Very good evening, ladies and gentlemen. Welcome to this Final Aid Chanting Style Rapid Revision by Conceptual Medicine, Day 2, where again we are going to cover 6 subjects in a unique manner in 6 hours to make sure that everyone is passing this exam on 17th of January 2026. May God bless you all, and before starting the session, I just want all of you to know that Please subscribe our YouTube channel Conceptual Medicine, and along with that, if you want PDF, please go to your Telegram. Search our 2 Telegram platforms. One is Dr. G. Bhanu Prakash, another is Conceptual Medicine. Both of them you will find the annotated, unannotated, and after the class you will find the annotated PDF. Before starting the class, I will pass, I will pass, I will pass. The first subject is going to be very interesting, and that is my favorite after ENT, and that is your FMT, forensic medicine. So let's start with the very first chapter, which is again added new in the course. So my dear friends, today also we'll be binding again around 12 o'clock. So be there with me. And to announce for tomorrow's class, that is day 3 class, we are going to start at 2 p.m. So we are going to start early because tomorrow major subjects like medicine, obs-gynae, surgery are going to take place along with the other subjects, important subjects. So tomorrow is again a big day. Maybe session can go to 6 to 7 hours, but we try to bind it our session within 6 hours to make sure that you know how to revise in the last days. So let's start with the class, my dear ladies and gentlemen. Chapter number 1, that is Indian legal system and the court procedure. So what is there? What has changed recently that we should also know, my dear friends? So this IPC is recently changed to the BNS. BNS stands for Bharatiya Nyaya Sanhita. This CRPC is now changed. So please keep on participating in this chat box so that we can learn during the class itself. Okay. Now CRPC is changed to BNSS. One is Bharatiya Nyaya Sanhita, another is Bharatiya Nagrik Suraksha Sanhita. Indian Evidence Act is now changed to BSA, that is Bharatiya Sakshya Act. So let's talk about them one by then, what we are going to talk about. So from 20 to 24, my dear friends, yes, I'm going to ask you questions also. So from 20 to 24, the criminal responsibility we have to talk about. First of all, 20 BNS is all about child less than, what 20? BNS says, it says less than 7 years of child is not responsible for any crime. Whether he or she is committing any crime, she is not responsible for that crime. Number 1. Second thing is 21 BNS says the child aged 7 to 12 years, the criminal responsibility depends on the mental maturity, and that will be decided by the court itself. That the responsibility will be decided by the court itself, my dear friends. So 20 is clear, 21 is clear. 20 say not responsible, 21 says yes, responsibility depends on the mental maturity. Who will decide? So your court will decide that. Coming on to the third one, my dear friends, that is 22. Now criminal responsibility of a mentally ill. There is no responsibility of a mentally ill person. That is defined by 24 BNS. 24, that is voluntary intoxication. If a person is drinking broad-minded medicos, colorful FMGs, is it buffering? Is it all right? Is it all right? Is it all right? Please give me feedback if it is coming fine. Okay. It's fine, completely fine. My dear friends, buffering, okay, it is fine, very nice. Girad, Vacha, Megha, Anirudh, Rahul, Palan Boy, Hani Mehta, Sagar, Anoop, very nice, everyone very nice, perfect. Sir, now involuntary intoxication is done, McNaughton's rule is done, child less than 7 is done, it is 20, 21, 22, 23, 24. Again, I want to repeat for all of you, less than 7 years, not responsible, 20. 7 to 12 depends on the mental maturity decided by the court, 21. Criminal responsibility, insane person is not there, sane is there, McNaughton's rule, that is 22. Then 23 is involuntary intoxication, not responsible for the crime. Then 24, voluntary intoxication, and yes, he or she is responsible for the crime. Done, sir? Chali. Now coming on to the next one, 25 to 30 BNS. That this segment is going to talk about the consent part, sir. The segment is going to talk about the consent part. So let's talk about the consent part. So number one is 25 BNS. Sir, welcome back, ladies and gentlemen. There was a small technical error and we sorted it very well. Our team is working so well. Now we are coming back to the 25 to 30 BNS. What it is saying, sir, this BNS saying, number one is Act 25 Act says, act not intended to know and not known to likely cause a grievous hurt or a death done by a consent. For example, a person was lying on seeking for a medical support and I helped him or her to a hospital, and meanwhile while taking her or him to a hospital, there has something happened which was unfortunate. So my intention was not to hurt that person or not to kill that person, but that happened in a good faith only. That is coming under 25 BNS, my dear friends. And I had a consent कि मैं आपको hospital ले जाऊँ, आपको तकलीफ हो रही हो तो, परेशान हो आप तो, then I took, then something happened which was not in my hand. Okay, then that is for the normal people. Now coming to the 26, sir. Act done intended not to cause a death. For example, best example for this 26 is for the doctors. Doctors are doing surgery. During surgery, any complication happens. That is not intentional. That is unintentional. Plus, we had consent for the surgery. Third is sir, 27. Act done in a good faith of a person less than 12 years of age or a mentally ill by the consent of a guardian. लेस देन 12 ईयर्स का बच्चा हो या मेंटली इल बच्चा हो, उसके लिए अगर आपको कुछ करना है गुड फेथ में विद द कंसेंट ऑफ द गार्डियन, दैट विल कम अंडर 27. Now coming to the next one is 28. Consent under fear, misconception, less than 12 years, mentally unsound, intoxicated is not valid. 28 says any consent taken from the mentally ill person, intoxicated, less than 12 years, without guardian, that will be considered as not valid. That will be considered as not valid. Then coming to 29 BNS, consent for act which are offensive and not valid. For example, criminal abortion. Maybe you have taken the consent, but if it is criminal abortion, that consent is again not valid, my dear friends. So these all things are explained by 25, 26, 27, 28, 29. Now coming to the 30. Now coming to the 30, my dear, act done in good faith. Act done in good faith for a benefit of a person without consent in emergency. For example, I am a doctor and I have to perform a surgery. There is no relative of that patient. Yes, I can perform a surgery by stating that this was life-threatening emergency. And this is allowed to only certain professions, and we are kind enough that we are allotted that power, that in emergency, yes, without consent also, we all can intervene and we can operate, my dear friends. So this was all about the consent part, 25, 26, 27, 28 and 29 and 30, sir. Okay? Now, coming on to the next one, sir. Sexual offenses, important topic for your exam. Sexual offenses, if we talk about, sir. Sexual offenses. I think now it's coming very, very fine. I can also watch it simultaneously along with you. It's coming very fine. बहुत सही आ रहा अभी तो. Okay. बहुत ज़्यादा प्रियंका जी, बहुत ज़्यादा फिजियोथेरेपी में भी देखिए हमारे लेक्चर्स को. चलिए. Now sexual offense number 1 is 63. 63 will be doing, yes sir. It's a definition of rape. A minimum age for a consent for a sexual relationship is 18 years. Less than 18 years, whether there is a consent, whether there is a full agreement, तो कहते हैं बुलाती है मगर जाने का नहीं. तो less than 18 years, that will be considered as rape only. Okay. Now, without consent, तो always rape. With consent, more than 18, no rape. Less than 18, with consent, yes rape. So 18 is very crucial. Then coming, sir, 64. Then coming, sir, 64. Punishment of rape up to 10 years to the life imprisonment. That is a rape punishment. Now 65, sir, 65 BNS is a special cases in which if girl's age is between 12 to 16 years, there will be a 20 years to the life imprisonment. And sir, if the girl's age is less than 12 years, there will be 20 years to the death sentence. 20 years to the death sentence, my dear friends. Now 66, causing death or vegetative state of victim while committing a rape. While committing a rape, if a person dies, if a girl dies, then 20 years to death sentence will be there. सेक्स बाय हस्बैंड डूइंग सेपरेशन, बाय डिवोर्स हो रहा है, डिवोर्स होते होते भी हस्बैंड का जी नहीं भर रहा, वो अपना हक समझ के वहां पे बीवी के पास जाके जबरन रिश्ते बनाने की कोशिश कर रहा है, forcefully he is trying to make the relationship, then that is also considered as rape, coming under 67 BNS. Now coming sex by a person in authority. For example, if some policeman is there and female went for some work and he is again making pressure of a physical relationships, though these kind of things come under authority. 68 BNS. This is coming under 68 BNS, my dear friends. Then coming 69. Yes, sex by using deficit means. For example, false promises, marrying up to 10 years. अगर कोई लड़का किसी लड़की को झूठे सपने दिखा के कि बेबी बाबू सोना, मेरी शादी तो तुम ही से होना, तो जो शादी के बाद होना क्यों ना अब होना, तो अगर अब होना और बाद में शादी नहीं होना तो बाबू को पुलिस पकड़ के ले जाएगी और डंडे डंडे बजाएगी और लंबे समय तक जेल में रखेगी. तो माय डियर फ्रेंड्स, रिमेंबर 69 BNS up to 10 years of punishment will be there. Up to 10 years of punishment will be there. Now sir, if there is a gang rape, yes, and the female age is more than 8, is 20 years to the life, 20 years to life sentence. And if less than 18 years, life imprisonment to the death sentence will be there, sir. Death sentence will be there, sir. 71 BNS says Repeat offender, the person is repeat offender, then there will be life imprisonment to the death. Same. 72 says disclosure of identity of a rape victim. There is a law where we should not disclose the identity of the rape victim. We should not take name. We should not publicize the address, phone number, etc. If we are doing that, because doctor is having all these information along with the police walas. But we should, if we found it doing, we will be sent to prison up to the 2 years. Now 73, publishing any matter related to the court proceeding. Whatever court proceeding is going on, confidential documents are there. We are not allowed to leak them. If they are leaking them, again there is a punishment of 2 years, my dear friends. Sexual assault by a criminal force. Sexual assault by criminal force. You are using some weapons, etc. And then on the बंदूक रख के जो गलत काम कर रहे हो, then it will be 74 BNS. Then 75 is sexual harassment. Physical contact, request for sexual favor, showing pornography up to 3 years. Sexually color remark, anything on the body, etc. up to 1 year. किसी को भी comment बाजी नहीं करनी है. If you're doing if you're doing that, then that will be a problem. 76, removal of clothes of a woman forcefully, 3 to 7 years. You should not. Okay. 77 is voyeurism. What is voyeurism? To see someone doing private acts, and these private acts including bathing, changing clothes, or sitting without clothes. So this is called as voyeurism. If first time you are caught doing this, 1 to 3 years of punishment will be there. 1 to 3 years of punishment will be there. If second time you are found doing that, 3 to 7 years of punishment will be there. 3 to 7 years of punishment will be there for you, sir. Then stalking means to follow someone. If you are following and found for first time, up to 3 years. If second time you are found doing that, up to 5 years punishment will be there. Then 79 BNS, word, gesture on act intended to assault the modality of a female. कुछ भी बोल दिया, मोटी बोल दिया, रंग को लेके कमेंट कर दिया, बालों को लेके, हाइट को लेके, which is insulting the woman, and if she files a complaint against you, yes, you will be sent to jail to the 3 years. The law itself also says लड़कियों को कुछ नहीं बोलना है, कोई कमेंट नहीं करना है, कुछ परेशान नहीं करना है, वो आपको कर सकती हैं. Yes. ठीक है, तो you should not do that. Now coming on to the 80 to 87 BNS, offense related to the marriage, शादी से related offense है दोस्तों. 80 BNS से dowry death. If a death of a woman happening within 7 years of marriage, 7 years to the life imprisonment will be given to the husband, and if family members are also included, they will also be sent to the jail. Then sir, 85 BNS, woman subject to the cruelty by husband or in-laws. They are beating her, then up to 3 years of jail will be given to the husband and the relative itself. Now coming to the criminal abortion. Criminal abortion with mother's consent is 88 BNS. Any abortion happening after 21 weeks, that will be considered as criminal abortion, but only in the special cases it is allowed. That we will be talking very soon. 89 BNS, abortion without mother's consent. Mother का consent नहीं है, then also you are doing forcefully abortion. 89, death of a mother during abortion is 90 BNS. My dear friends, these are important questions, can be asked in your exam. 91, act done with the intent to prevent a child being born alive or cause death or die after the birth. 91, बच्चे को जिंदा पैदा होने से रोकने में अगर कोई भी दवाई का यूज किया जाता है, then it is what's it? 91. 92, causing death of a quick born child by hitting abdomen or something. 92. Welcome back, ladies and gentlemen. Again we are back. जहाँ फंसे वहाँ रुके, दोबारा से आए, फिर लेंगे, फिर अगर फंस गए दोबारा रुकेंगे, फिर आएंगे, पर परमानेंट नहीं रुकेंगे, पढ़ाई चलती रहेगी. कम, वेलकम 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 वेलकम. Now sir, let's talk about this affecting the life. So 100 is culpable homicide. Culpable homicide means I know this act can cause a death, but my intention was not to kill, just to show that person that I am hitting. So this can be dangerous. So be aware of me. So, but the person dies. That is your culpable homicide. Definition of murder: anyone person in dying. Punishment of murder coming under 103. Culpable homicide not amounting to murder. tried hitting with the car, person did not died, that is attempt to murder itself, 105. Then death due to negligence, medical negligence, 106, up to 5 years you can get a punishment. A medical negligence particularly will give you a punishment of 2 years, my dear friends. Now 107 and 107, abetment of suicide, attempt to suicide, attempt to murder, and attempt to culpable homicide. So these are for the, आवाज नहीं आ रही, कैसे नहीं आ रही? Thank you Rocky जी. Hurts and grievous hurts से related भी है. Definition of hurt, voluntary causing hurt, definition of grievous hurt, simple hurt, then causing hurt, grievous hurt, then voluntarily causing grievous hurt with a dangerous weapon, grievous hurt on provocation, someone provoked you or you are provoking someone, hurt by a poison is 123, and hurt by acid, vitriolage, is by 124. So some questions are previous year question which were asked, like I can tell you, dowry death related, criminal abortion related, homicide, rape. These are some important BNS you have to remember for your exam. Maybe not everything, but at least these are some important areas where you should focus on. Now criminal force and all, isko chhod do. Let's come on to this one, 227 to 246. Sir, 227, if we talk about 227, perjury definition, giving false evidence. If you are producing the false evidence, then it is 227. Fabricating false evidence, you are just making the wrong reports, that is 228. Punishment of perjury up to 7 years. Perjury means giving false evidence, and that is up to 7 years. Issuing false certificate comes under 234. Disappearance of the evidence of an offense, that comes under 238. Now, exhibitionism, to show the private part in a public, that comes under 296. Now, my dear friends, important BNS, like 2 BNS variously defined, including the definition of various types of offenses like bailable, cognizable, warrant cases, summon, etc. That is coming under 2 BNSS. Okay? Bharatiya Nagrik Suraksha Sanhita. Then 33 BNS, crime information to police. Whenever you are seeing some crime, you will inform the police, that is coming under 33. Okay? 51 include the medical examination of an arrested person. 52 includes the medical examination arrested accused of a rape, especially 52. And 63 to 71 comes for the summon, which we are covering, which is also called as subpoena, a document sent to a person for appearing in a court. And in this, the many questions were asked previously also. If 2 equal courts are there, then you will give preference to the first one received. If lower court and higher court is there, you will give preference to the higher court. If criminal case and civil case is there, you will give preference to the criminal case first. So these are the preferences in the summons. If the examiner is asking you, you will be easily able to mark those answers. Now 184 BNSS, medical examination of a rape victim. Now 194 police inquest and magistrate inquest. Police inquest is done by a minimum level of officer, that is your sub-inspector. Sub-inspector is a minimum level of officer which will be recruited. He will prepare a report called as subpoena. Magistrate inquest is done in special cases when there is any kind of custodial death, any kind of dowry death, or we have to do the exhumation. What is exhumation? Exhumation means digging of dead body. Digging of dead body, that is done in the bright daylight, and that too done in the presence of the magistrate, my dear friends. So this is all complete about the fresh topic. Now we are going to do the next topic, and that is traumatology. I hope you guys are clear enough. My voice and quality of image we are providing you is absolutely fine right now. If I can also see all these things are going fine as per now. All good? Now coming to the chapter number 2, that is traumatology. Traumatology, if you see, sir. Traumatology. Number 1 thing is abrasion. There is an epidermal layer, and epidermal layer is getting scratched away. This is called as abrasion. There will be later on scab formation, and this is happening because of a blunt force. Then next type of abrasion, if you talk about scratch abrasion. Now the type of abrasion, type of scratch is going to tell you the mode of injury. For example, if it is on the face, you will see the person had fight with someone. Okay, and it can be somewhere else also, है ना? Chalo, I'll not speak about that. Graze abrasion, these kind of abrasion you'll see once a person is hit with the accident, road traffic accident, or from falling from the bike. You have seen when the person is rolling. Even we people in early childhood, we have seen when we were riding the bicycle, we used to fall down, and when we used to fall down, there used to be a grazed abrasion. Ragad lag gayi, that is going to be a grazed abrasion. Now pressure abrasion. Pressure abrasion is a bite mark. You can very well see some dog has given, some love boy has given a dog mark to this pressure abrasion. You can easily see the tooth marks, and you can tell that this is a bite mark by a human, or if any other dog mark is there, anything. Ligature mark can be there. Ligature mark, if anyone is using the rope, etc., to strangulate, then the bite ligature mark will be there, and by looking at that you can tell whether this is homicide or suicide. Okay, and all those things we will be simultaneously talking about. The pattern abrasion, you can see the tire mark, object mark, that will also produce a graze, and that is also going to tell you about all these things. Now color of scab, if you have to remember, first of all it is raw color, then it converted into reddish brown, and in the end of 6 to 7 days you will find your scab will become black and epithelium grows under that, and simultaneously your scab falls down and a new skin appears. Okay, chali. Now coming on to the contusion. Contusion is now your epidermal layer is intact. Your epidermal layer is intact, but the blood is collected under the skin. That is called as extravasation. Or in other language we call that as ecchymosis. So this is a contusion or a bruise. You can see the images. Now what is ectopic bruise? There is an injury somewhere and bruise you are seeing somewhere. This is a favorite area of question of examiner. So ectopic or migratory bruise, if you see the bruise away from the site of impact. So my dear friends, here if there is an anterior cranial fossa fracture, there will be a raccoon eye or panda eye. There will be a raccoon eye or panda eye. Raccoon eye or panda eye. You will see ecchymosis happen in the periorbital area. If there is a middle cranial fossa fracture, this will be a Battle sign. This will be Battle sign. Plus, here you will see CSF otoria. Here you will see CSF rhinoria. CSF will be coming outside from the nose, and in this case, middle cranial fossa fracture, the CSF will be coming out from the ear, my dear friends. Coming on to the next one, sir. Fractures. We talk about the fractures, skull-based fractures, skull fractures. So on the basis of line, we have divided them into different categories. Sir, if the line is running along the sutures, these are the normal sutures we are having, natural suture. Now this is fracture line which is running along with that. And this is seen in young adult most commonly. This is called a sutural or diastatic fracture. If a small baby is there, and you know small baby's head is very soft. So if we will hold, for example, if the baby is born and we are holding with the forceps, it can get a dip, and this dip is called as ping pong or Pond's fracture. Ping pong or Pond's fracture, my dear friends. Now let's talk about the next one is forensic ballistics, my dear friends. Forensic ballistics, if we talk about the range of the guns, very important range of the gun. Number one, if you see the shotgun, my dear friends, is the 50 to 60 yard. Shotgun, it will be what, sir, here? 50 to 60 yards. Revolver is 200 yard, pistol is 400, military rifle is 2000 yards. 2000 yards. The shotgun is having very short range, 50 to 60. Yet the revolver is coming with 200, pistol is coming with 400, military rifle coming with approximately 2000 yards. Now gunpowder is there. Type of gunpowder. There is a black gunpowder which produces the smoke, and there is a smoke-less gunpowder which is categorized into single base, double base, and triple base. Now smoke producing is potassium nitrate, charcoal, and sulfur. Again, potassium nitrate, charcoal and sulfur, they are the smoke producing gunpowders, which are also called as black gunpowder. And smokeless are single base, double base, triple base. What is having single base? Only and only nitrocellulose. Only and only what we are having, sir, right here, nitrocellulose. Double base we are having nitrocellulose and nitroglycerin. In triple base, along with these two, we are having nitroguanidine. Now I'll ask you question, sir, nitrocellulose is a part of smoke producing or smokeless? Nitrocellulose is smoke producing or smokeless gunpowder? Smoke producing or smokeless gunpowder? Your answer should be there in the chat box. Your answer should be there in the chat box. Nitrocellulose, smokeless gunpowder. Very good. Nitrocellulose is a smokeless gunpowder. Smokeless. What about the charcoal? Charcoal and potassium nitrate. My next question. Charcoal and potassium nitrate. 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 Very nice. They are smoke producing gun. Now let's talk about the range of a shotgun. First of all, we talk about the contact shot tightly onto the skin. And here the wound will see the margin, and margins are stellate wound with the cruciate margin. Star shape wound you are seeing, sir. Star shape wound will be there, sir. Now close shot less than 1 meter. So there will be a smoke. There will be a fire. So burning, blackening and tattooing is observed in the close shot. तो contact shot 0 meter से ली जाती है, close shot less than 1 meter से ली जाती है, sir. Very nice, sir. Near shot 1 to 2 meter. Now fire is absent but smoke is still there. So single hole with the irregular margins plus some tattooing you will be seeing. Near shot. The first shot is contact, close, near. Now more than 2 meters what you are going to see intermediate, sorry, 2 to 4 meters you will see intermediate, where the dispersion of the bullet just started like this. If this is a bullet, the pellets will start dispersing like this. Pellets will start dispersing like this. So there will be a single hole where main bullet is going, and along with that small pellets are going to cover the surrounding area, as you can see in this image also. This is where the dispersion starts. Central rat hole you will see. Distant shot, that is more than 4 meter. Distant shot more than Chalo, let's talk about the entry and the exit wound. My dear friends, whenever there is a gunshot, you will see the entry wounds are small and the exit wounds are large. Totally opposite to the stab wound. If the knife is there, the entry wound will be large and exit wound will be small. So gunshot wound is opposite to the stab injury. Done, sir? Chalo, let's talk about the type of bullets itself right now in this. Type of bullets, if we talk about, first is tandem or piggy bank bullet. One after one, another bullet is coming. One bullet going, then another one, another, like a piggy bank. You are putting the coins one after the another coin. That is what tandem or piggy bank bullet is called as. One follows the other. Tracer bullet. The smoke producing bullet is going on. It is producing some kind of smoke and charcoal. You can easily able to trace from where the bullet was shooted till the target, and this is called as tracer bullet. This is called as what's a tracer bullet. Then coming dum-dum bullet. Dum-dum bullet is causing the maximum damage. After going inside, it will open like this. The open mouth bullet, this is called as dum-dum bullet, my dear friends. Frangible bullet, once it hits the target, it will be divided into, or you say broken into small fragments. That is why this is called as frangible bullet. That is why this is called as what, sir? Frangible bullet. Then ricochet bullet, from intermediate source like a air or something, it will go to another side. This is called as ricochet or deflected bullet. Then coming incidentary bullet. Incidentary is sounding like an incident. So incident happen when the bullet is hitting the target, it is getting exploded, boom, it is getting exploded, boom. So this is incendiary bullet. Now tumbling bullet, sir, the bullet is rotating and then hitting the target, tish. So this is called as what, sir? Your tumbling bullet. Then yawning bullet is going like this, then doing the work. So this is called as what, sir? Yawning bullet. Then the bullet which is having hole in the down part. When the bullet is having hole in the down part, the velocity of the bullet increases. Less the weight, more the speed is something express bullets. Souvenir bullet, the bullet remains inside the body. How we will identify it? We will identify once there is a fibrosis around the bullet, that is called as souvenirs bullet. That is called as souvenirs bullet. To study about the entry and the exit wound, that phenomena is called as Kennedy phenomena. That phenomena is called as Kennedy phenomena. And one fracture line touching another fracture line, to study the pattern of which bullet hit it first, second, that phenomena is called as Puppy's rule. That is called as Puppy's rule. So my first question for all of you, max velocity bullet is, which is a max velocity bullet, what that is called as? Yes, all my dear broad-minded medicos, colorful FMGs, the maximum velocity bullet is, can you please answer my question? Yes, number one, Harshiki kata, that is your velocity, express bullet. Then maximum damage is caused by, my second question for all my dear friends, my second question is maximum damage is caused by, very good, Techie, Sunny, Medico, very nice, Vacha, that is your dum bullet. Sir, the bullet is moving into the rotating fashion and then hitting the target. It is moving in the rotating fashion and then hitting the target. This is called as rotating in this fashion and then hitting the target, called as, this is called as tumbling bullet, and moving into this fashion and then hitting the target is called as, yawning bullet. Very nice answer by all of you, sir. Now car injury has happened. What kind of injuries you can get? For example, first your this head will go in the extension, the neck will go in the extension, there will be a whiplash injury, then the glass which is present, it will break down and come on your face, that is called as sparrow feet mark. Then your steering will hit your chest and there will be aortic tear. Then seat belt is going to wear, that is going to tear your mesentery. So these are the different type of car injuries, a previous year topic which has been asked in the exam. Now blast injury, the primary blast has happened. Now there is the air compression. What is happening in the blast? Number one thing is air compression. Because of the air compression, the number one organ which is going is your tympanic membrane, then lungs. Then because of that compression, what will happen? There will be an object coming and those objects are hitting our body and there will be a pattern, abrasion, contusion, laceration depending on the objects. So this triad is called as Marshall's triad that you are going to see in the secondary blast. In the primary was completely air compression coming, and secondary is along with the air compression, there are the objects also coming which are hitting us. Tertiary is, third degree is when you are falling down onto the ground and getting a pedestrian injury. Then fourth degree is also there when complete building is getting collapsed onto you. So these are the different type of blast injuries you will encounter with, my dear friends. Now electrical injuries, which current is more dangerous? So your answer will be AC is more dangerous than DC, and it can cause cardiac arrhythmias, respiratory failure, myoglobinemia. Now what type of burns we are having? Joule burn. This is due to the slow voltage which is endogenous world. Crocodile world, why we call this crocodile? Because there will be a crocodile like skin. There will be what, sir? Crocodile like skin. This is because of high voltage. Then filigree pattern like this, you can see I will draw it for you. This filigree pattern is because of the lightning. When lightning is coming from the sky, it is hitting us, then there will be a filigree type of pattern, like this is called as filigree one. Now let's talk about the different type of torture methods, my dear friends. Different type of torture method, my dear friends. First of all, we talk about the telephono. Telephono is beating the ear. Telephone करते हैं हम कान से, तो beating the ear is called as telephono. फलंगा या बस्तीनादो, तो कोई लफंगा आपकी बेइज्जती करा दे तो बेइज्जती वाले को खड़ा रखना है, that is beating the soul. No sir, इसको मारना, इसके पैरों पे मारना. Beating the soul is called as bastinado. You are putting a plastic on the face and covering it, not giving air. That is called as dry submarine. You are putting someone's head inside the water and not letting that person breathe. That is called as wet submarine. You are hanging some person on a rod or pole like this. The rod or pole like this. This is called as parrot's breach. And if you're making the person sit on a triangular surface, one leg that side, one leg this side, this is called as sawhorse. This is called as sawhorse. Black slave. Sir, insertion of hot, garam rod ली और माहौल बना दिया. प्लांटॉन, खड़ा रखना है, बैठने ही नहीं देना. दैट इज कॉल्ड एज प्लांटॉन. और अगर किसी के ऊपर तूने लकड़ी के साथ में ऐसे अत्याचार करा, दिस इज कॉल्ड एज घोटना. दिस इज कॉल्ड एज घोटना. नाउ सम क्वेश्चंस फॉर ऑल ऑफ यू, माय सम क्वेश्चंस फॉर ऑल ऑफ यू, माय डियर फ्रेंड्स. नंबर 1 इज मेकिंग पर्सन हैंग ऑन अ पोल. Don't say pole dance. Making person hang on a pole is person hang on a pole is parrot's breach. Making person sit on triangular surface is sawhorse. Very good. Beating soul is Palanga or bastinado. Completely happy with your answers. May God bless you all and everyone. The news is everyone is going to pass on 17th of January 2026. May God bless you all. You all are going to pass this exam. Now, thanatology is a study of death. Now, how the different changes you are going to see, how the person can die, all those things we are going to talk in this chapter, my dear friends. Now, the study of death is called as thanatology. Definition was given by Declaration of Sydney. What type of death we are having? Somatic death, where your heart, lung plus brain stop working. And when your heart, lung and brain stop working, after certain time, your cell will start dying. After certain time, your cell will start dying, my dear friends. And meanwhile, our link is there. You can follow our Telegram channel. Yes. Somatic death, there will be a bishop tripod where heart, lung and brain stop working. After somatic death, what will happen? Cell will start dying, and this time period is called as supravital period. That is a time gap between the cellular death and the cessation of the vital organ. Cessation of the vital organ से लेके cell की death तक के बीच का जो time है, that is called as supravital period. That is called as supravital period. Now, what are the postmortem changes? After the death, the length of the person increases. Why? Because if you see our vertebra, it is curved like this. After the death, it will become flat, and because of flattening of the vertebra, you will see there is an increase in size of 2 to 3 centimeters, my dear friends. Now, in the eye, you will see the Kevorkian sign or railroad phenomena. Because of the retinal vessel segmentation, you are going to see this Kevorkian sign in the eye. This is Kevorkian sign. Then you are going to see the trachenoid. You can see the blood collected right here in the eye is a trachenoid that you are going to see after the death. So, lengthening you are going to see, eyes ke andar you are going to see the this trachenoid and also your Kevorkian sign. Now, what is algor martis? Algor martis is like a algae. Algae makes fridge increases the temperature. So remember, there will be a increase in temperature, that is called as algor mortis. So body after the death, will start cooling down, will start cooling up. Now this is not decrease in temperature, my dear friend, not increase in temperature, sorry, this is decrease in temperature. The algar mortis is like a fridge. What fridge does? It cools the body. So after the death, except certain cases where initial there is an increase in temperature, then decrease in temperature, but in the normal death there is certainly decrease in the temperature, and in summer it is 0.5 degree Celsius per hour rate से it will decrease. In the winter it will be slight more. How much more? It is 0.7 degrees Celsius per hour, 0.77 degree per hour. Then postmortem caloricity. These are some exceptions where initially the temperature increases and later on the temperature decreases. Later on the temperature decreases. So my dear friends, body remain warm for first 40. They are like heat stroke, pontine hemorrhage because of the bacterial activity. There will be a septicemia also responsible for initial increase in the temperature. Then there will be decrease in the temperature. Now what is livor mortis? That is staining, post-mortem staining of the dependent areas, and this post-mortem staining is only present where gravitational effect is there. That means if person is dying inside the water, the post-mortem staining is absent. Why this staining is present normally in after the death in the presence of gravity? Because of the deoxygenated blood which is collected in the dependent area, my dear friends. Now we will talk about the embalming or theratopraxia. This is an artificial method of preserving the body. The artificial method of preserving the body is called as embalming, or in this we inject some artificial fluids like phenol, etc. and time it should be done within less than 6 hours. Coming on to the next chapter is post-mortem technique. What are the different post-mortem technique? First of all, the types of autopsies we have to talk about. Number one type of autopsy is medico-legal autopsy, sir. The number one type of autopsy is going to be, sir, what, sir? Medico-legal autopsy, done in case of unnatural death, most common type in India. No need of consent from relative and can be done on the requisition of the investigating officer. Now clinical or pathological, again done in unnatural death, relative consent is mandatory. Like some person has died in the hospital and you need and we know the diagnosis, etc., and because of that person died, we know the cause of death, but to prove that we need a postmortem report so that we can claim that insurance, etc. For that, relative consent is mandatory. Virtual autopsy, whole body imaging is done. Obscure autopsy, where gross findings are minimal and we have to go for the micro examination like histopath examination, microbiological and chemical examination, where the gross findings are minimum. Now coming on to the negative autopsy, when the autopsy fails to tell you the cause of death. Now which cavity need to be opened first? In what situation? In case of poisoning, you are opening the cranial cavity, and after getting the smell, you will come to know which poison was there. Second is newborn, we open the abdominal cavity. Air embolism is there, we open the ventricle. Asphyxia is there, we first open the cranial cavity, then we open the thorax. In the last, we open the neck. Why neck in the last? Because of the bloodless dissection we want. That is why neck in the last will open, sir. Now coming to the incision, there are different n number of incision. For the exam point of view, you should remember the most common of incision is I-shaped incision, which is chin to the pubic symphysis. In the newborn, we produce a inverted Y-shaped incision. The two incision at least you should know before going to the exam, sir. Coming on to the next one, sir, human identification. My dear friends, cephalic index is something which was asked the exam multiple time. How to calculate what is the significance? Base breadth of skull upon length of skull into 100, and that approximately come the range between 70 to 75, 75 to 80, 80 to 85. Now this 70 to 75 is dolichocephalic, mesencephalic and brachycephalic. Like this range we have divided: 70 to 75, 75 to 80, 80 to 85, dolichocephalic, mesencephalic and brachycephalic. Now if dolki is like a dark, and dark people are in Nigeria, so like Negroes, you will see in the Negroes, not Negro, Negroes. Mesencephalic, India वाले China जाके मस्ती करते हैं, Indian and Chinese. Brachycephalic, सब चीजें गोल गोल, that is your Mongol, Mongol. Sex determination. If female is there, you will see Davidson body, drumstick body, bar body on the blood chromosome testing. If you read on that, you will find this Davidson, drumstick and bar body. In the blood sample also you will see that. मेल एंड फीमेल डिफरेंशियल बेस्ट इज पेल्विस. पेल्विस मेल का जो है बड़ा होता है, फीमेल का थोड़ा छोटा होता है. ओनली द ग्रेटर sciatic notch which is best parameter which is smaller in the male but larger in the female. Done and dusted. Age estimated, rule of Hasse. What is rule of Hasse? In the first 5 months, you will see age is 1 centimeter, 2 months with 2, 4, 3 3s are 9, 4 4 the 16, 5 5s are 25. This is height according to the month. Then sir, in the next 5 months and when the bacha is born, you will see this is addition of 5 5 5 we are doing right here. First initially it is 2 2s are 4, then 3 3s are 9, 4 4 the 16, 5 5s are 25. Here it is happening like this, plus 5 plus 5 plus 5, and when the baby is born, the final height is 50 centimeter. The final normally height is 50 centimeter, my dear friends. Ossification centers. What is ossification center? When the cartilages is changed into the bone. Clavicle, it changed into the bone in the intrauterine life of 5 to 6 weeks. Sternum and talus 7 weeks. Leg was asked in the exam. The upper part of the femur and upper end of the tibia during the delivery time. The lower part of femur and upper end of tibia, they are getting ossified at the time of delivery, or you can say just before the time of delivery. Bone fusion. When two bones are fused together to form a single bone, that is patella in 14 years, xiphoid 40 years. Skull base. Let's talk about the suture, important suture. First suture to get fused is metopic suture at the age of 1 year. Last suture is masseto-occipital at the age of 80 years, and the best suture is sagittal suture, that is between 25 to 50 years, between 25 to 50 years. Identification method of a person. Poroscopy. To study the skin pore, we call that as poroscopy. It was given by Lockhart. Poroscopy. Cilioscopy is a lip print which was given by Suzuki. Palatography is the study of hard palate, anterior 1/3, which is a hard palate if you put a finger, that was given by Allen. Anthropometry Bartolian system to identify missing person, giving all the detail about the face, complexion, length, width, etc. These measurements are taken care in that. Dactylography is a fingerprint which was best. It was given by William Herschel. Now what are the different type of fingerprints which is the most common, and in which condition you will lose the fingerprints? Now there is a Quetelet rule which says that identical twin even do not have. They have everything same, but their fingerprints are different. Their fingerprints are different. Next is classification by Henry. So there was a loop, whirl and arch. Most common is what's a loop. Most common is what's a loop, and least common will be arch. One more is the composite is also there, which is also more least common. Now permanent loss of fingerprint is seen in, this is again your previous year question, my dear friend. Leprosy, radiation charring. या तो जल जाए या leprosy या तो radiation exposure की वजह से permanent loss of fingerprint is seen in a person, and this is asked in the exam. Coming on to the next one, sir. Asphyxial death, my dear friend. Asphyxial death. Asphyxial death. Now my question number 1 for all of you. Studying the lip print is called as. Studying the lip print is called as. Very good, techie. This is your cilioscopy. Cilioscopy. Study of pores of finger is called as. Study of pores of finger is called as. Pores of finger is called as. Pore of finger is called as. Is called as poroscopy. Very good. Are we ready to start the next chapter, that is asphyxial death, my dear friends? The next chapter what we are going to start is asphyxial death. Asphyxial death. Asphyxial death, my dear friends. Now what is asphyxia? The person cannot breathe. When asphyxia is the cause of death, you will see the cyanosis, petechiae and congestion. And on the eyes you are going to see the tardive spot, that is a petechial hemorrhage in the conjunctiva. That is a petechial hemorrhage in the conjunctiva. Can you tell me After normal death, if eyes are kept open, which sign you are going to see? The triangular sign I am talking about. Which sign you are going to see in the eyes? Which sign you are going to see in the eye? Can you tell the name in the chat box itself, my dear friends? Which sign you are going to see in the eye? Trachea noir is a correct answer. One retinal vessel segmentation is also there. That sign is called as Kevorkian sign, my dear friends. Very good answers by everyone. Very good. Good performance. Now let's talk about the asphyxial death. Tardio spots are there. Petechial hemorrhage in the eye because of neck compression, and most common site is conjunctiva. Now there are some weight because of which certain structures are getting compressed. If 2 kg weight is there, enough to compress your jugular vein. 5 kg weight is enough to compress your carotid artery, and trachea is enough to compress your 15 kg weight is enough to compress your trachea, and 30 kg is enough to compress your vertebra. So these are certain weight which are responsible. Now type of suffocation, if we talk about smothering. What is smothering? Closing of the oro and the nasopharynx, closing of the mouth and the nose. You can very well see the hard-working lady is closing the face where mouth and nose both are closed of a person, and the person is dying because of suffocation. This is called as smothering. Next is gagging, where you can see this hard-working lady is putting a gag inside the mouth, oropharynx, and this is called as gagging. It can be a pleasure also. Choking की बात करेंगे, obstruction of airway by a foreign body. Here we can choose a Helminth maneuver. Traumatic asphyxia. Now you can imagine some very heavy person is sitting onto a chest of a person, and because of the mechanical compression of the chest, that person is dying. This is called as traumatic asphyxia. Yes, this can also happen during the this dash activities, when a lean thin male is lying down like this, and very heavy female is sitting on the chest of that lean man and compressing the chest of the man, and man can die. So be careful. Burking, it is a mixture of smothering and traumatic asphyxia. Why? Because nasopharynx or oropharynx are closed. Along with that, there is a mechanical fixation of the chest. This is called as burking. Then coming to the positional asphyxia, you can see jackknife position, where your chest is compressed, and this kind of position in the surgeries these days are banned, my dear friends. Now coming on to the next chapter, type of hanging. The most common method used in suicide is hanging than the poison. Why? Because in poison it takes more time for the death. In hanging it takes less time. Now based on the knot, the hanging is of typical and atypical. If the knot is placed on the occiput right here in the back, this is called as typical hanging. If knot is placed anywhere, this is called as atypical hanging. Chalo. Based on the suspension, sir, a complete hanging and a partial hanging. Complete hanging means the foot are not touching the ground, and if foot are touching the ground and person is dying because of the weight of the head, which is 10 to 15 kg, and that is called as partial hanging. What finding you are going to see in the person who is dying because of the hanging? So in the eye you are going to see the tardieu spot, protrusion of the tongue, semen discharge, dribbling of saliva, hide bone is getting fracture. There will be a bleeding in the anterior surface of the vertebra, which is also called as Simon's bleed. So these all are finding you are going to see in case of a person dying because of the hanging or asphyxia, strangulation. Done. Now coming on to the manner of hanging. Suicidal, most common painless, that I already told you. Accidental, sexual asphyxia. What do you mean by this? Some people do not feel pleasure in the normal sexual activities. For that reason, they try to do some more stunt. So they try to buy some rope or something like that. During the sexual activities, they try to strangulate the neck, and during they are getting the pleasure. Both of them are getting the pleasure, and in pleasure, over pleasure happen, and suddenly the female dies, or the male is getting pleasure more, then male will die. Anyone who is strangulated will die. This is called as accidental hanging or sexual asphyxia. Then homicidal hanging. Fatal injuries are present. Now if you are hanging someone forcefully, that person will try to save himself or herself. So there will be the injuries. Sign of struggle you are going to see. Judicial hanging practice in India. Which type of fracture you will see? Hangman fracture seen at vertebra C2. Seen at vertebra C2, C2, C2. Then coming to the type of strangulation, my dear friends. Type of strangulation, my dear friend. With the elbow, if you are strangulating someone with the help of elbow, this is called as mugging. With the help of metallic collar, which is regularly practiced in the Spain for giving the death, that is called as garroting. With the hand you are doing, this is called as throttling. With the stick you are doing, this is called as bans dola. This is called as bans dola, bans dola. Now what is wet drowning and dry drowning? My dear friends, wet drowning is further divided into two, fresh water and the sea water. So in the fresh water, what will happen? Your potassium is going to increase. Moment the potassium is going to increase, there will be ventricular fibrillation. This will be the cause of death. But in the sea water, what will happen? The sodium concentration is going to increase. When the sodium concentration is going to increase, there will be a bradycardia. So sea water, the cause of death is bradycardia. In case of fresh water, the cause of death is ventricular fibrillation, or you can tell the arrhythmia is a cause of death. Arrhythmia is a cause of death, sir. Now dry drowning, what is happening? The person is going inside the water and there is a laryngospasm. No air, no water, nothing going inside. This is called as dry drowning. Near drowning, the person saved. The person was in the water. Someone just do the swimming, put him outside, but the person died after 24 hours or 2 days or 3 days. Why? First reason is electrolyte imbalance, and second is infection inside. Septic shock the person can go into and the person can die. This is called as near drowning. So wet drowning, two types, fresh water and sea water. Then dry drowning is there. Then near drowning is there, where the patient was saved but died later because of the electrolyte imbalance and also because of the infection, because of the infection. Done, sir? Hydrocution or Immerslin syndrome, where the extreme cold water is touching the epigastrium. If the extreme cold water is touching the epigastrium, in the epigastrium there is a diaphragm, and diaphragm there is a vagal nerve. So there will be a vasovagal shock. There will be a vasovagal shock, my dear friends. Now, post-mortem changing in the drowning, you will see if the death is happening inside the water, lung will be inflated, that is called as aqueous emphysema aqueous, water inside the lung. Mouth and nose, there will be a froth coming outside. Trachea, mud particle will be there. Now the important thing is diatoms. What are these diatoms, my dear friends? Diatoms. Let's talk about diatoms. Diatoms are the unicellular algae, and it is seen in ante-mortem death, not post-mortem death. Why in ante-mortem? Because blood supply was working and these diatoms through the GIT got absorbed and they came into the circulation. From circulation they settled into the long bones. That is why. But if the death has already occurred and the dead body you have sent inside the water, there is no circulation going on, no absorbing of these diatoms from the GIT, no settlement in the long bones. तो long bone के अंदर diatom पाए जाते हैं, मतलब anti-mortem drowning. That means person was alive before dying inside the water. That also you can rule it out. Now, washerwoman syndrome and floating. The floating inside the water in the winter season happens little delayed because reactions are slow in winter and reactions are faster in the summertime. That is why in the summertime it only take 24 hours and winter time it take 1 to 2 years. 1 to 2 years. Okay? Done. Chalo. Clear funda. Coming to the sexual offenses. Sir, what is natural sexual offense? Peno-vaginal penetration. Rape. What is rape? Against will, without consent. Consent was there but age is less than 18 years. But consent was there, victim was intoxicated, insane. In all those conditions we consider as rape. Statutory rape. Any age less than 18 years with or without consent is rape. Now sir, crime scene. Examination. Disclosing the identity of a rape victim is also crime. Up to 2 years you can get a punishment. Then coming the crime scene, seminal scene. Important question coming up for all of you for the exam. Now sir, sperm is 10%, semen is 90%. Here, what are the tests for the sperm and what are the tests for the semen? For the testing of the sperm, we are having barbaridiosis, fluorescence and Christmas. How we will remember it? Barbie gayi Florida Christmas manane, and the Christmas is coming. Merry Christmas to all of you. Merry Christmas to all of my dear friends. Barbaridiosis test, fluorescence test and Christmas tree stream. एंड सीमेन टेस्ट के लिए वी आर हैविंग लैक्टेट डिहाइड्रोजनेस, लैक्टेट डी, तो स्पर्म के लिए बारबी गई फ्लोरिडा टू सेलिब्रेट द क्रिसमस, दीज आर द टेस्ट, लैक्टेट डिहाइड्रोजनेस इज फॉर द सीमेन. Now blood staining screening test is like benzathine mixed with peroxidase, phenolphthalein mixed with peroxidase, and orthotolidine mixed with peroxidase. Sir, this benzathine, if it is mixed, blue color will come. This is most sensitive. Sir, phenolphthalein with peroxidase, P color, P. Custer-Meyer test. Orthotolidine with peroxidase will give you blue-green color. That will tell there is a blood sample present. A confirmatory test, spectroscopy is better answer than Tickman and Takayama. One image-based question is there where you will see the rhomboid crystals right there. In the Takayama, you will see the blood stain crystals like this. In this Tickman, you will see the rhomboid crystals like here, sir. Rhomboid crystals like here, sir. And for the species identification, whether this blood is of a human or something else, the precipitation test is the best test and was asked in your exam. Now let's talk about the adultery. One male having sex with wife of another male or a girlfriend of another male is completely legal because they too are adult and they are doing these kind of activities on own wish. No one has forced them to do that. They are doing that. That husband can take a divorce but cannot say anything to wife. Unnatural sexual offenses. Number one is sodomy, love or buggery. When a male having sex with another male or a male having sex with female but anal intercourse is there, that is called as sodomy, love or buggery. ठीक है, चलो. Now lesbianism or tribadism, a female having sex with another female. Active female is what, sir? Bitch or dyke, not bitch, it is butch or dyke. And passive female who is just lying down enjoying the show, that is she is being called as femme. Now buccal coitus, if a male is giving to a female, if oral stimulus of a vagina by a male, that is called as cunnilingus, that is a kind of cunnilingus. And if female is giving to a male, that is called as fellatio, facilitation is happening of a male. And if kindness is served to a female, that is called as cunnilingus. So fellatio and cunnilingus clear. Bestiality is a sex with animals. Now what are the sexual perversions which we are having? Not exactly sex is happening in all the stages, but we are getting pleasure by doing the other activities. Giving pain to a person enjoying giving pain to another person, that is called as sadistic person. And if a person enjoys suffering the pain, maro mujhe, hit me baby harder, and that is called as masochism. This is called as masochism. Rubbing the private part of a female is called as frotteurism, and person enjoy with the object related to the female, maybe their clothes, maybe their sandals, etc. That is called as fetish. They are having fetish for that particular product. Transvestism or eonism, person enjoy wearing opposite sex clothes. उनको अपना नहीं, घाघरा चोली पहन के ज्यादा मजा आता है. This is called as transvestism. Now exhibition, flash, एकदम से निकाल के खड़े हो गए, flashing. ग्लूटियल रीजन दिखा दिए तो चांद दिखा दिया, मूनिंग. और अगर भागने लगे नंगू पंगू, तो दैट इज कॉल्ड एज स्ट्रीकिंग. डन. वॉयरिज्म वी ऑलरेडी टॉक अबाउट, पीपिंग टॉन्ग टू वॉच समवन हैविंग द प्राइवेट एक्ट. नेक्रोफिलिया, having a person enjoy having sex with dead body. Necrophagia, person enjoy eating dead body. Coprophilia, person enjoy watching having the smell of feces. And urophilia, person enjoy while seeing the smell of the urine. Wow. Masturbation, person enjoys shaking his own penis, है ना. And Bobbitt syndrome, where male genitalia is amputated by a female. Scatologia is a mobile sex. When we are in a long distance relationship, there it works very fine, but it is illegal. Okay, now I'll ask some questions and then we move on to the chapter number 8, my dear friends. My first question is male giving stimulus to the female is called as, male giving stimulus to the female is called as, male giving stimulus to the female is called as, please answer in the chat box. Male giving stimulus to the female is called as, No answer coming. It is cunnilingus. It is cunnilingus. Very good. Very good. Very good. Mobile sex. Next question. Perversion about the mobile sex is. Perversion about the mobile sexes. Next question. Next question. Scatology. Very, very nice. A person enjoying wearing the objects of the opposite gender. A person enjoying wearing the objects of the opposite gender. Opposite gender. Opposite gender. Opposite gender. Transvestism or eonism. Transvestism or eonism. Perfectly, 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 perfect. Now this medical jurisprudence is again a short chapter we have to talk about. In this schedule 1 is for IMG, FMG, let it be. Now violation of medical ethic is punishable according to the State Medical Council. If simple cases are there, only warning is given. Small cases has happened, small complaint has happened, only warning is given. But severe cases there can be an erasure of the name from the medical register, and that can be permanent and that can be temporary. If permanent has happened, this will go to the NMC or Medical Council of India, which is no more existing. So it will go to the NMC. From NMC it will go to the Health Ministry. Now let's talk about the agreement and permission. Now which is the best consent? Sir, best consent is expressed orally and then taken in written. First you will inform that person this, then you will take everything in written. That is the best consent. Written and informed consent is the best kind of implied consent. Consent given by a mean of gesture. For example, a female patient is visiting a male gynecologist where the per-vaginal examination is mandatory and she knows why she is going and she has to do that. That is a gesture consent. Blanket or open consent, which is a banned in India these days. Earlier this consent was there, in which all procedures were covered. Then human organ trafficking has happened, and because of that the government of India has stopped that, sir. Best consent. Consent is not needed in emergency, that is a life-threatening condition. Second is unexpected emergency during the surgery. Who can give consent? Minimum age is 12 years. Above 12, less than 12 years you need a guardian, and more than 12 years you do not need a guardian. But if it is a major surgery or major decision, then 18 years of age is mandatory. Age is mandatory. Done, sir. Then coming to the medical negligence. Civil negligence, simple mistake result in damage, for example wrong prescription, then you can just pay the money for the compensation. Then coming on to the criminal negligence, gross, like doing the surgery on the wrong patient. This is called as res ispa liquidator, where the problem was in the right foot, you have operated the left foot. The right foot will again be approving himself. That is called as res ispa liquidator. Here the imprisonment plus minus fine will be there. Contributory negligence, doctor and patient both are responsible. You have to write something and inform patient and then recheck. You have informed but didn't give in written and the patient didn't follow, that result in the damage. This is called as contributory negligence, and now the claim depends on how much contribution doctor has. Okay. Vicarious liability. What is vicarious liability? Superior is respondent. In this case, superior, whosoever is superior to you will be responsible for the crime. Let's suppose you are a junior doctor in a hospital and you are doing a surgery under your consultant. If something happens, the consultant will be held responsible. This is called as vicarious liability. Vicarious liability. Now my defense chapter 9 is all about the impotency, abortion and virginity. Now what is this impotency? Inability of a person to achieve or maintain the virile erection is called as impotency. Most common cause is psychological and second most common is vascular. In case of a male, agar male pareshan hoga, so there will be chances that male will get a impotency. For example, exam is coming and before the exam we have lot of stress. Because of stress we will not be able to focus on all those things. Second is vascular cause. Other things which are terms which you need to remember for your exam. Quad is impotency toward a particular woman. For the rest of the world you are feeling very fantasized, but to a particular woman you are not. That is called as quad. frigidity, cold female, female impotency, where female is not getting sexually aroused, or you can say sexually excited, and this is a strong ground for a divorce. If such thing is happening, your married life is not going good, you can file for a divorce. Yes, हमें नहीं चाहिए. Sterility, inability to produce children seen in both male and female, seen in both male and female, inability to produce the children seen in both male and female. Earlier it was believed just the female, but nowadays the scenario has changed, it is both male and female. Virginity, the person who has never intercourse, the sexual intercourse, he or she is only virgin. Okay, he का तो कोई concept ज़्यादा है नहीं. बाकी false virgin is intact hymen after the intercourse. Why? Either the hymen is very posteriorly situated, or a hymen is very hyperplastic, because of which it is not getting damaged. Now superfecundation and superfetation is very important. Superfecundation is two ova fertilized by same ovulatory cycle by two separate act of coitus. पहले एक एग फर्टिलाइज हुआ, फिर दूसरे से इंटरकोर्स करा, उससे हो गया, तो दिस इज कॉल्ड एज सुपरफिकंडेशन. टू सेपरेट फादर्स ऑफ अ टू सेपरेट बेबी ऑफ अ वन मदर. सुपरफिटेशन, टू ओवा फर्टिलाइज इन टू ओवुलेटरी साइकिल, रेयरेस्ट और रेयरेस्ट. पहले एक ओवुलेटरी साइकिल आया, उसमें भी ओवा फर्टिलाइज हुआ, दूसरा वाला भी साइकिल आ गया, उसमें भी. जर्नली क्या होता है, एक साइकिल आ गया, प्रेग्नेंट हो गए तो बंद हो जाता है. इन दिस वन मोर साइकिल इज देयर, एंड दैट इज अ रेयर कंडीशन. दैट इज व्हाई वी आर लर्निंग दिस. लेजिटिमेट चाइल्ड, चाइल्ड बॉर्न ड्यूरिंग द लीगल मैरिज, जिसका माँ बाप की प्रॉपर्टी पे हर चीज पे हक होता है. सपोजिशियस चाइल्ड, फिक्शियस चाइल्ड, अ फीमेल इज क्लेमिंग अ स्यूडो प्रेगनेंसी टू सेकेंडरी गेन, दैट इज अ मनी. झूठ मूठ का आपने कहीं संबंध बना दिया, दैट फीमेल इज कॉलिंग यू अगेन एंड अगेन, आई एम प्रेग्नेंट बिकॉज ऑफ यू, नाउ गिव मी मनी. दिस इज कॉल्ड एज सुपोजिशियस चाइल्ड. Posthumous child, something which is born after the death of a father. Now medical termination of pregnancy is something you have to remember for the exam. So MTP Act 2021 says less than 12 weeks you need one doctor, 13 to 20 weeks you need two doctor, and more than 20 weeks you required only done in case of an emergency. Now the new rule also says more than 24 weeks can you do or not? Answer is yes, but you need a special cases. For example, there is a fetal malformation. For example, there is a rape victim. In such kind of special cases, the file will go to the medical board where the review will happen, and then the permission will be given. Then the permission will be given, my dear friends. So this is what the new rule is saying. And who can do 12 to 20 weeks diploma? 12 to 20 weeks is a legal time limit where you can do it. Okay. Now sir, diploma or degree in OBG, 1 year experience in OBG department, and if less than 12 week pregnancy is there, done at least 25 cases of an MTP. Please remove these things. Just remember, डिप्लोमा डिग्री होनी चाहिए, 1 साल का एक्सपीरियंस ओबीजी डिपार्टमेंट में, और 25 केसेस एटलीस्ट एमटीपी के असिस्ट किए होने चाहिए. देन यू आर एलिजिबल फॉर दिस. नाउ चैप्टर नंबर 10 इज टॉक्सिकोलॉजी, माय डियर फ्रेंड्स. चैप्टर नंबर 10 इज toxicology. My dear friends, toxicology is study of poison. Here we are talking about the cobra, common krait, most fatal. These are the neurotoxin snake. Patient can go into the coma and patient can die. Now treatment is neostoxmin plus anti-snake venom we are giving the hospitals. Viper, V for viper, V for vasculotoxic snake like Russell viper, saw scale viper. Sea snake are not toxic. They are just they're not fatal. They are myotoxic. They will lead to the मसल पैरालिसिस. दे विल लीड टू द मसल पैरालिसिस. मसल पैर, ठीक है, यस, एक ही डॉक्टर है, यस. नाउ कमिंग मोस्ट कॉमन कॉज ऑफ डेथ इन द स्नेक, इट इज ड्यू टू द फियर. Okay, now what is the treatment? First of all, right strategy we will use. What is this right strategy? Reassure, immobilize, go to the hospital and then start the treatment. Now question is, do you, जो हम फिल्मों में वगैरह देखते हैं, कंफ्यूज हो गए? क्या कंफ्यूज हो गए दोस्त? Up to 12 week, one doctor, up to 20, very good. Up to 20 weeks, one doctor, more than 20 weeks, two doctor. Very good. Yes, please. More than 20 weeks. This is an old rule which was written by print mistake. Don't worry. Up to 20 week, one doctor, more than 20 weeks, two doctor. This is a new rule. Okay, chali. Now coming on to the, yes. Will you put a strangulation If there is a snake bite, will you do a strangulation? No sucking, no tight tourniquet. Very good. Yes, no, we will not do that, जो फिल्मों में होता है. Now, anti-snake given in cobra, common crate, Russell viper, sawscale, vasculotoxic and neurotoxic snake. In short, if I tell you, vasculotoxic, ठीक है, चलिए. Now, poisonous और non poisonous में कैसे differentiate करेंगे सर? पॉइजनस वाले के अंदर 2 फैंग बनेंगे, नॉन पॉइजनस के अंदर मल्टीपल टूथ बाइट विल बी देयर सर. Now let's talk about the very first thing is a plant toxin, and in plant toxin I would love to talk about the very first is strychnine, that is Nux vomica. Fatal dose is 1. It will mimic the tetanus. Now what if it is mimicking the tetanus? Then you will come to know there will be ophiotonous position, respiratory muscle paralysis. Tetanus is also called as 8th day disease. 8th day disease. Antidote here, otherwise it is 100% fatal, but antidote if you have to give, you can give an antidote called as diazepam. Datura makes the person sleepy. It's the most common roadside poison or railway poison, which makes the person sleepy, and this is a 9D poison. It includes everything, diplopia, everything, but it will never involve the diarrhea. Never will involve the diarrhea. Now datura, what different type of datura we are having, sir? Datura alba means white datura, nigra means black datura, stramonium means thrown apple, जो हम शिवजी भगवान के ऊपर चढ़ाते हैं. Antidote of datura is going to be the physostigmine. चिल्ली सीड से डर्मेटाइटिस होता है, इसको बोला जाता है हुनान हैंड. Cannabis sativa, now important topic for all of you. Sir, cannabis sativa, the most common mechanism of action is CNS stimulant. Active form is tetrahydrocannabinol, 9-tetrahydrocannabinol. Products are marijuana, products are bhang, products are ganja. These are the products. Then marijuana is coming from any part of the plant. Bhang is coming from dried leaf or stem. And कैसी बदबू आती है? Burnt rope odor. Ganja is from dried flower of the female plant. And rum amok symptoms will be there. The person will feel like dying or killing someone. A motivational syndrome will be there, sir, where person will feel less motivated, sir. Then coming to the opium, also called as Hafid. Sir, this antidote is naltrexone. Oral, if we are giving trachea, near to trachea. Naloxone is a systemic, IV route से दिया जाता है, sir. If emergency condition is there, choose the naloxone route. If normal we have to give, we are giving the naltrexone. हफीम ओपिएट एंड ओपियोइड में डिवाइड हुआ. ओपिएट में मॉर्फिन, कोकीन, हीरोइन आई ओपियोइड्स के अंदर. दिस हीरोइन इज ऑल्सो कॉल्ड एज स्मैक और ब्राउन शुगर. द हीरोइन इज ऑल्सो कॉल्ड एज स्मैक और ब्राउन शुगर. नाउ लेट्स टॉक अबाउट दिस कोकीन इटसेल्फ. Cocaine is also called as white lady, obtained from coca leaves. Sign and symptom, a magnum symptom. Here you will see the magnum symptom. The person is having tactile hallucination. Cocaine के साथ में you are having tactile hallucination, and sometimes you have a reflex hallucination which is also associated with LSD also, sir. Smoking, snorting से ले सकते हो. The name is white but हरकतें सारी काली है, जैसे कि black teeth, black tongue. And treatment of cocaine toxicity, तो क्या बोलता है एंटीडोट में? white lady से कब मिलना है? रात को. तो remember the antidote is amyl night में, तो that is amyl nitrate. Now important. Most common substance abuse in India, it is alcohol. Use in India is tobacco. Now carbon monoxide poisoning, what treatment you are going to give? Hyperbaric oxygen. Now coming to the ideal homicide poison, that is thallium, which is not detected in the body. ठीक है? Ideal suicide poison is cyanide. Now we talk about the arsenic. Arsenic poisoning mimic the cholera. Yesterday only in the microbiology session we talked about this. Cholera is caused by Vibrio cholerae. There we talk about the arsenic. Now let's study about this arsenic poisoning. What is happening right here? Eldritch me line, white line, garlic smell, golden hair, arsenic का raindrop pigmentation, velvety mucosa. Antidote of arsenic is going to be the ball. जैसे garlic होता है, garlic के ऊपर बाल होते हैं, तो antidote is going to be the ball. Sir. Sir, also the disease associated with this is going to be the black foot disease, sir. Fatal dose is 100 to 200. No one is going to ask. Again, I want to summarize what is happening. Black foot disease, velvety mucosa, raindrop pigmentation, golden hairs you are going to see, antidote ball you are going to see, Eldritch me line going to see. If all these things you are going to see, you are reaching to the diagnosis of arsenic poisoning, my dear friends. Arsenic poisoning, my dear friends. Now coming to the cyanide, ideal for suicide, bitter almond like smell. Otherwise person will die, but if antidote you have to use amyl nitrate. Again, for a cocaine also amyl nitrate, for a cyanide also. So 2C are having the same antidote, that is amyl nitrate. Okay. Now most common poison use in India for suicide is insecticides. Is used as what's your insecticide. Now organophosphate poison, why, how they act, acetylcholine esterase को block कर देते हैं, पैरासिम्पैथेटिक एक्टिविटी बढ़ जाती है, ट्रीटमेंट में क्या करेंगे, एट्रोपिन प्लस ऑक्सिम ऐड करेंगे, विल गिव ऑर्गेनिक। ऑर्गेनोफॉस्फेट के साथ में अगर किसी और चीज की पॉइजनिंग हो देन ओनली एट्रोपिन इज गिवन। चलो पॉइजनिंग में फर्स्ट वी स्टार्ट द ट्रीटमेंट, देन इन्फॉर्म द पुलिस एंड वी गिव द गैस्ट्रिक लवाज विद द हेल्प ऑफ इवॉल्व्ड ट्यूब। Now this evolved gastric lavage is contraindicated in some poisons, and those are corrosive poisons, kerosene. In these poisons we use activated charcoal. We use activated charcoal. Now some important metal chelating agent we have to study, my dear friends. Metal chelating agent में सबसे पहले आया ball. Ball is contraindicated iron and cadmium. Penicillin is antidote in copper poisoning. EDTA is used in lead poisoning. Hemodialysis is contraindicated. Otherwise, when we are doing the gastric lavage and what for the systemic absorbed drug, this poison, we do a hemodilution. Hemodilution, we give plenty of fluids, we give the diuretic, the person will excrete the drug out. But this is contraindicated in KBC heroin. In the heroin poisoning, you will not. Kerosene, yes, you will not. Benzodiazepine, not. And copper sulfate, not. So these are some poisoning where you will avoid the hemodialysis. Now white phosphorus versus red phosphorus. White is a Diwali toxic smell present. Red one is non-toxic and smell is absent. Antidote is copper sulfate, my dear friends. And if copper sulfate toxicity is there, possy jaw you are going to see plus hand tremors are going to come. Mercury के अंदर Minamata disease of Japan, where glass bowler shaking is there, person will become more shy in this. Erythrism, where person will become more shy, glass bowler shake is there. Acrodynia, there will be pink disease, the person will appear more pink. And in the Minamata disease of Japan, mercury poisoning mein antidote is again ball. In previously also antidote was ball in wind condition where golden hairs were there, which mimics the cholera. Can you answer in the chat box which poison I am talking about, please? Meanwhile, lead poisoning. Lead poisoning, you are going to see Bartolian line, basophilic stiffening, there will be a constipation, there will be a wrist drop or foot drop. So one of the non-traumatic cause for the wrist and foot drop is what's your lead poisoning, is going to be what's your lead poisoning. Can you answer me what I have asked you? Golden hair, velvety pigmentation, that which disease is there where antidote is also ball? Sir, arsenic. Shailendra, very nice. Arsenic. West Vacha, arsenic, arsenic, arsenic. Now let's talk about the another important thing which I have to tell you is the poison and the smell, sir. Poison and the smell, sir. Very important. In poisoning, can you tell me which cavity we open in the first go? In the poisoning, which cavity we open in the first go? Can you tell me the simple name? Which cavity in the poisoning we open in the first go? Which cavity in the poisoning we open in the first go, sir? Which cavity we open in the first go, sir? Oh, sorry. Which cavity we open in the first go is a cranial cavity, sir. No, it is a cranial cavity, sir. We just smell it and tell which poison it is. So some important smells you need to remember along with me, sir. Now coming to the hydrogen sulfide, it will give you rotten, सड़े हुए अंडे की बदबू. Ethanol आपको fruity smell देगा. Nitrobenzene आपको shoe polish जैसी smell देगा. और hemlock जो नर poison आपको carrot जैसा smell देगा. So these are the different type of smells we are having. Now these are two definitions, body packer and body stuffer syndrome. Body packer, the drug is packed in polythene or condom, the person swallows it. So it will follow the GIT part. Body stuffer means you are packing the drug and you are stuffing into the different anal cavity, Anal canal, you can stuff it. Peritoneal cavity, you can stuff it. Different organ, if stuffing is happening, this is called as body stuffer syndrome. If person is swallowing, आज खा लिया, फ्लाइट है, कल निकल आएगा बाहर, this is called as body packer syndrome. This is called as body packer syndrome. Now before that, if two more things we have to add. If excessive sexual desire in male is called as satyriasis, and excessive sexual desire in female is called as nymphomania. It is called as nymphomania. With this we have completed whole of what we have just completed. Yes, my dear friends, can you tell me which subject we have completed just now? We have completed the forensic medicine and toxicology. These are some important points which we need to cover. Now coming on to the next important subject, and that is called as PSM. That is called as what, sir? Your PSM. Done. The one subject is done and dusted, bigger subject. Now let's talk about PSM subject, which is a bigger subject. Okay? Now ophthalmology is not done, it will be done. Don't worry. Okay? चलो जी, सिद्धि जी गाना सुनेंगी, बहुत बढ़िया, बाद में सुनाएंगे, ठीक है. Let's start with this subject now, PSM. Sir, stage 1, 2, 3, 4 and 5 stages. What are these stages? What happens to the birth rate? What happens to the death rate is again a exam ka question. Sir, stage 1 is high stationary. Then sir, stage 4 is low stationary. 5th is declining, and in this early expanding, late expanding is there. So in high stationary, my dear friends, everything is high. In high stationary, everything is high. Everything is high. Everything is high. Everything is high. Already explained. Everything is high. Now early expanding mein, birth rate is high, but death rate start decline. Late expanding mein, the birth rate is start decline and death rate is slow decline. Low stationary mein, everything is slow decline. Declining phase mein slow decline and very low decline. In all of these, India is in stage, this India, late expanding. India is in late expanding, stage 3. Yes, India is in late expanding. Done, sir? So remember, high stationary mein everything is high. Then high, start decline, slow decline, then slow decline and very low decline. So these are the stages, 5 stages you have to remember. They make the pyramids. Now what is demographic dividend and demographic liability? Demographic dividend and bonus or gift is what? When younger population is more in a country, when independent population is more in a country, that is called as dividend or gift. Now demographic liability is more people are dependent. Who are more people? Less than 15 years and more than 60 years. Old age are more, 60 years retirement की age होती है. So more than 60 years and less than 15 years, these are the people who are the dependent people. If in a country these people are more, they are called as demographic liability. Now fertility indicator, 4 formulas I am going to teach right now, and these formula are equally important for the exam. What is GFR? GFR stands for general fertility rate. How you are going to calculate? Each is corrected to other one. Sir, what is this GFR? It is a total number of children born to a female in a reproductive age group. Now what is reproductive age group? 14 to 49 years. Okay. Now this is reproductive age group, my dear friends. Remember how we have to calculate total number of live birth upon woman in reproductive age multiplied by 1000. Total number of live birth upon woman in reproductive age multiplied by 1000. This is going to be the GFR. Total number of live birth, woman in reproductive age multiplied by 1000. One formula clear. Now next is TFR, total fertility ratio. Now here what is TFR? Number of children born to a female in a reproductive age group with age specific fertility rate. इस age group में इतना, इस age group में इतना, इस age group में इतना. For that again the formula is same. Total number of live birth upon woman in reproductive age plus age specific fertility rate multiplied by 1000. So GFR and TFR, both the formulas are clear to all of you. GFR के अंदर only the reproductive age group, reproductive के साथ age specific reproductive age group, then it will become TFR. Now coming to the next is gross reproduction rate. Gross reproduction rate. This is GRR. GRR, gross reproduction rate. Now daughter born, number of daughter born to a female in a reproductive age with ASFR, that is age specific fertility rate. Now your denominator will be daughter born upon woman in reproductive age plus age specific fertility rate into 1000. This is called as GRR, girl. NRR, this is net reproductive rate. Net reproductive rate. My dear friends, daughter born upon WRA, that is woman in reproductive age specific fertility rate, and age specific mortality rate multiplied by 1000. This is going to be the net reproductive rate, and this is best to evaluate National Family Planning Program. National Family Planning Program. Now I'll ask you question and you tell me what I'm talking about. Okay? Girl born upon woman in reproductive age plus age specific fertility rate multiplied by 1000 is a formula for. Can you tell me this formula is for? This formula is for gross reproduction rate. Okay. If I add this here, age specific mortality rate, ASMR also, then this formula will become of a, this formula will become of a ASMR, net reproductive rate. Very good. Number of live birth upon woman in reproductive age multiplied by 1000. Now this formula will be off. बस एक आंसर दे दीजिए, then we are good to go for the next topic, sir. That is contraception. Contraception. GFR. Very, very nice. So all the formulas are clear to all of you. Now let's talk about the contraception. Contraception, sir, we are dividing into two forms. One is temporary, another is permanent. Temporary and permanent. Temporary and permanent. Temporary method include natural method. Natural method में calendar method, cervical mucosa thickening you have to check, है ना? Lactational amenorrheas, then cycle beads, etc. Barrier method, condom, OCPs, IUCDs, injectables, DMPA जिसके अंदर आता है. Permanent में tubectomy and vasectomy. Tubectomy is done in female, vasectomy is done in male, sir. So let's in detail learn about all these things. First of all, natural method. We have a calendar method. In calendar, we'll mark it the dates in which we don't have to do the unprotected sex. If body temperature is increasing before the ovulation, we have to stop the unprotected sexual intercourse. If cervical mucosa is thinning, that means fertile window is going on, then also we have to stop the unprotected intercourse. Then lactational amenorrheas. Lactational amenorrhea के अंदर we should like action should be like lactational amenorrhea के अंदर we cannot do. Okay, sorry, lactational amenorrhea के अंदर we can do it. ठीक है, चलिए. Cycle beads, also known as Tirumala method, where the mala is there and in the mala there are the dates. You will have to one Ladies and gentlemen, welcome back. Let's start with what we have left with. Generation we were talking about the copper T, that is T shape, U shape, 380 and 375. Which is better, sir? 380 is better than 375. Why it is better? Because of the half-life, which is 10 years in the 380, sir. 10 years, which is 380, sir. Done. Now, generational IUCDs, we are having the hormonal one. Two, we are having Mirena and Progestat. Equally important for the exam. Sir, Mirena is having lowest failure rate, better, and half-life is also better, 5 to 7 years. And what drug it is secreting? That is what, sir, your levonorgestrel, LNG. How much? Daily at the rate 20 mcg. Equally important, sir. Progestat, natural progesterone is coming at the rate 65 mcg per day, but the half-life is less and the failure rate is more as compared to the Mirena. So is better in Mirena and progesterone. So remember, Progestat, your answer is Mirena is better. Mirena is better, sir. Mirena is better, sir. Now the mode of IUCDs, what they are doing actually, they are increasing the cervical mucosa thickness, which is preventing the fertilization. Absolute contraindication is PID. When the person is having a disease diagnosed PID, in that, remember, it is absolutely contraindication. Then ectopic pregnancy is a side effect of a third generation IUCD. Third generation IUCD. And what was third generation? Hormonal IUCD. Now we are having OCPs also for the contraception, Mala and Mala D. What salt they are having inside? Remember, it is ethinyl estriol and your levonorgestrel. The estrol and in short you can say estrogen and levonorgestrel is there. 21 hormonal tablet and 7 iron tablets are there, sir. Injectable mein we are having DMPA, that is depot medroxyprogesterone acetate. Half-life is approximately 3 months it will work. Dose is 150 IM we are giving it. Contraceptive of choice. These are some one-liner question you should remember for your exam. My dear friends, yes, unmarried but sexually active, condom plus OCPs. Just married, OCPs. After delivery of first child, the gapping is there, then IUCD is the first method. First method, my dear friends. Now, sir, coming to mixed voice aa rahi hai? No, I think it's fine. I think it's fine, guys. It's okay. I'll continue the class in a smooth manner and you can watch it. Okay? Let's talk about this population covered by the healthcare system. Small thing. Subcenter. See, in this chart, just remember, the population cover in a plain area is more than the hilly areas. That's the first fundamental. So subcenter, if in a plain is covering more 5,000, in hilly it cover only 3,000. And beds are 0 to 3 bed depending on type A, type B, where delivery is happening and not happening and how much deliveries are happening. If no delivery happening, 0 bed. If deliveries are happening, 0 to 3 bed depending on that, sir. Again lag ho raha hai? Video blur ho rahi hai? Oh. That's the first. No? I think it's clear. Welcome back, ladies and gentlemen. Let's start with the population covered by a healthcare system. So in the plain area and the hilly area, you will understand the plain area will cover more population as compared to the hilly areas, and then we'll talk about the number of beds they are having in the particular center. So number one, we have to start with the sub-center, where in the plain area population covered is 5,000, in the hilly areas the population covered is 3,000, and number of bed is 0 to 3, depends on type A and type B, where delivery is happening and where delivery is not happening, my dear friends. Then coming to the primary healthcare system, PHC, primary healthcare center, where there is plain area 30,000 and hilly area 20,000 population is there, and the bed cover is 4 to 6 bed. CHC, community health center, in the plain area 1,20,000, hilly areas 80,000, and beds are more than 30. In the district hospital, it covers no population norm, but the beds are more than 100 bed. Beds are more than 100 bed. It depends. Now coming on to the next one, ASHA. Once the examiner asks about this full form of ASHA also, accredited social health activist. How much it is currently right now? 1:1,000 population. Only female can become a ASHA, and married female with no more than 2 children. Age is between 20 to 45, and she should at least be 10th pass. Now promote family planning, breastfeeding, immunization. That is a work of a ASHA. She'll be involved in all these kind of programs where she'll be doing the house job. She'll be going house to house and promote the awareness program, and also give some drugs also if needed to the required people. Now multi-purpose worker committee, it was given by Kartar Singh committee, and one multi-purpose worker is on 5,000 population. The multi-purpose worker is male or female? My dear friends, male is for the malaria service, surveillance, spray insecticide, water quality in the village, and female is for antenatal care, postnatal care, conducting of the normal delivery. She'll be helping in family planning, immunization. Now coming to the epidemiological triad and triangle, what difference it is having? Epidemiological triad is having agent, host and environment. Agent, host and environment. If we compare this with the epidemiological triangle, it will be having agent, host, environment as compared to the time also, as well as time is also included. Now let's talk about malaria. Diagnosis is by peripheral blood smear. Which species are there? Vivax, falciparum, malari and ovale. This falciparum is most common in India, and remember, for the Vivax and malaria we have to remember the drugs. For the Vivax and falciparum, tab, chloroquine and primaquine we give, sir. For the falciparum, now we check a non-pregnant female and a pregnant female. This treatment is different from a female and a non-female. In a northeast and north other states, the treatment is different. In a northeast state, the treatment is ACT-AL. Lumefantrine is added to this. In other state, it is ACT-SP. Now, if it is a pregnant female, what in the first trimester you can give? You can give only the quinine, but in the second and third trimester, you will again check if it is northeast state or other state. In the other state, you will give ACT-SP. In the northeast, again, you will use the ACT-AL wala combo. ACT-AL wala combo, sir. Now, coming on to the vectors and the disease, my dear friends. Now, along with me, you all have to answer in the chat box. Along with me, sir. Yes, right here. Sandfly, the mnemonic is COSO. Sandfly is a vector for a disease like K for Kala Azar, O for Oriental Sore, Sandfly fever, Oraya fever. Se, sleeping sickness, sote, black fly, onchocerciasis. Soft is cute, Q for Q fever. Hard tick, as a Casanur forest disease, antic typhus. Mite, kujli karta hai, scrub typhus, and R for rat, rickettsial. Louse is epidemic typhus, rat fleas, endemic, चूहा अंदर रहता है जमीन के, endemic typhus, and also lead to bubonic plaques. Redwood bug will lead to Chagas disease, and itch mite will lead to scabies. These are some important vectors and disease they are causing. Now let's come on to this table. This table is going to give us 100% exam question. 3 mosquitoes I'm going to talk about. Number 1 is Anopheles, Culex and Aedes. My dear friends, Anopheles is for the malaria. It will lead to malaria, and Anopheles lives in clean water. Anopheles eggs are boat shaped, and their Angle to the ground, you will see is elevated angle like this, 45. This is anopheles, lead to malaria. Now culex, filariasis, Japanese encephalitis, and your West Nile fever. They breed in the dirty water. Japanese encephalitis history you have heard of, paddy rice worker where stagnant water was there. From there the mosquito came, bitten, and the person diagnosed with Japanese encephalitis. So stagnant water is for the culex, and the eggs are C for culex. C are small clusters, and they are yellow shaped mosquito, yellow colored mosquitoes. Then Aedes mosquito, sir. Aedes mosquito breeds in artificial collected rainwater. Single cigar shaped eggs are there, and the disease they are causing is, sir, जायकेदार, Z for जायकेदार येलो चिकन. कहाँ खाया? रिफ्ट वैली में बैठ के. और क्या बीमारी हो गई? डेंगू. दिस इज अ निमोनिक टू रिमेंबर दिस. जायकेदार येलो चिकन we have eaten in the Rift Valley, and the disease we got is dengue. So all these diseases are associated with the Aedes mosquito. Aedes mosquito. Aedes mosquito. Now coming on to the dengue testing, Kala Azar testing. These are some important tests you have to remember for your exam. Now coming on to the number one is dengue. The test is NS1 antigen test. Clinically also we can check, we will put a tourniquet. If more than 10 petechiae per square inch is there, then the dengue positive. Lab diagnosis, hematocrit more than 20%. If PCB volume is more than 20%, then also we'll be thinking of a dengue. But sure diagnosis will come after NS1 antigen test. NS1 antigen test. Now dengue's feature are bone breaking fever, body ache. Any specific treatment for a dengue? My answer is no. Then what you can give? Supportive treatment, and also there is one tablet you can add to that, that is carry pill. Now coming to the Kala Azar, next one, sir. Diagnosis is serological test RK39. Field surveillance. If we are going on to the field and we don't have a lab, we can do the aldehyde test. If we have to do the confirmatory test in the lab, we are having RK39 test. Treatment is injection liposomal amphotericin B, and if orally you have to give, you can give the miltefosine drug, sir. Miltefosine drug. Japanese encephalitis, how you can diagnose it? RT-PCR. Clinical feature is encephalitis plus minus convulsions will be there. Plus amplification host is big ones asked in the exam, and it is seen where? In the stagnant water paddy fields we were talking about. Japanese encephalitis is a fatal disease, but we can give a vaccine to a person, and the vaccine given here is a live vaccine, and the name of vaccine is SA-14-14-2. SA-14-14-2. Now filariasis, my dear friends. The last is filariasis. Filariasis is caused by Wucheria bancrofti, peripheral blood smear pe you are going to see the maximum activity between 10 o'clock to 2 o'clock, and treatment of choice is diethyl carbamazine. Epidemiology. Who is the father of epidemiology? John Snow. Father of public health? Cholera. Germ theory was given by Louis Pasteur, and first vaccine was given by Edward Jenner. Now what is this incident and what is this prevalence? Number of new cases in the population is called as incidence, and new plus old cases is called as prevalence. So though the dono ka definition is clear to all of you. Now my dear friends, maternal mortality ratio. First of all, we'll talk about the ratio, and ratio is number of maternal death upon live birth into 1 lakh. Same way rate is there, and only difference it in the rate, it is multiplied by 1000. In the ratio, maternal mortality ratio, it is multiplied by 1 lakh, and in the rate it is multiplied by 1000. In the rate it is multiplied by 1000. Now different type of studies we have to focus on right here, sir. Cross sectional study, it gives us prevalence. Prevalence, that means old and new cases. This is kind of a snapshot study, cheaper study. At the same time only you can compare the exposure and outcome of a disease in the same time, which is a short study, snapshot study, and this is to check the burden of the disease. This is to check the burden of the disease, my dear friends. Now next is a case control study. It gives you odds ratio. It is a study of a rare disease. Now case control study is a backward study. That is why it is called as retrospective study. Case control study is a backward study. Like in the COVID we did, sir. In the COVID we did, sir. Rare disease COVID we did, sir. Cohort study, prospective study, forward study. It will give us the attributable risk, relative risk. It is a study of rare risk factor. Cohort study is a forward study, sir. We will observe the particular set of population, what rare risk factor they are having and what kind of outcome is coming. The forward studies cohort study, backward studies case control study. If you are comparing the disease and the outcome at the same time on the base of previous data, that is going to be the cross sectional study. If you are comparing the population, whole population, like of one state with another state, of one country with another country, those kind of studies are called as ecological studies. Those kind of studies are called as what, sir? Your ecological studies. Now errors, random error can be sampling, systemic error can be bias. How to treat this bias? We will do a blinding, single blinding, double blinding and triple blinding. What type of bias we are having? Observer can be biased, interviewer can be biased. Recall Parkinsonian bias. It is a bias happening on the base of hospital data. Bias happening on the base of hospital data. Then treatment of bias, if we talk about single blinding, double blinding and triple blinding. Single blinding, only subject is blind. Double blinding is subject and object. That means patient and doctor both are blind. Triple blinding, patient, doctor and observer, or you can say analyzer, they all three are blind. All three are blind. So this is a treatment blinder. Now coming to the confounding error based on exposure and outcome. किस चीज का exposure था और outcome क्या निकली? Those are called as confounding error. Those are called as confounding error. रिस्क फैक्टर किस चीज का था? बीमारी कुछ और ही निकली. अब स्मोकर के अंदर कोई तीसरी बीमारी निकल आई. दिस इज कॉल्ड एज कंफाउंडिंग एरर. हाउ टू इफ कंफाउंडर इज नोन, वी विल डू द मैचिंग प्रोसेस. If confounder is unknown, we will choose a particular group. We can do the randomization, random group, or we can choose some small group and we can randomly choose from that. Welcome back, ladies and gentlemen. So we were talking about the mother and child health. So infant mortality rate, you will see the number of infant death upon live birth into 1000. These are some important formulas you will find in a slide. Only 7-8 formulas you have to remember for your exam. Now under 5 mortality rate, under 5 mortality rate is under 5 mortality upon live birth into 1000. It is the best indicator for overall development of a country. A country's development is defined by the death of a children. If you have to talk about any country's healthcare system, you will check how many children are dying less than 5 years of age. Less than 5 years of age. So if the country is having less number of mortality rate in that age group, that means healthcare system is very good and country is a developed country. Now RM and CHA program, where reproductive mother neonate child health care is taken care. In this antenatal care, the minimum visits are 4 and maximum are 8. This is again a previous year question of the exam. Postnatal care is also coming in this, where the different type of medications etc. support is given to a female. Now supplementation which is given in under this program is iron folic acid, my dear friends. Iron folic acid. 6th month pregnancy and 6th month lactation, we give iron folic acid. How much iron, sir? This is important. 60 milligram of iron and 500 microgram of folic acid is given. 60 milligram of iron and 500 milligram of folic acid is given. How much calcium is given? It is 500 milligram. And albendazole is only given in a pregnant female in a second trimester. ठीक है सर? मैक्स तो 12 है ना? नहीं यार, मैक्स 8 है according to WHO, but in India it is 12. Oh, sorry. According to WHO it is 12, but in India we take 8 visits only. Okay, chali. Other schemes are like Anemia Mukt Bharat, iron and folic acid given under this. Janani Suraksha Yojana, incentive for institutional delivery is given to both mother and Asha who is accompanying them. Then coming to the Janani Shishu Suraksha Karyakram. This program promotes about the WHO का जो है वो 13 visit है. इंडिया में only 8 visits are taken. Yes, India में less visits are there. ठीक है. जननी शिशु सुरक्षा कार्यक्रम, increase government facility utilization, free OPD, IPD, drugs, diet, sick or newborn, pregnant female की care के लिए this program was there. Then home based newborn care, who does this? ASHA. How many visits? If it is a home based delivery, 7 visits are there. If home visit is there, if home delivery is there, 7 visits are there. If hospital delivery is there, 6 visits are there. What is the function? Function is to promote breastfeeding, growth and development, develop the immunization. चल, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम, बेनिफिशियरी 10 to 19 years age children. प्रधानमंत्री वंदना योजना, मातृ वंदना योजना, it is मातृ वंदना योजना, where incentive is given for the delivery and immunization to the mother. सुमन, सुरक्षित मातृत्व आश्वासन, no one can deny the pregnant female. So here even the private facilities can't deny the female patient for the delivery or any kind of health checkup. They can't deny. This is coming under Suman scheme. Lakshya is the quality of labor room. To increase the quality of a labor room, separate initiative has taken place and that is called as Lakshya. First referral unit, if you have to talk about, sir, PHC to CHC is the first referral unit and second referral unit is district hospital. All the operations are possible district hospital level onwards. Okay, all the operations are possible because anesthesiologists, then your surgeons, they are all available district hospital onwards. Now immunization scheme is there. This is again changing again and again, multiple time, which I will not be touching right now. Okay. Now cold chain, let's talk about. What is this cold chain? Important topic for your exam, sir. Cold chain, if we talk about, sir, cold chain, the temperature is 2 to 8 degrees Celsius. 2 to 8 degrees Celsius. There is a ice line refrigerator. This you can see ice ray. Work without electricity for 8 hours. Work without electricity for 8 hours. 8 hours. 8 hours. Plus present at PHC and CHC. Vaccines stored here are MR, BCG, polio, PV. These kind of vaccines are stored there in this ice line refrigerator. Then some small boxes are there. They are day carrier, which are present in sub-center. How much vaccine they can carry? Approximately 30 vaccines they can carry. Now next coming vaccine while monitor. Sir, vaccine while monitor. Now there in the vaccine while monitoring, you will check if the central square is fader than the periphery. Yes, vaccine is good to use. If same color as periphery or darker than periphery, then you cannot use it. Then coming to the open vial policy. Open vial policy, the vaccine can be stored in peripheral center after opening vaccine till 28 days, except MR, rotavirus, BCG, Japanese encephalitis and COVID-19. And best example I can tell you about the COVID-19. When we were going to the center, after opening, they were only opening the vaccine when there were the group of 10 people. Because if they will open and it is not usable in the other person, then they have to discard that without using. So for that purpose, they open vial policy need to be taken care of. ये तभी खोली जाए जब उतने लोग वहाँ हो उस वैक्सीन को लेने के लिए. Now some important strains of vaccine you have to remember. BCG, BC, who is BC? Danish. So remember BCG is Danish 1331. Then coming to the measles. मजा आया है गुड़ खाके. गुड़ को क्या बोलते हैं? जैगरी. एडमिनस्ट्रॉन जैगरी. रूबेला, बिला का एड्रेस क्या है? RA27/3. मम्मी जहरीली, जेरिलिन. चिकन पॉक्स, चिकन कैसा बना? ओके ओके, ओका स्ट्रेन. येलो फीवर 17D. देन OPV साबिन, लाइव, दैट इज लाइव इन मतलब लाइव. ठीक है, ओरल पोलियो वैक्सीन. So these are the important strain you have to remember for the exam. Then coming to the TB elimination program, the WHO has a target of 2030, but India set a target of 2025, which is not achieved. Okay, but new guidelines will come about the target also. But you have to remember what you are giving right here: 2-month HRZD regime, 4-month HRE. isoniazid, rifampicin, है ना, these drugs are given. Money given for a TB patient for a nutrition is 500 rupees, 500 rupees per month during the treatment. Now coming to the next one is National AIDS Control Program. Here we check the 90-90 strategy. What is this 90-90 strategy? 90-90 strategy says 90% should be diagnosed, 90% should be on a treatment, and 90% should be on a surveillance. And this is having a red color ribbon. This is treatment to this is antiretroviral therapy. Different therapies given to this patient. Suraksha Clinic logo has been asked once, my dear friends, and different type of kits also we have to remember. Kit 1 is gray color, that is for urethral discharge, that is cervicitis. Kit 2 is green color, that is for vaginitis. Kit 3 is white color, genital ulcer. Kit 4 is blue color, then again genital ulcer. This is non-herpetic genital ulcer, and this red color kit, red color kit is, red color kit is for herpetic genital ulcer, herpetic genital ulcer. Yellow is for lower abdominal pain. Yellow is for lower abdominal pain, and black is for scrotal swelling or inguinal buboes. Scrotal swelling or inguinal buboes. Chalo. Now coming to the next one, sir. National Leprosy Eradication Program. Paucibacillary, multibacillary leprosy is there. Less than 5 if lesions are there. This is paucibacillary. More than 6 is multibacillary. Treatment for pauci goes for 6 months. Treatment for multi goes for 12 months. And what treatment we are giving? RCD in both of them. Both of them RCD. R for rifampicin, D for dapsone, C for clofazimine. For both of them we give RCD regime, sir. Both of them. Then this is a logo of a leprosy eradication program. Then polio surveillance program. In this we are giving P1 and P3 bivalent, not trivalent. Also, which type of paralysis you will see? Flaccid paralysis. 2 stool samples are given. One is within 28 hours and another is within 14 days. And this is sent to a lab with the help of reverse cold chain, and temperature is -2 to 8 degrees Celsius. Then coming to the all live vaccines are contraindicated in pregnancy, except your answer is yellow fever. Now next chapter what we have to start right now is nutrition energy requirement. Now there are workers like sedentary worker, moderate worker and heavy worker. Sedentary worker, moderate worker and heavy worker, if we talk about, male and female ratios are different. Sedentary worker, in the female it is 1600 and male it is 21. Moderate worker 21, 27, heavy worker 27, 48. So female is like a 16 in the 16, 21, 27. Male is 21, 27, 34. So additional energy requirement, how much it is required? In pregnancy it is 350. If a female is lactating, my dear friends, less than 6 months is 600 and more than 6 months is 520. Can you calculate how much energy is required to a moderate worker male, who is moderate worker male? Can you tell me energy requirement? And also energy requirement in a heavy worker female, who is 3 months pregnant. Both the calculation, please write it down in your chat box. Now vitamin A we have talked about yesterday's session also. Source is halibut, fish liver oil. If vegetable source is there, carrot, less than 6 months, 50,000 international, 6 to 1 lakh, more than. And if weight is less than 8 kg, we again give 1 lakh international. 1 lakh international, 1 lakh. Very good, nice answers given. 2700 for the moderate worker, and for the female who is heavy worker, the answer is going to be 27 plus 350. Female who is heavy worker, 27 plus 3 month pregnant, 350. It is going to be 3050. Okay, chali. Now let's talk about the next thing, and that is your आयरन नॉर्मल, प्रेगनेंसी लैक्टेशन में कितना चाहिए 30 40 20. कैल्शियम इज नॉर्मली 1000, प्रेगनेंसी 1000, लैक्टेशन इज 1200. Folic acid 200, 500, 300. Iodine is 160, 250, 280. Okay. Now coming on to the diseases, toxin and the food stuff. Important one. Chaliye, let's move on to this topic one by one. Sir, here you remember letharism. कहता है कैसे, how to remember this? The toxin is boa and the disease is affected, it will affect the knees. So you just remember name of disease, toxin and the food stuff. Three things you have to remember. Chalo. Now remember letharism. Toxin is boa and food stuff is kesari dal, arhar ki dal. Letharism में sir, the toxin is boa and food stuff is kesari dal, arhar ki dal. Kesari dal, arhar ki dal. ठीक है, तो कैसे याद करना है, लठ लेके बोने गया केसरी दाल. एंडेमिक एसाइटिस, टॉक्सिन इज प्यारी, अंदर आओ प्यारी, मिलते हैं, प्यारी इज पायरोलिजिडिन एंड मिलते हैं इस मिलेट सीड. एपिडेमिक, आप संग आओ मस्ती करते, संग इज सेंगोरिन, टॉक्सिन, फूड स्टफ इज मस्टर्ड ऑयल. देन एर्गोटिज्म, एर्गोट एल्कलॉइड एंड बाजरा. Aflatoxin and it is present in groundnut. Now I'll ask you question, please write it down. Sir, letharism. Which toxin is there in the letharism, sir? Which toxin is there in the letharism, sir? Which toxin is there in the letharism? Boa, very good. Sir, epidemic droplets. Epidemic, आप संग आओ. What toxin I'm talking about? आप संग आओ. What toxin I'm talking about? Sanguarine. Very good. Aflatoxicosis. Which food is causing this? Aflatoxicosis. Which food is causing this? Aflatoxicosis. Groundnut. Very good. Groundnut. Very good. Now coming to the next chapter, that is environment. Environment mein number one thing we have to talk about the air. The most important indicator of air pollution is who? These days 100% exam question is going to come because air pollution is becoming the prominent topic these days. So my dear friends, most important indicator of air pollution is sulfur dioxide. Number one MCQ. Air quality index less than 50 is good and more than 400 is very bad. So your paper is going to be made from Delhi. Delhi is having very poor AQI. So remember environment chapter से question आने वाला है. Now next is Kata thermometer. It will be measuring what's low air velocity and cooling power of the air. Hygrometer, H for H, humidity. Soiling index, air pollution check करेगा. Kyoto protocol, decrease ग्रीन हाउस इफेक्ट के ऊपर एक टोक्यो के अंदर कॉन्फ्रेंस हुई थी जिसमें ग्रीन हाउस गैसेस को कम करने के लिए काम किया गया था. नाउ लेट्स टॉक अबाउट द नाउ नॉइस. अप टू 85 डेसिबल इट इज कंसिडर्ड नॉर्मल, बट दीज डेज 90 डेसिबल्स in the factory workers etc. for 5 days in a week for maximum 8 hours in a day. More than 120, 110 temporary, 160 will be permanent hearing loss where hair cells are getting damaged in this. Water quality, to check the water, we best thing is color, temperature, odor etc. and best disinfectant, boiling is better answer than chlorination. Sir, chlorine demand कैसे calculate करोगे? एक apparatus होता है, that is again your exam का question is Horrocks apparatus. And there will be free chlorine level. How you are going to check? With the help of chloroscope. Free chlorine level are checked with the help of chloroscope, and sir, chlorine demand is checked with the help of Horrocks apparatus. My dear friends, next is orthotolidine test and OTA. Orthotolidine is free plus combined chlorine again. OTA, orthotolidine arsenite test, free plus residual chlorine. It will give total, it will give free give, and residual also it is going to give. Now how much fluoride should be there in our drinking water? 1 ppm. If it is exceeding, then it is a problem. It will lead to the skeletal sclerosis, and if it is decreasing more or less, it will lead to the dental caries. It will lead to the dental caries, sir. Housing standard, floor space per person should be 750 to 1000 square feet. Cubic space should be more than 500. Door and window area should be 40% of the floor space, whatever we are having, sir. Now, radiation is also important topic from where the question has been asked in the previous exams. Thickness of a lead apron is more than 0.5 mm. Total natural radiation is 0.1 rad per year we are receiving, and max permissible in case of a normal man and woman is in a year is 5 rad, but if pregnant female is there, 0.5 rad a year only it is allowed, sir. Sewage की बात करेंगे. The liquid waste with the human excreta is called as a sewage, where 99% water is there, 1% content is there. Strength of sewage is calculated with the help of, sir, biological oxygen demand is better answer than the chemical oxygen demand. Now, the level of prevention is also your exam question. Primordial, primary, secondary and tertiary, sir. Primordial, primary, secondary. Now, you see the risk factor and the disease, sir. Sir, if risk factor is absent and disease is also absent and still you are taking the precaution, for example, every day you are waking up and doing yoga, exercise, etc. This is called as primordial prevention. This is called as primordial prevention. Then, sir, if risk factor is there and disease is absent and still you are taking the precaution, for example, wearing condom, getting the vaccination done. Secondary, risk factor bhi hai, disease bhi hai, then you are doing the screening, S for S, that is screening of the disease, sir. Screening of the disease. Tertiary, now risk factor and disease both are present and damage has occurred. Now, after major surgery, how the life is going to, for example, after heart transplant, after implant. So these are the levels of preventions we are having, right, starting from primordial. जब कुछ नहीं था, सुबह दौड़ने जाते हो, एक्सरसाइज करते हो, तब क्या है, प्राइमरी में क्या है, रिस्क फैक्टर है बट डिजीज नहीं हुआ है. यानी कि हमें जैसे कोविड आया था तो हमने वैक्सीन कब ली थी, व्हेन वी वर अपरेंटली वेल, वी वर नॉट इन्फेक्टेड. ऐसा थोड़ी कोविड पॉजिटिव पेशेंट को वैक्सीन लगा रहे थे, नो, व्हेन वी वर ओके देन ओनली वी वर टेकिंग द वैक्सीन. Now, some screening of choice we have to think of, sir. The screening of choice, cancer cervix, it is going to be the pap smear, better answer than your viability test. Then breast cancer, clinical examination is the best thing, self breast examination. Colon cancer mein fecal occult blood test, we will check the stool samples. Diabetes mellitus, fasting blood sugar is better screening test than your HbA1c. Otherwise, most best confirmatory is HbA1c only. Thyroid में thyroid stimulating hormone test we do. Now coming to next important things like lead time. Lead time. What is lead time? So the time between a first possible diagnosis and appearance of a symptom. First possible diagnosis and appearance of a symptom. पहली बार diagnose कब हुआ, symptom कब आया, उसके बीच का जो time है, that is called as lead time. What is sensitivity, specificity? One liner you have to remember for your exam. Sensitivity tells about the diseased population and specificity will tell you about the healthy population. बीमारी वाली चीज को कौन बताएगा, sensitivity, और ठीक वाली चीज को बताएगा specificity. That sensitivity, the true positive upon true positive plus false negative, and specificity is true negative upon true negative plus false negative. Positive predictive value, disease is present, test is positive, disease is absent, test is absent, that is negative predictive value, negative predictive value. So in this everything will be true, true positive, false positive, new, and in this true negative, false negative. So this is how you have to remember these four formulas also, sir. Now biostats. Sir, quantitative versus qualitative, we have to do that. Quantitative versus qualitative. My dear friends, quantitative data are measurable and they are continuous like height, weight, age. 1, 2, 3, 4 ऐसा नहीं आज एज जो है 25 साल है कल 30 हो जाएगी, ऐसा नहीं है, एक कंटिन्यू चलते हैं, ठीक है. क्वांटिटेटिव इज काउंटेबल डाटा, 1, 2, 10 भी हो सकते हैं. डिस्क्रीट डाटा, जेंडर है like 10 मेल, 10 फीमेल, 10 गरीब, 10 अमीर, like this it will go on. मीन मीडियन मोड क्या है? सम ऑफ ऑल नंबर डिवाइडेड बाय एन नंबर, वी ऑल नो, बचपन से कर रहे हैं. मीडियन क्या है? सेंटर मोस्ट वैल्यू. मोड क्या है? मोस्ट फ्रीक्वेंट वैल्यू. नाउ नॉर्मल डिस्ट्रीब्यूशन कर्व, दिस इज ऑल्सो कॉल्ड एज Gaussian's curve. What Gaussian's curve is telling us? Area under the curve, which is giving us the standard deviation, and standard deviation is also your previous exam ka question. Sir, one standard deviation is 1 MCQ 68%, 2 standard deviation is 95%, and 3 standard deviation is equal to 99%. 99%. Now here we are having right skewed curve, or which is also called as positive skewed curve. Positive shift, left skewed curve, which is also called as left shift. My dear friends, there is right skewed curve is mean, then median, then mode. और इसका उल्टा कर दो, which will be left skewed curve, which will be your negative shift, that is your mode, median, mean. Normally we say mean, median, mode. If mean, median, mode is there, this is a right skewed curve or a positive shift. If it is mode, median, then mean, it is going to be the negative shift, which is also called as left skewed curve, which is also called as left skewed curve. Left skewed curve, sir. Thank you so much. Normal curve, mean भी बराबर होगा median के और mode के. Done, done, done. Now the type of graph we are having, sir. The quality वाला याद कर लो, quantity अपने आप याद होगी. Sir, there is a picture. There is a picture. In this picture, there is a map. In this map, there is a bar, and in this bar, someone is eating pie. So pictogram, spot, map, bar, and pie. Rest everyone will come in the quantity representation. Now, test of significance, my dear friends. Test of significance. First of all, 1 group, 2 group, and 3 group. What will do for 1 group? For 1 group, if 1 group is there, for example, you have to remember like this. If only 1 group is there, there will be a more bonding. So remember, this is paired t-test, which is done for the quantity. 2 groups are there. अगर 2 group हो जाएंगे तो लड़ाई लग जाएगी. Unpaired t-test, sir. And if 3 or more group is there, we need a Innova car to make them sit. Big group, big car. Innova test, sir. Innova test, sir. And for quality, we are having Chinese product. Quality is tested, so chi-square test, sir. Chi-square test, sir. Chi-square test, sir. Chi-square test, sir. वेस्ट मैनेजमेंट के अंदर सीधा आप बायोमेडिकल वेस्ट की बात करेंगे. विच डस्टबिन इज throwing what we have to throw in that? Sir, yellow and red first we have to compare. Yellow and red both are infectious. Infectious. Now, yellow is non-recyclable and red is R for red, R for recyclable. If any infectious waste we can recycle, that will go into red color. If any infectious waste which we cannot recycle, that will go into the yellow color. For example, anatomical waste, vaccine, if we cannot recycle it, it will go into the yellow. Gloves, blood bag without blood, it will go into red color. Blood bag with blood, it will go into the yellow color, sir. Yellow color, sir. Needle, syringe, etc. white color, sir. Blue color mein implant, broken glasses, it will go into the blue color. This is a basic things you have to know for the. Now ESI, employee state insurance scheme, which is giving a leave. In this, only one leave is very important, enhanced sickness leave. For tubectomy, it is giving for 14 days to female for 100% wages, and in vasectomy, it is giving to male for 7 days with the 100% wages, with the 100% wages, sir. Now, what is this icebergs phenomena? Iceberg phenomena is like this. The submerged part are the hidden cases or the subclinical cases whose sign symptoms are bimari hai, but sign and symptoms are not there. Now, what are diseases which are not following this iceberg ka phenomena? My dear friends, remember, this is MTR, that is your measles, tetanus, rubella. Measles, tetanus, rubella. And even some books are saying rabies also. Rabies also. What is Delhi Quali Hale? So Delhi is disability adjusted, best indicator of burden of disease. कितनी लाइफ आपने बर्डन बीमारी के बर्डन में जी है उसके क्वालिटी एडजस्टेड लाइफ ईयर. लाइफ आफ्टर ट्रीटमेंट, लाइफ आफ्टर ट्रीटमेंट. ट्रीटमेंट के बाद कितना, लेट सपोज 60 साल में कोई बीमारी लगी, बोले खत्म ही हो जाओगे, ऑपरेशन नहीं कराओगे, तो ऑपरेशन के बाद अगर आपने 10 साल जिंदगी और जी ली, दैट इज कॉल्ड एज क्वाली. दैट इज कॉल्ड एज क्वाली. दैट इज कॉल्ड एज क्वाली. HALE, health adjusted life expectancy, number of years spent in good health, best indicator for assessment of a health status of a community. तो डाली इज अ बर्डन, कितनी देर बीमार रहे, डाली में बीमार रहे, क्वाली मतलब बीमारी के इलाज के बाद कितना जी पाए, और हेल के अंदर कितनी देर आप स्वस्थ रहे. डाली में बीमार रहे, क्वाली के अंदर आप कितना ट्रीटमेंट के बाद आगे जी पाए. दोज आर द थिंग्स यू हैव टू रिमेंबर. Now incubation, time between entry of organism and first sign and symptom. Now tell me first sign and symptom और diagnose with के बीच के time को क्या बोलते हैं? What we call the time between first sign and symptom and diagnosis. What that interval is called as? What that interval is called as, my dear friends? What that interval is called as? Can anyone answer right in the chat? Lead time. Lead time. Lead time is a correct answer given by it. Very very good sir. जनरेशन टाइम क्या है? एंट्री अंदर हुई और कितनी देर में वो मैक्सिमम कम्युनिकेबल हो, कितनी देर में वो मल्टीप्लाई हुआ सर, दैट इज जनरेशन टाइम. क्वारंटाइन इज डन फॉर डिजीज्ड पर्सन और अपेरेंटली हेल्दी पर्सन. तो क्वारंटाइन आपको किया गया हर जगह जाने पे. आप बीमार थे इसीलिए करा कि आप बीमारी फैला सकते हो, इसीलिए क्वारंटाइन इसीलिए किया गया ताकि उतने दिन आपको वहां रखा जा सके कि अगर आपके अंदर वो बीमारी हो भी तो वो उतना उसका टाइम पीरियड खत्म हो जाए तो आगे फैल ना पाए. अगर आप बीमार हो, इफ यू आर डिजीज पर्सन यू विल बी आइसोलेटेड. इफ यू आर अपेरेंटली हेल्दी then you have to go for the quarantine. In India we have to go for yellow fever for 6 days and COVID-19 for 14 days. COVID-19 for 14 days. इंडेक्स केस क्या होता है? प्राइमरी केस जो नजर में आया बट एक्चुअली बीमारी कौन लेके आया? जो हेल्थ अथॉरिटी से पकड़ा, दैट इज योर प्राइमरी केस. सेकेंडरी इज प्राइमरी से आगे जो हुआ वो सेकेंडरी केस हुआ. नेशनल प्रोग्राम फॉर कंट्रोल ऑफ ब्लाइंडनेस एंड विजुअल इम्पेयरमेंट का लोगो इज इम्पॉर्टेंट. हाउ मच पॉपुलेशन वन ऑप्थेमोलॉजिस्ट इज कैरी, दैट इज इम्पॉर्टेंट. Less than 3/60 blindness is there with the best possible correction is the WHO का definition for the blindness sir. Sir now public quality life index and human development index, what is the difference between these two? These are having ILL, infant mortality rate, life expectancy at 1 year and literacy rate. In human developmental index we are having life expectancy at birth, expected schooling years and income per capita. So these are the two things you have to remember कि अगर लाइफ एक्सपेक्टेंसी बर्थ की बात हो रही तो वी आर टॉकिंग अबाउट HDI. इफ लाइफ एक्सपेक्टेंसी एट 1 year they are talking about the PQLI. Per capita income is a part of HDI. Infant mortality rate is a part of PQLI sir. Niti Aayog given the different committees. What different committees they have given? Kartar Singh committee, which was a multi-purpose worker committee. Chadha committee, basic health worker committee. Mukherjee is family planning. Srivastava medical education. Bajaj is for the finance. Now health communication sir, didactic approach is one way approach. सिर्फ मैं बोल रहा हूँ और आप आगे से feedback नहीं दे रहे हो, that is didactic. If I am saying something, you are also giving me feedback, that is psoriatic. Individual को how will approach? Letter, SMS. Group method is what sir? Your group discussion. 6 to 12 people, if they are discussing, it's group discussion. If series of lecturer or experts are coming, they are giving lecture and going, that is called as symposia. And if 12 people are sitting around, they are discussing something and audience is watching, like we have a news channel debate, that is called as panel discussion. That is called as what sir? Your panel discussion. And mass communication method is radio, social media, etc. Now disaster management, who will go first to the site of disaster? First is paramedical staff, and this is being taken care by Ministry of Home Affairs. What are the pre-disaster and post-disaster phases? My dear friends, pre-disaster phases and post-disaster phases are equally important. Prevention, first we can prevent it or not. Mitigate, we can go to some other place. Preparedness, we will try to see if the flood is coming, we'll try to make the boundary walls, etc. Like this, the prevention, mitigation, preparedness. Now disaster has happened. What other things are there? Response, recovery and rehabilitation. Response, recovery and rehabilitation sir. Now, most common disease after this is gastric enteritis, and most common micronutrient deficiency, that is going to be vitamin A, sir. Now, these are some logos you have to remember. Integrated Child Development Services, Ayushman Bharat, where 5 lakh cover is given to per family. One family is given 5 lakh rupees health insurance. PM Poshan Yojana, this is replaced by midday meal scheme. Other important things are WHO, where the WHO center is, headquarter is, the WHO headquarter is where, sir? Can you tell me? It is in the Geneva, Switzerland. UNICEF का अपना न्यूयॉर्क सिटी में है. वर्ल्ड बैंक की भी अपना वॉशिंगटन के अंदर है. बायोहजार्ड का लोगो, दिस इज ब्यूरो ऑफ इंडियन स्टैंडर्ड लोगो, वंस आस्क्ड इन 2020 अगस्त एग्जाम. Then these are some colorful structures, no need to tell what it is, it is obvious to all of you what it is. चलिए, एक डॉक्टर कितने पे है? At current we are having 1000 population. Okay, some recent data has came about 1.7 something like that, but till now in gross factor, if we have to remember that, we remember one doctor is on 1000 population currently. Asha is 1 is to 1000, 3 nurses पे एक doctor है, 1 pharmacist is on 10,000 population. Now ORS, what ORS is having as also your exam question. My dear friends, ORS की बात करेंगे. First thing is sodium, potassium, citrate, chloride and your glucose. Your sodium and glucose is same, 75 millimole per liter. Potassium is like a केला 20 रुपए किलो, 20 mm. Citrate is like a संतरा orange, it is 10 rupees kg, so 10 mm. Chloride is left 665. ORS is a fluid of choice for mild to moderate diarrhea. Mild to moderate. How we are giving? 1 sachet we are mixing in 1 liter water. WHO has advised like that, sir. Now bioterrorism group A, B and C, and then we are going to finish this PSM. All important topic we have covered. Group A is having sub-TB pneumonic. Sub-TB stands for smallpox, anthrax, botulism, tularemia, viral hemorrhagic fever. These are coming under Group A, bioterrorism. Group B is Q-Bru-P, that is fever, Q fever, brucellosis and epidemic. And Group C is Nipah corona hanta. You can, actually these are bioterrorism. Why these called bioterrorism? Because of this we can attack other country. किसी और country को बीमार कर दो, तो गोले बारूद के अलावा भी लड़ी जा सकती है. दैट इज गोइंग टू बी बिकॉज ऑफ द बायोटेररिज्म. किसी कंट्री के सोचो पानी की पाइप में कुछ मिला दिया आपने, तो पूरी कंट्री को इन्फेक्शन हो जाएगा. दोज आर द बायोटेररिज्म एजेंट्स वी हैव स्टडीड एंड सक्सेसफुली वी हैव कंप्लीटेड आवर सेकेंड सब्जेक्ट. The third subject which we are going to start is ophthalmology. That obviously we are going to take a short break, and after that break we are going to start this class. At what time we are going to start this class? Now is 9:10. Let's start this class at 9:30. 20 minutes break is fine for all of you. Go do dinner and then we start the next subject, that is ophthalmology. चलो डन. Welcome, ladies and gentlemen, to this day 2 of Final Aid Chanting session by Conceptual Medicine. And the third subject we are going to do now is equally important, that is ophthalmology. आंखों वाला तो एक गाना हो जाए आप सबके लिए. कहते हैं इन आंखों की मस्ती के अफसाने हजारों हैं, दीवाने हजारों हैं. My eye, नहीं. To these eyes we have thousands of stories and thousands of lovers. इन आँखों की मस्ती के. ठीक है. चलो, ladies and gentlemen, let's start. सर जी बेवफा वक, ये कौन सा गाना है? गिरिराज चौधरी. चलिए साहब, let's talk about the ophthalmology. And ophthalmology, the first thing we have to start with the anatomy. Anatomy में different structures are there. So we have divided basically eye into three parts. What are those, sir? Outer, which is cornea; middle, which is also called as अपना sorry, outer layer, middle layer, and inner layer. Sir, outer layer we are having cornea, sclera, limbus. This cornea is the only avascular structure in the eye. Cornea is the only avascular structure in the eye. Sclera is a white part in the eye, and limbus having the muscles, zonules and ciliary muscle, which are for the mydriasis and meiosis of the eye, plus also for the accommodation power of the eye. Then middle layer we are having uvea, and uvea is having three structures. What three structure uvea is having? ICC. What three structure uvea is having? ICC. ICC stands for iris, ciliary body, and choroid. My dear friends, this iris will decide the color of the eye. This iris will decide the color of the, and ciliary body is having pars plicata and pars plana. They are responsible secretion of aqueous humor. Aqueous humor. We are having two type of fluids in the eye. One is aqueous humor. That. So choroid is the most vascular structure in the eye. So because of the most vascular structure in the eye, the choroid is responsible for the thermoregulation of the eye. Thermoregulation of the eye. So these are some basic things you should know before starting the eye part. Now let's talk about the three layers. We have talked about the outermost layer is having cornea, then sclera, then limbus, then middle is having uvea. Uvea is having three structures. ICC, that is iris, ciliary body, and choroid. And other than that, we are having the inner structure where we are having the main retina, my dear friends. The basic one-liners we have to remember, we have to focus on. Volume of orbit is 30 ml. Yes, we agree to that. Full of the orbit we are talking about. If we have to talk about only eyeball, it is 6 ml. Out of 6 ml, 4 ml is who? Who is 4 ml? Vitreous humor is 4 ml. Who is 4 ml? Vitreous humor is 4 ml. Now there is a MCQ which we have learned in the ENT also. Orbital blowout fracture. The most common wall which is going in the orbital blowout fracture. This is CT scan, coronal section we are having. This is a teardrop sign, and we have, remember, the mnemonic DIE. D for diplopia, I for infraorbital anesthesia. Wherever the punch is going to go, there will be a numbness. This is called as infraorbital anesthesia. Then anophthalmos, the eye is going to go inside. Diplopia can happen, anophthalmos can happen, and also in infraorbital anesthesia can happen in a orbital blowout fracture. Multiple time asked question in the exams. Now coming to the next is cornea. Cornea is a avascular structure, is present on the outer side. This avascular structure is responsible for bending of the light. Bending of the light, very important. And this is a transparent avascular structure. Now thickness and curvature is measured with the help of MCQs. Now if we are talking about the thickness, we are talking about the packing, more thickness, like where we are wearing the clothes, more packing. So packing, thickness, it is pachymetry. The test which is done to check the thickness of the cornea, that test is called as pachymetry. That test is called as pachymetry. And for the curvature, we are having keratometry, and we are using a specific device for that, and that is called as Placido disc, my dear friends. The blue color you are seeing right here is Placido disc, Placido disc, Placidosis. Now coming to another thing, refractive index. The refractive index of a air is 1, cornea is 1.37, and length is a previous year question. Lens is a previous year question, PYQ. Lens in the center we are having 1.40, periphery we having 1.38. So in the lens it is from 1.38, right, starting from periphery going to the center, that is 1.48. That is for the center of the lens, which is having the maximum refractive index of 1.40. Air 1 straight away, cornea 1.37, lens it is 1.38 to 1.40. Where is maximum? Your answer is going to be, it is in the center. And how much it is? Your answer is going to be 1.40, 1.40. Now let's talk about this uvea. We have already talked about iris. What is going to do? Iris is going to decide the color of the eye. Iris is going to decide the color of the eye, sir. Color of the eye. Ciliary body, I told you, ciliary body is having two structures. What two structures? Pars plicata, pars plana, and they are helping in what? Your MCQ was, they are helping in the production of aqueous humor, sir. They are helping in the production of aqueous humor, aqueous humor. Now coming to the next one is choroid. Choroid we have already learned, it is a most vascular structure in the eye, drained by vortex vein. And because most vascular supply is coming, so your thermoregulation is also taken care by the choroid, sir. Thermoregulation is also taken care by the choroid, my dear friends. Choroid, my dear friends. Then coming to the retina. Retina is the innermost layer from where the optic nerve is connected and the visual signals are going to the visual area, which is area 17, 18. Done. Now, ora serrata is the thinnest part of retina. Ora serrata is the सबसे पतलू part of the retina, and center of retina is having special type of structure. A central of retina is having special type of structure. What are those? Macula, fovea, optic disc. Now, phobia is sounding like a PHOBIA phobia wala. So remember, phobia is most sensitive to light. The structure of the retina which is most sensitive to light, your answer is going to be the phobia. Your answer is going to be the phobia. Optic disc diameter is very, very important. How much it is? 1.5 mm. If there is an optic disc diameter increases, there will be blurring of vision, and we are going to talk about those diseases where you are going to encounter such problems, my dear friends. Such problem, my dear friends. Now let's talk about the cells which are present inside the eye. Those are rods and cones. Two types are there, sir. Rods are of one type, cones are of three type. Rods are of one type, cones are of three type. One type, they are present in the periphery, and what they are responsible for? Your scotopic vision. What is your scotopic vision? That is your black and white vision. Black and white vision. Black and white vision. And what about the photopic vision? The photopic vision is by the cone. How much they are? They are 3 in number. Oh, sorry, they are 3 types. They are of 3 types. Sir, they are red, RGB, red, green, blue. And they are present in center. So colorful vision is by cone, and black and white vision is by rods. So total 2 types of cells are there, rods and cones, rods and cones. My dear friends, first cell to receive light will be rods and cone. And my another question is, which is most sensitive to light? Then your answer should be in the chat box right now, sir. If I ask you most sensitive to light, then your answer should be different, sir. Then your answer should be different, sir. Now coming to the lens and pupil, what they are dividing? There are chamber, there are segment in the eye. Yes, there are chamber, there are segment. First is fovea. Sensitive to light is fovea, and first to receive is rods and cones. Yes, Dr. Nice 5 has given a correct answer. Dr. Sakit Mastikhor has given a correct answer. Very nice. Chaliye. Now the lens and the pupil, what they are dividing? So sir, if you see right here, your lens is sounding like a length. So length is dividing anterior and posterior segment. So length is in segments. Your pupil is sounding like a people. People are sitting in chamber. The pupil is dividing anterior and posterior chamber. They are dividing anterior and posterior chamber. Then coming to the aqueous humor. It is produced by who? your ciliary body, pars plicata plus pars plana. More is pars plicata. They are secreting that. Now production rate is 2.5 microliter per minute and outflow rate is 0.2 milliliter per minute of mmHg. And my dear friends, remember something right here. If this flow is reduced, then intraocular pressure is going to increase. And if your intraocular pressure is going to increase, so my dear friends, remember there is going to be a disease, and that disease is called as another MCQ of your exam, that is called as glaucoma. That is called as glaucoma. Now coming to the vitreous humor, which is again a larger structure in the eye with the volume of 4 ml. With the volume of 4 ml. So out of 6 ml, 4 ml is vitreous humor. Is it produced throughout the life? Your answer is no. It is not produced throughout the life. It is present by birth itself, my dear friends. It is present by birth itself, my dear friends. God bless you. God bless you, Dr. Shruti. Chaliye. So vitreous humor is present by birth. 98% water and 2% hyaluronic acid is there. 2% hyaluronic acid is there. Total volume is 4 ml, sir. Largest structure in the eye, sir. Now question is, aqueous and vitreous both are responsible for the intraocular pressure, my dear friends. Both are responsible for the intraocular pressure. Let's talk about the power. Eye is having 60 diopter of power, cornea is having 43, lens is having 19 diopter of power. What is the normal axial length of the eye? The normal axial length of the eye is 24 millimeter, my dear friends. But what happens at the time of birth? At the time of birth, this axial length is only 16 mm, which makes our eye small. And small eye is called as hypermetropic eye, and hypermetropia means far-sightedness. So जब बच्चा पैदा होता है, when the child is born, we can only see far. This is called as physiological hypermetropia, which is present by birth. Physiological hypermetropia. So sir, normal axial length of adult, and see, if the axial length is exceeding 24 mm, then it will lead to big eye. Big eye is called as myopia. Big eye is called as myopia. Then the nerve supply of the eye, parasympathetic, sympathetic both. Parasympathetic will lead to the meiosis and sympathetic will lead to mydriasis. Yesterday only I taught you one concept in this. If parasympathetic is there, so every activity which is abdomen and below abdomen is going to increase, and sympathetic above abdomen it is going to increase. So sympathetic above abdomen eye size is going to increase, called as mydriasis, and below abdomen, if we are talking about parasympathetic, above abdomen everything is going to decrease, that it is going to cause the meiosis, sir. Now normal vision is 6/6, max possible is 6/3, and we will talk about how to test the vision, my dear friends. The next question is how to test the vision. Sir, testing vision, number one is Snellen's chart. Which chart we are going to talk about, sir? Snellen's chart. This is most commonly used chart. The most commonly used chart is going to be Snellen's chart. Then for the illiterate people, sir, for the illiterate people, we are having a landlord's link. Like if we say landlord people are illiterate people, they don't know how to read. For these people, we are having ring. Ki muh kahan se khula, where the opening is, up, down, lateral. This is how they will tell you. Then Allen's chart is there for the preschool children. They can identify the shapes. And the children who are not able to speak, mostly less than 2 years or 1 year, optokinetic drum is there. Here we'll check the nystagmus, the movement of the eye. Moment we roll the drum and the eye movement is not there, that means baby is not able to see. And if movement is there, that means baby is able to see. Baby is able to see. Baby is able to see. Now next is best chart to check the vision, and that is going to be EDTRS or Logmar chart, sir. EDTRS or Logmar chart. EDTRS or Logmar chart, sir. EDTRS or Logmar chart. So my dear friends, EDTRS or Logmar chart is like a sloping thing. So most common used chart will be, my first question, the most common used chart is going to be, then your answer is going to be, the most common used chart is going to be Snellen's chart. And best chart is Logmar chart. Other name of Logmar chart is ETDRS chart. ETDRS chart. ETDRS chart. Very, very good. Very, very nice. Now, अब chart से check कर लिया. Chart में नहीं दिखाई दे रहा. Then what you will do next? Finger count. If finger count is also not visible, you will wave the hand. If waving of hand is also not visible, then you will go for the torch. You will put torch in the eye. If still light is also not visible, then we consider that person is blind now. Then this person is blind now, sir. Now, let's talk about the next thing which we were talking about is intraocular pressure, sir. We were talking about intraocular pressure. Ladies and gentlemen, it is a pressure exerted by both aqueous and vitreous humor. Aqueous and vitreous humor both are responsible. Normal is 10 to 21. If it is more than 21, called as glaucoma, and it is measured with the help of device, and which is previous year question of your exam, sir. This intraocular pressure is measured with the help of device, which is your which is your best device to measure the intraocular pressure, and the best device is again exam question, that is Goldman applantation. Goldman applantation. Visual field, let's talk about. Sir, if I talk about male or female, who is having the better visual field or bigger visual field? Your answer should be female. And why so? God has graced them like that. So visual field we have to talk about. So superior, inferior, nasal and lateral. So my dear friends, if we compare, lateral is having the widest range. Lateral is having the widest range, my dear friends. So here you will see superior and your nasal is same 60-60, inferior is 70 and your lateral is 100. And how to check in the bachpan also, in the early childhood, we have seeing through the machine, and where one balloon is there, house is there, green grass is there, they're asking kya kya dikh raha hai. So on the basis of that, they will decide our visual field is normal or not. And remember, that is called as none other than Humphrey's perimeter. That is called as none other than your Humphrey's perimeter, sir. The next topic what we are going to talk about is color blindness. It's a X-linked recessive. That means females are carrier but never affected. Female carry तो करती हैं पर affect नहीं होती हैं. Now the person is confused. Color blindness doesn't mean that there is a complete absence of, जैसे कि लाल पड़ा दिखाई नहीं दे रहा उसके पूछा. The person is confused for color. This is called as color blindness. So my dear friends, proto is for red color, deuter is for green color, triter is for blue color. So if the word normal is there, that means there is a weakness of the cone. So red cone is weak. Deuter normally matlab green cone is weak, and triter normally matlab blue cone is weak. If the word is protonopia, that means absent. Normally means weakness, nopia means absent. Nopia means absent. And what is monochromatism condition, my dear friends? Monochromatism is a condition where only rods are present. And my dear friends, I taught you that if only rods are present, that means the person is seeing the world black and white. The person is seeing world as black and white. He or she will not able to see world as what? He will not able to see world as colorful world. So uski दुनिया कैसी हो जाएगी? 50 shades of. चलो, done. Now coming to the color blind checking. The investigations are Ishihara. The most common one is what are your Ishihara. You can see different numbers in this. We have to see. If you are not able to see, that means we have the color blindness. Color blindness. Another test is FM100 Huey. Another test which is the best test which was asked in the previous exam, and this is Naegele's anemaloscope. Naegele's anemaloscope. Naegele's anemaloscope. Now coming on to the next thing, that is your ocular movement. The muscle which are helping in the opening of the eye and muscle which is helping in the closing of the eye. Opening of the eye require at least 3 muscles. Opening of the eye required at least 3 muscles. What are they? LPS, levator palpebrae superioris, molars and frontalis. Closing only requires orbicularis. Then one mnemonic you have to remember: synrat, superius intort and your rectus adduct. And another mnemonic is SO4 LR6. LR6. Superior oblique is supplied by 4th nerve, lateral rectus is supplied by 6th nerve, rest all are supplied by 3rd nerve. Rest all are supplied by 3rd nerve. So let's talk about the muscle arrangement right here, sir. Focus. How the muscles are arranged. So my dear friends, right here, medial side mein there is a medial rectus, lateral side mein lateral rectus. If you see right here, so this is right eye, this is left eye. So lateral side pe lateral rectus, medial side mein medial rectus. Right side पे lateral side पे inferior में is a inferior rectus. There you have to focus. अब इसके side पे सर आप बोलोगे there should be inferior oblique. This is the catching word you have to remember in case of eyes. inferior rectus के बगल में you are going to have a superior oblique and opposite will happen onto the other eye and the same eye. Inferior rectus नीचे है, ऊपर is going to be superior rectus, superior oblique नीचे है, going to be the inferior oblique. And opposite will happen lateral side के नीचे, left वाले के lateral side inferior rectus, opposite superior oblique. Then this is how. Then we ever talk about SO4 LR6. So superior oblique is supplied by fourth nerve, rest everything, and the lateral rectus is supplied by sixth nerve, rest everyone is supplied by third nerve, sir. Done, sir. Now coming to the question, what are their individual actions? So write down like this: SR, IR, SO, IO. Superior rectus, inferior rectus, superior oblique, inferior oblique. So intorsion, extorsion, intorsion, extorsion. In X, in X. पहला सीक्वेंस क्या बना? In X, in X. Then दूसरा सीक्वेंस बनता है add, add, abduct, abduct. पहला in X, दूसरा है add, abduct, abduct. तीसरा है elevation, depression, depression, फिर elevation. Elevation, डिप्रेशन, डिप्रेशन, फिर एलिवेशन. तो एलिवेशन, डिप्रेशन. अब इसको 3 हिस्सों 4 हिस्सों में डिवाइड कर दीजिए. सुपीरियर रेक्टस इज हैविंग दिस फंक्शन, inferior rectus हैविंग दिस फंक्शन, superior oblique having this function. With this trick you can solve all this question in your exam. Now binocular single vision. What is this binocular single vision, my dear friends? Binocular single vision is we are having 2 eyes but still we are able to see only one image. How? First of all, 3 grades we are dividing it into. What are the 3 grades what we are dividing into 2? One is simultaneous macular perception. Then there is a fusion of the image. Then third is stereopsis, that is depth perception. Till here we are getting the 2D vision, but stereopsis is 3D, which is the 3D vision. And to check this binocular single vision, and we are having a test called as tetanus flight test. This stereopsis, we have a tetanus flight test. Tetanus flight test. Anisometropia. What do you mean by anisometropia? Power difference between 2 eyes is more than 2 standard deviation. That means more than 95%. Can't wear glass. There will be diplopia. Treatment क्या दोगे sir? Contact lens, sir. Contact lens. Now coming to the cataract topic, another topic which is important for the exam, and that is a cataract topic, sir. Sir, cataract, opacification of the lens or capsule. Opacification of the lens or capsule. Most common cause of blindness is cataract. Second most common is glaucoma. Infectious is trachoma. In children it is vitamin A. Ocular morbidity, refractive error, sir. What is the definition of the blindness? The WHO say less than 3/60 with best possible correction in better eye. This is a complete definition of a blindness, was asked in the exam previously also, sir. Now we have divided into 3 type of blindness. ESM, like we study PSM, here we study the PSM. Sir, a very simple to remember: economic, social and manifest. It is 6/60, 3/60, 1/60. So less than 6/60 is economic, less than 3/60 is social, and less than 1/60 is manifest. Less than 1/60 is manifest. Now my question is, if the vision is 2/60, we consider that as which type of blindness? Can you answer me? If the vision is less than 2/60, if 2/60, we consider out of these 3, we consider that as which type of blindness? Among these 3. Among these 3. Among these 3. So 2/60, less than 3/60, you have to mark answer as social man. Social blindness. Now type of cataract: nuclear, cortical and posterior subcapsular. Nuclear is for day blindness, cortical is for night blindness, and posterior subcapsular is exam question. Posterior subcapsular is for day and night plus near vision. Many times examiner is asking us the question. What question examiner is asking? The examiner is asking, the old man is not able to read newspaper in the bright daylight. That means not able to read newspaper. What does that mean? Near vision is impaired plus bright daylight. This component is there. This fits better into the answer of posterior subcapsular cataract, my dear friends. Now different type of cataracts with their findings, we'll see. A congenital के अंदर zonular and punctate. Zonular के अंदर your other names are laminar and riders also. You are going to see the spokes wheel opacity. You are going to see the spokes wheel opacity. And in the punctate or blue dot, my dear friends, punctate or blue dot, you are going to see this punctate. These are the congenital cataract. Now traumatic blunt trauma, roseate cataract, flower shape appearance, you are going to see. Metabolic cataract, we are having, number one is diabetic. Sir, all the cataract are sudden. All the cataract are slow progressing. Only cataract which is sudden, that is going to be your diabetic cataract. It is snowflake cataract. What is accumulated here? Sucrose plus fructose is accumulated right in the eye, sir. In the eye, sir. Chaliye, sir. Wilson's disease. Sir, ATP 7. 7B. ATP 7B gene is involved for the Bilson, B for Bilson. Sunflower like appearance, there is a deficiency. There is a deficiency of ceruloplasmin. There is a deficiency of ceruloplasmin, and ceruloplasmin is a copper transporter. अगर ceruloplasmin नहीं होगा, copper will deposit on the different part of the body, and if it will deposit on the eye, you will have a Kesher-Fleischer's ring, a sunflower type of appearance. Galactosemia, from the yesterday's class, can you tell me which enzyme deficiency we are talking about in the galactosemia, my dear friends? In the galactosemia, which enzyme deficiency? Which enzyme deficiency we are talking about? Gal-put. And what we are seeing right here, sir, oil drop cataract. Next is myotonica dystrophica, Christmas tree cataract you are going to see, sir. Then symptoms of cataract, slow, painless, loss of vision. Only cataract which is sudden is a snowflake cataract, which is also called as diabetic cataract, sir. Snowflake cataract or diabetic cataract. Sir, patient can have a diplopia, also can have a color halos. For color halos, we are having a different test called as Fincham test. Fincham test we are having, and here the examination is slit lamp examination. You can see an unhappy man and a happy woman. So this is a slit lamp examination. Slit lamp examination. Very, very nice. Treatment of cataract. See, if a young patient is there, we avoid surgery because we require accommodation power in an adult. So that in a young patient, we prescribe glasses. And in the old patient where we do not need accommodation, there we will prefer a surgery. They will prefer a surgery. Now, different type of surgeries, what we have, ICC, ECC, phacoemulsification, and one more surgery is there, femto laser is a flask. Now, sir, ICC is an intracapsular cataract extraction where capsule and length both are extracted. ECC where capsule is there and lens is extracted and we put a lens inside. Phacoemulsification is a stitchless surgery where only 3 mm incision is given and foldable intraocular lens is placed in that. One more is femto laser assisted surgery, which is superior to all of them. Flasks. Coming on to after operating cataract, what complication we can have, sir? That is also important question equally. What complication we can have, sir? Number one is secondary cataract. How it is visible? We are going to see on the fundoscopy Elshing pearl and Somerings. Elshing pearl and Somering. And how we'll treat? NDA laser. Cystoid macular edema. What we are going to see, sir? Honeycomb appearance. Honeycomb appearance. Cystoid macular edema. Honeycomb appearance we are going to see, sir. Then, sir, next third complication what we can have is endophthalmitis, is an infection of the vitreous. Now, this is triple V disease. How? There is a loss of vision. Treatment, intravitreal injection of another V, 4V, that is vancomycin. How we can prevent? Cleaning of the eyelashes with the pyridine, iodine, that is your betadine, sir. Betadine. So these are the 3 prominent complications regarding the cataract we have studied. Well, now coming on to the next topic, and that is, sir, what called as uveitis. Uveitis, first of all, uveitis is of 3 types: anterior, intermediate and posterior. What structure we have to talk about? Yes, iris, ciliary body and choroid. Ciliary body is having 2 structures. One is pars plana, another is pars pliccata. Pars plana and pars pliccata. So my dear friends, right here in the anterior uveitis, if we have to simply divide anterior, intermediate and posterior, rule out करने के हिसाब से, remember anterior uveitis is painful, rest two are painless. A one line answer to this confusion. Only anterior uveitis is painless, other painful, other two are painless. Simple. Now coming to the anterior, why there is a pain? Why there is a redness? The pain is because of congestion of a circumciliary muscles. So remember, there is a spasm of a ciliary muscle, and pars plicator is also involved. Most common cause, again a question, idiopathic, but second most common cause is HLA-B27, which will also lead to a disease in orthopedics, back, bamboo spine, ankylosing spondylitis. Other is what's a Ritter syndrome, which is also called as reactive arthritis. What features this reactive arthritis is having? Conjunctivitis, urethritis and arthritis. Along with arthritis, patient is having urethritis and conjunctivitis. That will suggest you of a Ritter syndrome or reactive arthritis. These are coming under what are your anterior uveitis. Now symptoms, as I told you, circumciliary congestion is there. That is why painful loss of vision is there. Because of congestion, there will be a redness. There will be a redness. And sign what you are going to see, the aqueous flare, mutton fat, KP, sir. Nodules. Two type of nodules are there, sir. Irish nodules are there, sir. One is Busaka, which is present on the surface of the lens. And one is Copies, which is present at the margin of the lens. Margin of the pupil. Pupil margin. Margin of the pupil. Another complication what can happen is a synecdoche formation. Anterior synecdoche will lead to a complication A for A, that is angle closure glaucoma. Posterior synecdoche will lead to two complications. One is cataract and another is festooned pupil. Sir, what is this festooned pupil? Festooned pupil means there is a distorted shape pupil. Distorted shape pupil is going to, as you can see this diagram also. Treatment, drug of choice is topical steroid. But if there is an acute case, patient is coming to you with a severe pain, so you need to prescribe a cycloplegic drug. And cycloplegic drug of choice in children is atropine. And in adult, it is going to be tropicamide or cyclopentolate. Cyclopentolate, sir. Coming on to the next one, sir. Intermediate uveitis. Now they are painless uveitis. What is happening right here? Pars planitis and vitritis is happening right here, and pars plana is involved in this. Remember, most common cause is again idiopathic. Second is sarcoidosis. Most common finding is going to be the floaters. Other finding is snowball and snowbank. Along with the floaters, snowball and snowbank is seen, and loss of vision, painless, as we already told. A treatment is going to be steroid, my dear friends. Posterior uveitis, infectious, non-infectious causes there. Infectious में toxoplasmosis, non-infectious में sarcoidosis. Loss of vision is again there, but painless loss of vision. What other finding? Sir, you are going to see chorioretinitis, where you will see a creamy yellow patches on the fundus, creamy yellow patches. Headlight in fog appearance, which is associated with vitritis. If a vitritis patient is having inflammation of the vitreous, in this case, in the uveitis, vitreous is also involved, then headlight in fog appearance also you are going to see, sir. Treatment, antimicrobial for the infectious, like toxoplasmos, we can give a spiramycin. For non-infectious, we can go with a systemic steroid, my dear friends. Ocular HIV, commonly asked question, sir. Ocular HIV, remember, the most common manifestation, cotton wool spot and soft exudate. Cotton wool spots and soft exudate. Most common infection is CMV retinitis. CMV retinitis. Okay. Cytomegalovirus, where you are going to see owl eye appearance. Owl eye appearance. Owl eye. And most common tumor is Kaposi sarcoma. Most vascular tumor. Yesterday also we have studied HHV8. HHV8. Now, on examination in the ocular HIV, what you are going to see? Pizza pie or brush fire appearance. Pizza pie or brush fire appearance. You can very well appreciate right here, sir. Moving on to the next topic, sir. Glaucoma. Moving on to the next topic, that is glaucoma. Glaucoma. ऐसा है, एनर्जी कम नहीं होती है. कोई 6 बजे से बैठा है तो वो 10 बजे तक कूद नहीं सकता है. वो थोड़ा सा टाइम लेगा, है ना. ऐसा नहीं अभी दौड़ना शुरू करा तो पूरी रात ही दौड़ते रहेंगे. थोड़ा रुकेंगे, फिर दौड़ेंगे, फिर थोड़ा रुकेंगे, फिर दौड़ेंगे. इट्स अ नॉर्मल ह्यूमन बीइंग बिहेवियर, है ना. we can't laugh 24 hour, we can't dance 24 hour, है ना? So sometime we have to study, sometime we have to joke, laugh, etc. है ना? चले, so let's talk about this. ठीक है? Glaucoma, second most common cause of blindness is what, sir? Your glaucoma. That intraocular pressure is more than 21 mm of Hg and it is measured with the help of tonometer. Now my question is, my dear friends, now my question is, which is the best tonometer? 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 That you have to answer in the chat box. Best tonometer. Which is going to be the best tonometer? Your answer is going to be the Goldman plantation. Goldman plantation. Very good. What is happening? Intraocular pressure high, visual defect हो जाएगा, optic disc damage होने लग जाएगा. And what about the congenital glaucoma, sir? Congenital glaucoma is also called as buphthalmus. The tride is there, sir. Tride is there. Which tride is there? Lacrimation, photophobia, blepharospasm. Lacrimation, photophobia and blepharospasm. This is for the congenital glaucoma. Now we are dividing this glaucoma into two. One is angle closure and one is open angle glaucoma. How they are different? Angle closure, let's suppose it is most common in the female. And open angle, let's suppose male more than female. So open we are thinking about the male and close angle we are thinking about the female. Now sir, फीमेल की आंखें छोटी छोटी, फीमेल को रंगों का शौक होता है और फीमेल को जो परेशान करता है फीमेल उसको ब्लॉक कर देती है. द कॉज इज प्यूपिलरी ब्लॉक सर. द कॉज इज प्यूपिलरी ब्लॉक सर. एंड कलर हेलोस के लिए विच टेस्ट आई हैव टॉट यू? फिंशम टेस्ट विल डू सर. हाइपरमेट्रोपिया मतलब आंखें छोटी हो जाती है तो दूर का ही दिखता है, पास का नहीं दिखता है सर. एंगल क्लोजर ग्लूकोमा में सिम्टम आर पेन, रेडनेस, सडन लॉस ऑफ विजन. आंखें कैसी हो जाती है? पत्थर जैसी हार्ड हो जाती है. Shallow anterior chamber, steamy cornea, all those features are there. And Fincham test we do for the color halos. Drug of choice is pilocarpine for the angle closure glaucoma. For the angle closure glaucoma, angle closure glaucoma, angle closure glaucoma, hypermetropia. Then sir, coming on to the laser, surgical treatment, we are doing laser iridotomy with the help of ND-YAG laser. And what if there is an acute attack in the angle closure glaucoma? Then the drug of choice is going to be the mannitol. Then the drug of choice is going to be the mannitol. Now open angle glaucoma, male more than female मान के चलते हैं. मेल की आंखें बड़ी बड़ी, मायोपिया. कलर यहाँ पे क्या पता था? कलर रेसिस प्रेजेंट है. ट्रेबिकुलर फाइब्रोसिस हो चुकी है, एसिम्प्टोमेटिक, एंड इफ सिम्टम्स आर कमिंग टनल विजन. पेशेंट इज कंप्लेनिंग डॉक्टर साहब पहले पेरिफेरी से दिखना कम हुआ, धीरे धीरे टनल विजन हो गया. तो टनल विजन इज अ फीचर ऑफ ओपन एंगल. और ओल्ड एज पीपल आर कंप्लेनिंग कि प्रेस बायोपिक ग्लासेस आर चेंजिंग सो फ्रीक्वेंटली. Here in children, drug of choice is अपना carbonic anhydrase inhibitor, that is dorzola, brinzolamide. In adult, we are having alpha 1 analogs. These are अपना latanoprost drug, which is asked in the exam. Then trabeculoplasty, because trabecular fibrosis was there. That is why we will use the argon laser to treat it, sir. So this is the difference between angle closure and open angle glaucoma. Female में होगा तो angle closure, male more common than female होगा तो this is your open angle glaucoma. आंखें छोटी होंगी angle closure glaucoma, open angle में आंखें बड़ी हो जाती है, myopia हो जाता है. Pupillary block is the reason for angle closure glaucoma, and open angle glaucoma is because of trabecular fibrosis. Tunnel vision is a feature of open angle glaucoma. Frequent change in the presbyopic classes is a feature of open angle glaucoma. In an angle closure glaucoma, there is going to be the stony hard eye, steamy cornea, anterior chamber is going to be shallow. So these all are the different sign and finding. You are going to see the angle closure and the open angle glaucoma. Open angle glaucoma, sir. Now, next topic is neovascular glaucoma. So neovascular glaucoma के अंदर new vessels are there which are obstructing the outflow, and because of that inside there is lot of intraocular pressure. So most common cause to this is diabetes. First of all, if sir stop the neovascularization, and how to stop the neovascularization? One is drug, another is by the surgery. In surgery की मदद से तुम do the fan photocoagulation, but anti-VEGF drug are the anti-angiogenesis drugs also, my dear friends. That is बेवफा रानी. बेवफा रानी कहता है बेवफा प्यार है आजा, तेरा इंतजार है आजा, घूमेंगे हम। ओ चीटर कम अगेन, बेवफा का मतलब यही हुआ इंग्लिश में, I am waiting for you again and again. So this is a translation my dear friends. ठीक है चलिए, so anti-VEGF drug में बेवफा रानी we are going to learn sir. Now coming to the optics chapter. What is this optics chapter? Sir, 5 things we are going to read in this: myopia, hypermetropia, presbyopia, index myopia. So all these things we are going to read right now sir. Myopia सबसे पहले, myopia. Now myopia के अंदर what is happening, your eye is becoming bigger and normal and आपका कितना था 24, anterior posterior diameter कितना था, axial length कितनी थी 24 millimeter. Now it is exceeding 24 millimeter. If your length is your axial length is increasing 1 mm, the power difference is going to be -3 diopter sir, -3 diopter sir. Now what is happening? Here the rays are coming, and because of the big eye, now the rays are focusing before the retina. The rays are opening before the retina. Now what you need? You need a lens which is a diverging lens. You need a lens which is a diverging lens, my dear friends. And which is a diverging lens we are having? We are having a concave lens. So we give पेशेंट ऑफ मायोपिया कनकेव लेंस, तो यहाँ से फिर रेज डाइवर्ज होंगी जिसकी वजह से जो है हमारा दिखाई देना पॉसिबल हो पाएगा। ठीक है, नेक्स्ट इज योर हाइपरमेट्रोपिया. सेम आई टॉट यू, द आई इज बिकमिंग स्मॉल, so your normal axial length was 24 millimeter. Here it is decreasing. 1 mm decrease in axial length will lead to a power difference of +3 diopter. +3 diopter. Here what is happening? The rays are coming and they are getting converged behind the retina. So you need a lens which is a converging lens. So converging lens में आया convex lens. Here it will converge and new rays will be formed. ठीक है, चलो done हो गया काम. Hypermetropia is done, myopia is done. Now astigmatism. Sir, 2 different foci, one is before the retina, another is after the retina. Such condition was asked in the exam, and here the treatment is cylindrical glass or toric lens. Here the treatment is cylindrical glasses or the toric lenses. Then coming presbyopia, loss of accommodation with the age. Bifocal lens we are using, bifocal इस तरीके का lens होता है. For the near vision we put on the glabella, and for the near vision we put on the tip of the nose, and far vision we put on the glabella. Coming on to the next part, sir. Now this is something, a mistake which happened, and because of which some part of your forensic medicine, it just pushed right here, sir. So we'll just go to retina. Chalo, let's talk about the retina, my dear friends, right now. Retina, my dear friends, this retina is having 10 layers, sir. 9 are neurosensory, and 10th is pigmentary layer. 10th is what, sir? Pigmentary layer. ठीक है, pigmentary layer. Now retinal detachment is separation of these 9 layer from the 10th layer. Separation of these 9 layer from the 10th layer, that is called as retinal detachment. Now what is happening? The patient is coming to you with, Doctor साहब आंखों के सामने पर्दा गिरा रे मेरी आंखों के सामने, sudden there is a curtain like sensation in my front of my eyes. So curtain like sensation in front of my eyes. Floater and flashes are seen. And now on the fundoscopy or retinoscopy, what glow you are going to see? You are going to see gray glow, my dear friends. Gray glow. Once there is a retinal detachment, which type of glow you are going to see? So my dear friends, the name of glow is gray glow. Next is what types are there of a retinal detachment. So my dear friends, 3 type of retinal detachment is there. So the second type we were discussing about the tractional retinal detachment. The most common cause is malignant melanoma, exudative, we were talking about third one. Malignant melanoma of the choroid, sir, which is the most common ocular tumor in the adult. So which one is in the children now? Ocular tumor in the children, that is your ocular tumor in the children. No audio? Hello? All fine? Okay, chalo. Chalo, retinoblastoma. In the children, it was retinoblastoma. Now, diabetic retinopathy, type 1 diabetes and type 2 diabetes. Sir, type 1 diabetes and type 2 diabetes, if we talk about type 1 diabetes, if insulin dependent wala is happening, retinopathy, when you should suspect? You should suspect retinopathy 5 years, after 5 years, and check every year. If type 2 diabetes mellitus, which is insulin independent, if that is happening, at the time of diagnosis itself, you have to go for the search for the diabetic retinopathy, or you have to test for the diabetic retinopathy. Shabash mere shero, very good. Very good. Chalo. Earliest feature in the diabetic retinopathy, what you are going to have? You are going to have the microaneurysm, and the most specific feature is going to be the neovascularization. So diabetic retinopathy is further divided into non-proliferative and proliferative. In proliferative, yes, there are the blood vessels. New blood vessels are present in the proliferative. So treatment is pan-retinal photocoagulation. No proliferation is there. So new blood vessels are very less. So no new blood vessels, soft hard exudate, dot blot hemorrhage, flame shape hemorrhage. Previous year question. So dot blot hemorrhage, soft hard exudate, and your flame shape hemorrhage is a part of non-proliferative, and new blood vessels are there where venous engorgement is there, cherry red spot is seen, and also there will be a boxin, no, not boxin cartilage, that's not feature here. So there new blood vessel, there's a new blood vessel, and treatment is retinal photocoagulation. Vitreous hemorrhage. Now floaters are seen, but flashes are absent. Sudden loss of vision. Now, most common cause in adult is diabetes. Second, most common cause in youngs is trauma, and second is Eales disease. Eales disease. Okay. Now, sir, no glow is seen on examination. Can you now tell me, my dear friends who are watching me, sir, guys, please tell me, gray glow is seen in which condition we have talked about? Yes, my dear friends, you have to give the answer. Now, gray glow is seen in, answer दीजिए. अब नया चीज ऐड कर लीजिए. No glow is seen in. No glow is seen in vitreous hemorrhage. What is the treatment of the vitreous hemorrhage? The patient is coming to you. The treatment of the vitreous hemorrhage, retinal detachment. Harshika, very good answer given by Harshika. If vitreous humor is there, then vitreous humor, याद रखना, vitreous hemorrhage is there. Bed rest for 3 months. And after 3 months, if it is not getting resolved, then you will go for the vitrectomy. Now coming to the next is CRVO versus CRAO. Tomato splash appearance, 90-day glaucoma. Most common cause of loss of vision is macular edema. Treatment is anti-VEGF drug. This is CRVO. Central retinal venous occlusion. On the other hand, we are having CRAO. Central retinal arterial occlusion. This is an emergency condition. We have to reduce it within 4 hours. If we are not able to, there will be a loss of vision. And on examination, you will see a cherry red spot, box on car appearance, box car appearance, tram track appearance. These all are feature of CRAO. And how we can reduce it? Ocular massage, and also by reducing the intraocular pressure by giving the mannitol. So this is an image of tomato splash appearance. This is cherry red spot with the box car appearance, image of a CRAO, sir. Very good. नाउ रेटिनाइटिस पिगमेंटोसा रात को नहीं दिखता है, इट इज नॉन ट्रीटेबल कंडीशन बट डिलेबल कंडीशन। इसका मतलब क्या? उसका मतलब यह हुआ कि आप इसको ट्रीट नहीं कर सकते हो बट इसको डिले कर सकते हो। कैसे डिले कर सकते हो? योर आंसर इज विटामिन ए। कितना देना? दैट इज आई एम गोइंग टू टेल यू। तो रेटिनाइटिस पिगमेंटोसा रात को, आर फॉर रात, रेटिनाइटिस पिगमेंटोसा रात को नहीं दिखाई देता। और रात को कौन आता है? पापा। पापा को हिंदी में क्या बोलते हैं? आया। आया कौन आया? पापा आए पापा। बी फॉर बाप, बी फॉर बोन स्पिक्यूल, ए फॉर आर्टरियल एटेन्यूएशन, पी फॉर पेल वैक्सी डिस्क, पी फॉर पेल वैक्सी डिस्क, पेल वैक्सी डिस्क, पेल वैक्सी डिस्क। ठीक है साहब। The person can't see at night. Tried we have seen. Gold standard in investigation is ERG, that is electroretinography, sir. Electroretinography, sir. Manshki, thank you so much. Now, sir, treatment part can't treat but can be delayed with the help of what, sir? Your vitamin A. How much we can give every day? 15,000 international unit. 15,000 international unit vitamin A we can give every day, and that can delay it, not cure it. Now coming to the most common ocular tumor of the childhood, बच्चों के अंदर retinoblastoma. Which gene? RB1 gene. Which chromosome? 13q14. What it is called as? 13q14. My dear friends, you will see the leukocoria. Leukocoria is nothing but a cat-eye pupil. Loss of vision, yes. Cottage cheese appearance. Hallmark is Flexner, Windsor, rosette. Flexner, Windsor, rosette. You are going to see. Now this tumor can go from eye to the brain. So the primary vision is not a focus, life is focus. That is why primary is save the life. Second, you have to just save the eye की structure पढ़ा रहा है, save the eye. और tertiary your approach should be save the vision. And cause of death, for which reason we are first saving the life, was your metastasis. It can metastasize to the brain, my dear friend. It can metastasize to the brain, my dear friend. Coming on to the next topic, and that is cornea and conjunctiva. Cornea, conjunctiva. Now let's first talk about this, the glands, what they are having. Sir, they are having glands. They are having glands, lipid, aqueous and mucin. What they are secreting? They are secreting, mammalian gland is secreting lipid layer, lacrimal gland is secreting aqueous layer, goblet. What they are? They are lubricating the eye. They are lubricating the eye. Sir, dry eyes or keratoconjunctivitis sicca is a disease where these layers are absent. And this is most commonly seen with the old age people. They are complaining of foreign body sensation in the eye. Despite you checking the eye, you will find nothing. Plus you will see the redness in the eye. Can't tolerate fan or AC, symptom worsens in the evening. You have performed a test, my dear friends. You are performing a test, my dear friends, that is rose Bengal dye positive, sir. Rose Bengal dye positive, sir. Rose Bengal dye positive. And tear breakup time is less than 10 seconds. Tear breakup time is less than 10 seconds. Less than 10 seconds. Less than 10 seconds, my dear friends. And treatment is artificial tear supplementation, that is methyl cellulose. नहीं, ठंड नहीं लग रही क्योंकि मैं क्लास ले रहा हूँ हैदराबाद से, जहाँ पे बिल्कुल भी ठंड नहीं है, तो आपको फिक्र करने की जरूरत नहीं है, बिल्कुल ठीक है। चलिए, xerophthalmia, grading of xerophthalmia, my dear friends. XN night blindness, X1A conjunctival xerosis, X1B is Bitot spot, and Bitot spot is because of which vitamin deficiency? Remember, first name is longer name, that is conjunctival xerosis, and second is X2, that is corneal. Then 3A, 3B, corneal ulcer. Corneal ulcer less than 1/3 is 3A, more than 1/3 is 3B. S is corneal scar. XF is xerophthalmic fundus, and treatment to such condition happening is vitamin A, and Bitot spot is a deficiency of vitamin A itself. We have learned yesterday only. Now, two type of conjunctival degeneration is a peninsula is the fatty degeneration. You will see a bump right here, and pterygium is a bird wing-like flag. If asymptomatic, my dear friends, so no treatment. If symptomatic, you have to do the excision. Next is coming to the conjunctivitis. Conjunctivitis, sir. Conjunctivitis. Okay? Conjunctivitis, sir. Most common cause is viral. The different type of conjunctivitis we have to talk about right now, sir. Yes, sir. Epidemic keratoconjunctivitis, pink eye, Madras eye, shipyard eye, caused by adenovirus. Viral is most common. हम चश्मा लगा लेते हैं, आंखें लाल हो जाती है. So it easily spreads from one person to another person. ठीक है. So this is a mostly infectious and spreads very fast. Acute hemorrhages. Acute hemorrhagic conjunctivitis, easy way to remember is whenever there is a hemorrhage, we'll go to the Apollo hospital. The causative will be Apollo virus, enterovirus 70. Ophthalmia neonatrum, we have talked yesterday also, sir. Ophthalmia neonatrum is caused by a bacteria called as, can you tell me the answer? Ophthalmia neonatrum is caused by Neisseria gonorrhea, but other causes are also there. That is within 24 hours, 3 to 5 days and 5 to 14 days. Within 24 hours it is happening because of the chemical conjunctivitis by the silver nitrate. 3 to 5 days it is happening because of the Neisseria gonorrhea, and after 3 days, 5 days, that is 5 to 14 days, this is happening because of the chlamydia trachomatis. And now the chlamydia trachomatis is eliminated from India. So chances are less you'll have in this ophthalmia neonatrum. Let's talk about the next disease, that is called as what's your trachoma. So trachoma is the most common infectious disease of the infectious cause of the blindness, caused by chlamydia trachomatis. Triad, we are having redness, watering and photophobia, but the main important is hallmark and safe strategy. What we follow, those all are the question asked in the exam. Now this is called as sago grain follicles. These are the pits right here called as Herbert pits, and this scarring is called as Arld's line, my dear friends. Now here the treatment strategy which we follow is a safe strategy, my dear friends. Safe strategy. What is that? Surgery. A for drug of choice, azithromycin, facial hygiene and environmental sanitization. Blanket therapy to prevent other people having this. This is 1% tetracycline ointment. 1% tetracycline ointment, my dear friends. Now WHO grading of trachoma is also important. Fisto, like safe, remember the fisto. What is fisto? Follicles more than 5, infection caused by chlamydia trachomatis, scarring, that is Arld's line, trichiasis means misdirected ileus, and opacifications you are going to see. Next disease what we have to talk about is spring cataract or vernal keratoconjunctivitis. My dear friends, spring cataract or vernal keratoconjunctivitis is because of the allergic condition. So which season you are going to think of? Spring season. That is why spring cataract. Here you are going to see the cobblestone papillae, cobblestone. You can very well see like cobblestone papillae. Ropey discharge is going to happen from them, sir, and shield ulcers you are going to see, sir. This is shield ulcer you are going to see, sir. Sir, treatment के अंदर sodium chromoglycate, that is a mast cell stabilizer plus topical steroid we have to give, sir. Coming to the next one is cornea. Cornea is having 5 layers. In this, the important is Bowman's layer which can't repair itself, scar formation. Stroma is for the thickness and endothelium layer is for the maintenance of the transparency. Okay? Maintenance of the transparency. Now, question comes about the corneal donation. Corneal donation, what it requires and what is a favorable condition to donate a cornea, how to save it so that further it can be used. HLA matching is required, your answer is not required. Must donate within 6 hours. And cornea can be preserved after extracting it out. So how? 2 medias are there, they are your exam question. Macaulay-Kaufman we can save up to 96 hours and Optisol GS we can save up to 14 days. Now what is the normal cells in a living person? That is 3000 cell per millimeter square, but for a donation it requires at least more than 2000. And what is contraindicated where you will not take? Remember HIV, HSV, hepatitis B. HSV, HIV and hepatitis B, you will not take cornea of these people. Chalo, let's move on to the corneal ulcer. The next topic is what's your corneal ulcer. In this, number 1 is acanthamoeba, the most painful condition most commonly asked in the exam, my dear friends. Seen in the contact lens user, that is why ring shape ulcer is there. Most common cause is a pseudomonas. Pseudomonas, and most painful condition, drug of choice is cycloplegic drugs. Cycloplegic does. Cycloplegic does. Contact lens user के अंदर ही pseudomonas infect करता है. Bacterial keratitis, most common cause in world is Staphylococcus. In India, Streptococcus pneumoniae. You will see a hyphae which is not a fixed hyphae. Treatment is 4th generation fluoroquinolones. On the other hand, fungal keratitis, most common cause for fungal keratitis is aspergillus. Here you will have a finger-like projection, fixed hypopyon, satellite lesion. satellite lesion, satellite lesion, satellite. Treatment is natamycin. Treatment is what's a natamycin. HSV keratitis, dendritic ulcer, HSV1 or HSV2? Your answer is HSV1. HSV1 antiviral therapy we are going to give, sir. सर नॉन हीलिंग अल्सर के लिए क्या करते हो? केराटोप्लास्टी. और अगर छोटी परफोरेशन हो 1 mm की तो साइनोएक्राइलेट ग्लू ओनली वी विल यूज. व्हाट इज दिस केराटोकॉनस? अगर आपके कॉर्निया के सेंटर में हो जाए थिनिंग, जिसकी वजह से योर कॉर्निया विल लुक लाइक दिस इज कॉल्ड एज केराटोकॉनस. Progressive thinning of the center of the cornea will lead to cone shape cornea. Sign are Munson's Fleischer Bogot. ट्रीटमेंट में सबसे पहले ग्लास देने की कोशिश करनी, ग्लासेस लगा के, फिर आरपीजी लेंस यूज कर सकते हैं. इफ नॉट गेटिंग रिजॉल्व देन यू विल गो फॉर केराटोप्लास्टी. नेवर एवर डायरेक्टली जंप टू द केराटोप्लास्टी. स्टेप बाय स्टेप अप्रोच शुड बी देयर. नाउ लेट्स टॉक अबाउट रिफ्रैक्टिव सर्जरी. सर रिफ्रैक्टिव सर्जरी में लैसिक्स we can do for the refractive errors, but there is a contraindication, that is keratoconus. If keratoconus is there, the LASIK is contraindicated. LASIK is contraindicated. So now optic neuritis, also called as papillitis. Sir, inflammation of optic nerve, multiple sclerosis is the most common cause. Disc edema is going to see, and the patient is going to complain कि मेरी movement के साथ में दर्द हो रहा है optic neuritis की तरफ. IV methylprednisolone steroid we have to give. Retrobulbar, behind the optic nerve, optic disc, behind the optic disc there is a optic nerve. अब optic nerve पे inflammation हुई है तो patient is becoming blind and doctor is not able to find anything because it is happening behind the optic disc. So behind optic disc, so doctor is also blind, not able to see the finding, and patient is also blind because behind the optic nerve it is happening. Here again the drug of choice is IV methylprednisolone. Inflammation is happening, steroid दोगे, most commonly it will resolve. Toxic amblyopia. What do you mean by amblyopia? Lazy eye. If eye is lazy, we do the occlusion. जो eye lazy है उससे काम कराएंगे, it will become. Or how it is happening? Smoking, alcohol. Treatment में क्या करेंगे? Antioxidant add करेंगे, vitamin B12 add कर देंगे. This is going to help now, sir. Help now, sir. Sir, Argyll Robertson, which is prostitute people, and Eddie's tonic. What is the difference between these two? If you see the diagrammatic, upper one is for the Argyll Robertson, and second one is for Eddie's tonic. Sir, pupil is constricted, here pupil is dilated. Pupil is constricted, here pupil is dilated. Rest everything is same. Accommodation power is present. Accommodation power is present. Here also it is present, accommodation power. Light reflex is absent. Here also light reflex is absent. The only difference is this is constricted, this is dilated. Constricted and dilated. Constricted and dilated, my dear friends. And how to check? Pilocarpine test. Aedes tonic. If we put a pilocarpine, the eye, the dilated eye will become normal. The size will become normal, sir. Then coming on to the next, in Horner syndrome. Can you tell me what we have studied yesterday in the Horner syndrome? P male. What are the feature of Horner syndrome? P male, that is ptosis, meiosis, anhidrosis, loss of ciliospinal reflex, and an ophthalmos. Horner syndrome के लिए टेस्ट कौन सा किया जाता है? कोकीन टेस्ट. तो कोकीन क्या करेगी? डायलेट करेगी. तो इसमें हॉर्नर सिंड्रोम में मियोसिस हो रही है. आफ्टर गिविंग कोकीन द आई विल डायलेट. सो एबनॉर्मल आई विल बिकम नॉर्मल, एंड एबनॉर्मल आई विल बिकम नॉर्मल, एंड नॉर्मल आई विल बी डायलेटेड. नॉर्मल आई विल बी डायलेटेड. पेप्लियोडीमा, डिस्क एडीमा, रेज इंट्राक्रेनियल टेंशन, वर्स हेडेक, प्रोजेक्टाइल वॉमिटिंग, sixth nerve paralysis is seen, vision is normal, enlargement of blind spot is seen. Treatment is acetazolamide. Papilloedema. Now visual field defect we have to talk about, sir. Visual field defect, yes, visual field defect. Optic nerve पे lesion हो जाए तो monocular blindness, एक साइड दिखेगा एक साइड नहीं दिखेगा. Second is हाँ मूड फ्रेश करता हूँ अभी तुम्हारा. Optic chiasma, बाइटेम्पोरल हेमिनोपिया, यू कैन वेरी वेल से लेटरल साइड नहीं दिख रहा है. ऑप्टिक ट्रैक्ट पे अगर लीजन हो जाए, होमोनिमस हेमिनोपिया, एक साइड का मीडियल साइड, दूसरी साइड का लेटरल साइड इज गॉन, सर. ना डार्क रूम प्रोसीजर, अंधेरे के अंदर करने जाने वाले प्रोसीजर, ठीक है, अंधेरे में, ठीक है. डार्क रूम प्रोसीजर के अंदर रेटिनोस्कोपी, टेस्ट ऑफ रिफ्रैक्टिव एरर, पिन होल डायमीटर. दिस इज रेटिनोस्कोप. पिन होल डायमीटर इज 1 millimeter and distance from which is designed in 1 meter. Now different type of retinoscopic examination we do, sir. Distant direct ophthalmoscopy, distant direct and indirect. Distant direct, direct and indirect. This is how we are dividing it into, sir. Sir, remember, distant direct distance is 25. Normal eye, you will see red glow. Retinal detachment, gray glow. Vitreous hemorrhage, sir, no glow. And cataract and opacity, very important topic for the exam. नॉर्मल आंख आपको कैसे दिखेगी? लाल लाल दिखेगी सर. डिटैचमेंट हो जाएगा तो ग्रे ग्रे दिखेगी. विट्रस हीमोरेज आएगा तो कोई ग्लो नहीं दिखेगा. और अगर कैटरैक्ट है या ओपेसिटी है तो ब्लैक ग्लो देखने मिलेगा. क्या देखने मिलेगा? ब्लैक ग्लो देखने मिलेगा. ठीक है. अरे भैया अभी थोड़ी है क्रिसमस, अभी से मनाने लग गए तुम. 24 तारीख की रात को और 25 तारीख के दिन और रात को क्रिसमस है. सेंटा क्लॉस आएंगे और सेंटा क्लॉस हमें क्या देके जाएंगे? बुद्धि, सब्र, मेहनत करने की ताकत, ठंड से लड़ने की ताकत देके जाएंगे, ताकि हम एनबी के पास जाके पासिंग सर्टिफिकेट लाके अपने पेरेंट्स को दे सकें और अपने घर की नंबर प्लेट बदलवा सकें, अपनी गाड़ी पे लोगो लगा सकें और लोगों के फ़ोन में आपके नंबर के पहले डॉक्टर लिखवा सकें. उन सब चीज़ों को करने के लिए आपको धैर्य रखना है और मेहनत करते रहनी है और रुकना मना है. रुकना मना है सर. ठीक है. चलिए, डायरेक्ट ऑप्थेल्मोस्कोपी, डिस्टेंट डायरेक्ट. डायरेक्ट सर, द डिस्टेंस इज नॉट फिक्स्ड. द डिस्टेंस इज नॉट फिक्स्ड. हर्षिका कह रही है संता आएंगे क्वेश्चन दे के जाएंगे. यस उर्वी, संता आएंगे क्वेश्चन दे के जाएंगे, है ना. और फिर एक संता एनबी वालों के पास जाएंगे जो बता देंगे दूसरे वाले संता ने तो वहाँ क्वेश्चन दे दिए हैं तो क्वेश्चन बदल लो, पेपर टफ कर दो. वो भी हो सकता है ना. तो ऐसा नहीं कर. संता से क्वेश्चन नहीं मांगने हैं, बोलना बस तुम हमें बुद्धि दे दो, बहुत है, क्वेश्चन हम सॉल्व कर लेंगे. ठीक है साहब. Now quality is virtual, erect and magnified, and magnification is 15x. Now indirect, the distance depend on the length of the arm of a doctor. ठीक है. चलो, thank you so much. Distance is arm of a doctor, magnification is 5x, quality is real, inverted and magnified. Real, inverted and magnified. This completes our third subject, my dear friends. आज जाने की जिद ना करो, हाय मर जाएंगे, हाय रंग जाएंगे, ऐसी बातें किया ना करो. आज जाने की जिद ना करो, अभी अभी तो आए हो, बाहर बन के छाए हो. तो पढ़ लो अब. ठीक है. चलो my dear friends, let's talk about the next subject and that is going to be the anesthesiology. एनेस्थीसिया के बाद पक्का ब्रेक लेंगे. ठीक है. चलो. जिंगल बैल जिंगल बैल, ठीक है. चलो. प्री ऑप ऑर्डर्स, हर एक सर्जरी से पहले प्री ऑप ऑर्डर्स बहुत ज़्यादा ज़रूरी होते हैं. रिटन एंड इन्फॉर्म कंसेंट आज ही पढ़ा. एनपीओ कब कब रखना है, दैट इज़ ऑल्सो वेरी इंपॉर्टेंट. सर, क्लियर फ्लूइड 2 घंटे पहले, ब्रेस्ट मिल्क 4 घंटे पहले और गाय का दूध 6 घंटे पहले. गाय के दूध के साथ कॉफ़ी वगैरह ये सारी 6 घंटे पहले. अंडा, डोसा, चावल 6 घंटे पहले और मीट, मुर्गा, समोसा 8 घंटे पहले. फॉर अ सेफर साइड इन द हॉस्पिटल प्रैक्टिस वी डू 8 आवर्स पहले. ठीक है. 8 आवर पहले सर. ठीक है. सेफेस्ट वन. ठीक है. सेफेस्ट वन सर. चलिए. नाउ ड्रग दैट नीड टू बी स्टॉप प्रायर टू द सर्जरी. ऐसे कौन से इंपॉर्टेंट ड्रग्स हैं जो सर्जरी से पहले हमें रोकने होते हैं? व्हाट आर दोज ड्रग्स सर? सबसे पहले एनपीयू की गाइडलाइन आपको पता चल गई. क्लियर फ्लूइड होगा अगर, ठीक है, क्लियर फ्लूइड होगा अगर, तो पानी वगैरह ये सारी चीज़ें, कोकोनट वाटर आ जाएगा इसके अंदर, ग्रीन टी आ जाएगा, है ना, जूसेस आ जाएंगे. फिर ब्रेस्ट मिल्क 4 घंटे और फॉर्मुलेटेड मिल्क आपका 6 घंटे. ठीक है. और आपका जो मीट, मुर्गा, अंडा वगैरह है, आपका पिज़्ज़ा है, आपका डोनट है, ये सारी गंदी गंदी चीज़ें जो है 8 घंटे. ठीक है. चलो जी. Now sir, drug that need to be stopped prior to the surgery. First of all, oral antihypertensive drug. You can continue till the day of surgery except ACEs and herbs. ACEs and herb on the day of surgery you don't have to give. First thing, oral hypoglycemic drug. Okay, OHS. ठीक है. Now, minor surgeries omit the last dose. Major surgeries omit the last dose and shift that patient to insulin to maintain the blood glucose level. To maintain the blood glucose level, sir. Blood glucose level, sir. Then third is antipsychotic, antidepressant and anti-epileptic. You can continue till the last day of surgery except TCA, tricyclic acid. Stop 3 weeks prior to surgery. See, 3 alphabets are coming in this, 1, 2 and 3. So stop 3 weeks prior to the surgery. Lithium you should stop 24 hours prior to the surgery. So yes, antipsychotic drug, depressant and the anti-epileptics you can give till the day of surgery, but you need to stop TCA, that is 3 weeks prior to the surgery, lithium 24 hours prior to the surgery, sir. Now thyroid medication you can continue till the last day of surgery. सर्जरी के दिन तक भी आप उसको कंटिन्यू कर सकते हैं. एंटीकोगुलेंट्स, माय डियर फ्रेंड्स, एस्पिरिन कंटिन्यू टिल द डे ऑफ सर्जरी. क्लोपिडोग्रिल 4, C is sounding like a 4, so 4 से 5 दिन prior to the surgery. Yes, बिल्कुल. अलीशा, चैम्पागेन, yes, it is important. Low molecular weight heparin 12 hours prior to the surgery. 12 hours prior to the surgery. ठीक है. लो मॉलिक्यूलर वेट हेपेरिन, हमें लो लगता है दिन में रात में 12 बजे, तो 12 बजे पहले. अनफ्रैक्शनेटेड हेपेरिन 6 आवर प्रायर टू सर्जरी. तो लो मॉलिक्यूलर 12 घंटे, अनफ्रैक्शनेटेड जो है वो 6 घंटे पहले. वॉरफेरिन एटलीस्ट 3 to 4 days प्रायर टू द सर्जरी. 3-4 लोग मिलकर लड़ाई लड़ रहे होते हैं, तो एटलीस्ट 3 to 4 days प्रायर टू द सर्जरी वी नीड टू स्टॉप दिस. वी नीड टू स्टॉप दिस 3 to 4 days प्रायर टू द सर्जरी. सर complete, done. So these are the drugs which we need to stop prior to the surgery. ठीक है. Now my first question to all of you, the antihypertensive which we do not give on the day of surgery are, my first question, antihypertensive drug which do not give on the day of surgery are, yes please let me know. Antihypertensive drug which we do not give on the day of surgery are AZs and ARBs. AZs and ARBs. Sir, thyroid medication we can give till the day of surgery. Yes or no? 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 Thyroid medication, yes, we should continue. My next question is, lithium need to be stopped when before surgery? Lithium need to be stopped when before the surgery? Lithium need to be stopped when before the surgery? Lithium 24. Sir, low molecular weight heparin, लो मॉलिक्यूलर वेट हेपेरिन कब स्टॉप करना होता है? लो मॉलिक्यूलर वेट हेपेरिन कब स्टॉप करना होता है? लो मॉलिक्यूलर वेट हेपेरिन, लो मॉलिक्यूलर वेट हेपेरिन, यस, लो मॉलिक्यूलर 12 लो मॉलिक्यूलर वेट हेपेरिन 12 hours prior to the surgery. Sir, unfractionated heparin, when we need to stop unfractionated heparin? Unfractionated heparin 6 hours prior to the surgery. 6 hours prior to the surgery. 6 hours prior to the surgery. Moving on to the next topic is anesthesia. Sir, welcome. Chali. Anesthesia is what, sir? Your loss of sensation is anesthesia. Now there is an excitatory neurotransmitter and inhibitory. Who is excitatory? Glutamate. We are dividing this anesthesia into 3 forms. What is regional, general and your local anesthesia. Regional is further divided into 2. One is epidural and one is spinal anesthesia. They do not cross the blood-brain barrier. That is why no sedation is there. No sedation is there. General anesthesia, yes, they have some IV, they have some inhalational agents. Yes, they can cross the blood-brain barrier, sir, and yes, they can cause the sedation. They can cause the sedation. They can cause the sedation, sir. Done, sir? Now, sir, regional anesthesia, or you can say central neuraxial block. Regional anesthesia, they cannot cross blood-brain barrier, no loss of consciousness, and we are having spinal and epidural. Two types are there, sir. Spinal and epidural. So my dear friends, spinal, in the spinal, what structures we are piercing and we are going till what space? So remember, after skin, you have to remember Silda. Now S for skin, S for subcutaneous fascia, S for supraspinatus ligament, L for ligamentum flavum, D for dura mater, A for arachnoid mater. After arachnoid piercing, you are reaching a space called as subarachnoid space. Subarachnoid space. You are reaching to a space called as subarachnoid space. Subarachnoid space, sir. Clear ho gaya funda? So you are right starting, and the last structure what you are piercing is a arachnoid mater. Then you are reaching the subarachnoid. And in the adult side is L3, L4. In children, it is slightly lower, because in children, the spinal cord is little bit on the lower side. That is why in the children, we pierce from the lower side, that is L4, L5. In the adult, it is L3, L4, L3, L4. Now, sir, pierce till, your answer is subarachnoid space. Pierce till, your answer is subarachnoid space. Tak tear karna hai, aur usse pehle kisko tear karna hai? Arachnoid matter ko. Now, indication, any surgery below the level of umbilicus. This indication is same for the epidural also, sir. This indication is same for the epidural also, sir. The needle which we use right here, sir, Quincke's, Whitecare and Sporty. Quincke's needle is dura cutting needle, Whitecare is for dura splitting needle, and another which is oval shaped head you are seeing right here is a Sporty needle. It is a Sporty needle, sir. Sir, Quincke is a dura cutting, Whitecare is a dura splitting, and Sporty is a this oval shaped needle you are seeing right here, sir. Now coming on to the epidural anesthesia. This is again a catheter based technique. इसमें catheter डाल दिया जाता है और drugs दिए जाते हैं. My dear friends, the site is thoracic and lumbar vertebra. You have to pierce take ligamentum flavum. Ligamentum flavum, that is SIL only. Skin, subcutaneous fascia, then SIL. L for infraspinatus, then ligamentum flavor. After ligamentum flavor, you are going to enter a space called as epidural space. Epidural space. Epidural space, sir. Indication is same as spinal anesthesia, that is any surgery below the level of umbilicus. And here the needle used right here is a Tuhi's needle. Here the needle used is going to be what, sir? Your Tuhi's needle. Tuhi's needle. Now complication of regional anesthesia: hypotension, bradycardia, respiratory distress, urinary retention. Systemic toxicity can only be seen with the epidural. Why? The systemic toxicity can only be seen with the epidural, because epidural you are not entering directly into subarachnoid space. So where you have to inject more drug. The more the drug you are giving, the more systemic toxicity will be there, sir. What are the absolute contraindication? Increase ICP, infection, hypovolemic shock, patient nahi lagana chahta, cardiac disease, coagulation disorders. So these are some complications. These are some complication. ठीक है? चलो. Now general anesthesia can cross blood-brain barrier. No loss of consciousness, yes, present. Now what are the components of the general anesthesia? पहला component is loss of consciousness, because the person should be unconscious. Then there should be a loss of reflex, then no memory, muscle should relax, and there should be no pain. These are the 5 important components. Yes, what are those? First is loss of consciousness, loss of reflex, amnesia, no memory, the muscle should relax, and analgesia, no pain also should be there. Steps of general anesthesia. How general anesthesia there? Okay? How general anesthesia is there, sir? 3 to 5 minutes पहले ऑक्सीजन देना है. फिर induction and maintenance you have to choose. Induction is by IV or inhalational agent, and maintenance is by continuing the general anesthesia. Continuing the general anesthesia. Continue the general anesthesia, sir. Now reversal agent. How we will reverse it? Either we will stop giving, half life will go, and the patient will be in the If we want the reversal, if it is not happening that way, we have to give the agents like flumazanil, which is GABA antagonist. GABA क्या करता था? सुलाता था, inhibitory. अब inhibit को रोकने वाला एक agent चाहिए, that is your flumazanil, the GABA inhibitors. Also we can use neostigmine, sugamate for the neuromuscular inhibitor reversal. जो muscle relaxant हमने दिए हैं उसके लिए sugammadex होता है, medi नहीं होता, ठीक है. Now local anesthetic, loss of sensation is from particular area, for example lignocaine, है ना, lignocaine की जेली लगाते हैं, ठीक है. चलो, और उसके बाद रिमेंबर दिस lignocaine का मैकेनिज्म इज सोडियम चैनल ब्लॉकर, सोडियम चैनल ब्लॉकर, ठीक है. ठीक है. चलो, उसके बाद इनहेलेशनल एजेंट्स की बात करेंगे सर. Halothane, isoflurane, CO, des, enflurane and methoxyflurane. Out of them, methoxyflurane is most potent but never used because of nephrotoxicity. They all release fluoride. They cause arrhythmia, kidney damage, hepatotoxicity. More or less, that is something different, sir. More or less, that is something different, sir. ठीक है. चलिए, एक पोएम है बड़ी बचपन की, कहते हैं लकड़ी की काठी काठी पे घोड़ा, घोड़े की धुम पे जो मारा है थोड़ा, दौड़ा 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 धूप उठा के दौड़ा. ठीक है. चलो, उसके बाद आ जाइए सर, minimum alveolar concentration. So how to remember this minimum alveolar concentration, my dear friends? Remember, this MAC is inversely proportional to potency. ज़्यादा MAC, more the MAC, less is going to be potency. More the MAC is and less is going to be the potency, my dear friends. Less is going to be the potency, my dear friends. And how to remember? HISD, HISD. Then xenon, nitrous oxide, छोड़ो. HISD is important. Now H for halothane, H for hello. Hello बोलना is important, तो remember most potent is halothane. If halothane is most potent, तो halothane's potency is going to be the less. ठीक है. If halothane is most potent, the halothane का MAC is going to be less. MAC is going to be minimum. So same way it will go to left to right side. ठीक है. ठीक है. चलो. Now sir, blood gas solubility. Blood gas solubility. Blood gas solubility. Now blood gas solubility is inversely proportional to the speed. जितना ज़्यादा blood gas के साथ मिलेगी उतनी कम speed हो जाएगी. So here the mnemonic is DSIH. D for दौड़ा दौड़ा, तो दौड़ा दौड़ा मतलब डेसफ्लोरेन की स्पीड सबसे ज़्यादा है, फिर सीवो, आइसो, फिर हेलोथेन. तो अगर स्पीड सबसे ज़्यादा है तो ब्लड गैस सॉल्युबिलिटी सबसे कम किसकी होगी? डेसफ्लोरेन की होगी. दिस इज हाउ यू हैव टू रिमेंबर. DSIH, not dish. Halothane. Now let's talk about the gases one by one. Halothane. So this is a second best used in the children. Halothane is a second best used in the children and stored in the amber color bottle. और हार्ट में क्या कराता है सर? अरिदमिया. लीवर में क्या कराता है? Hepatotoxicity. But lungs में क्या कराता है? ये bronchodilation. That is why this can be used in asthma patient. Asthma patient, sir. Halothane, second best in the children. Now my question is, who is the first best gas in the children? And your answer is going to be the sevoflurane, sir. Before that, let's learn about the isoflurane, sir. Sir, this isoflurane is not used in the children. It is an agent of choice for cardiac and the neurosurgeries. Agent of choice for the cardiac and the neurosurgeries. Sir, desflurane, as dirty as Gautam Nagar Nala. So remember, this is a foul smelling, can cause a dyspnea. Best use for the neurosurgeries, but can be used in the others also. Others also. ठीक है. Then it is going to be the maximum greenhouse effect. Greenhouse effect. And this is best for the maintenance of the anesthesia, sir. Desflurane is best for the maintenance. आपने एनेस्थीसिया दे दिया, अब उसको मेंटेन करने के लिए आप डेसफ्लोरेन की थोड़ी थोड़ी गैस छोड़ते रहोगे सर. Sevoflurane is a sweet smelling, best in children, given everywhere, just avoided in the renal patients, sir. Given everywhere, just avoided in the renal patient, my dear friends. Then coming to, ठीक है, xenon. ठीक है, xenon is like a ex-girlfriend or ex-boyfriend. Everything was better, बट ओनली प्रॉब्लम वाज खर्चे, एक्सपेंसिवनेस नहीं झेली जा रही थी, तो ब्रेकअप हो गया. सो xenon यू शुड रिमेंबर लाइक दिस, xenon इज आइडियल एनेस्थेटिक गैस, लोएस्ट ब्लड गैस सॉल्युबिलिटी, तेज भी थी, कोई ग्रीन हाउस इफेक्ट भी नहीं था, स्टिल वी कैन नॉट यूज इट बिकॉज इट इज वेरी वेरी एक्सपेंसिव. इट इज वेरी वेरी एक्सपेंसिव, वेरी वेरी एक्सपेंसिव सर. Now coming to the nitrous oxide, my dear friend, nitrous oxide, it contain oxygen, so can cause fire. This is why this is contraindicated in laser surgeries. It can expand closed cavities, that is why it is contraindicated in pneumothorax, pneumoperitoneum and intestinal obstruction like your intussusception. Pin index and MAC we are going to talk later on. MAC बहुत ज़्यादा है, इसलिए nitrous oxide is going to be less potent. If nitrous oxide is less potent, the nitrous oxide is not going to produce general anesthesia alone. So nitrous oxide is the first gas who required a more potent gas, for example halothane. So nitrous oxide is the first gas, nitrous oxide is requiring a second gas which is a halothane, and they both are going inside the body producing anesthesia, and then they both are coming out taking third gas, and that is oxygen. So first gas, second gas, third gas, and once oxygen is coming out, there is a third gas effect. And what is that? Diffusional hypoxia, which is also called as Fink effect. Diffusional hypoxia, which is also called as Fink effects. Okay, chalo. Now this is what I was explaining you, which is written right here. Nitrous oxide is having maximum max, so less potency, hence it fails to cause general anesthesia alone. So it take help of a other anesthesial agent like halothane, which is a potent gas, to cause the second gas effect. When they both are coming outside, they are getting oxygen with them, and this will cause a diffusional hypoxia, which is known as third gas effect or Fink effect, my dear friends. Now in the day care surgery, if we talk about the gases part, desflurane, isoflurane, sevoflurane we can use, and day care surgery में IV agent के अंदर propofol is a raja, followed by midas and alfentanil, midas and alfentanil, midas and alfentanil, sir. Now coming on to this table, this is based on this only. Here is contraindicated, rest we can use. ठीक है, चल चल. Let's move on to the next one. IV anesthetic agent की बात करेंगे तो सबसे पहले we are going to talk about the thiopentone sodium. Sir, this thiopentone sodium is have a smell like garlic, लहसुन जैसी खुशबू. कैसी सर? लहसुन जैसी खुशबू, लहसुन जैसी खुशबू. एजेंट ऑफ अ चॉइस इन न्यूरोसर्जरी एंड लॉस ऑफ कॉन्शियसनेस. जब आप वेन से देते हो तो दिमाग तक जाने में ओनली टेक 11 सेकेंड्स. इट इज कॉन्ट्राइंडिकेटेड इन पोरफायरिया, हाइपोटेंशन एंड हार्ट ब्लॉक. सर कलर इज येलो, कलर एमॉर्फस पाउडर इज गोइंग. थायोपेंटोन सोडियम, लहसुन जैसी खुशबू, और न्यूरोसर्जरीज के लिए यूज होती है. प्रोपोफॉल, सर प्रोपोफॉल, प्रोपोफॉल इज व्हाट सर? योर गाबा रिसेप्टर एंड गाबा रिसेप्टर पे काम करती है. ठीक है, प्रोपोफॉल गाबा रिसेप्टर पे काम करती है. तो गाबा क्या कहता है? इनहिबिटरी न्यूरोट्रांसमीटर है सर. ठीक है. कलर, कलर इज मिल्की वाइट, कलर इज मिल्की वाइट. ठीक है. सिद्धि के लिए गाना, हाँ बहुत बढ़िया गाना आया है. छोड़ दो आंचल, जमाना क्या कहेगा हो. Composition, composition, diisopropyl alcohol plus EGS. EGS stands for egg lecithin, glycerin and soybean oil. Soybean oil. This is a composition of a propofol, sir. Propofol, sir. Propofol, sir. Agent of choice. Agent of choice is, agent of choice for daycare surgery. Prolonged infusion can cause urine green color का, और दर्द होता है जहां पे डालते हैं. प्लस टीवा, एग्जाम क्वेश्चन, टोटल इंट्रावेनस, दैट इज इंडक्शन एंड मेंटेनेंस, बोथ कैन बी डन विद द हेल्प ऑफ टीवा. बोथ कैन बी डन विद द हेल्प ऑफ टीवा. टीवा. ठीक है. कीटामाइन, मैकेनिज्म ऑफ एक्शन इज एनएमडीए. एंड एनएमडीए एक्साइटेशन वाले के रिसेप्टर है, एनएमडीए को एंटागोनिस्ट कर दिया तो मतलब क्या, ब्लॉकेज होगा. ठीक है, दिमाग सोएगा. दिस इज हैविंग अ वेरी स्पेशल effect called as dissociative anesthesia effect, which effect is very special. Right here is dissociative anesthesia effect. Sir, eyes are wide open but no memory, no pain. This is called as dissociative anesthesia. Dissociative anesthesia, dissociative anesthesia. It is contraindicated in neurosurgery. Contraindicated in neurosurgery, sir. Then used in shock and asthma. It is used in shock and asthma. Shock and side effect is post-op hallucination. कीटामाइन का इंजेक्शन लगाओ तो जैसे मरीज उठता है उसको क्या हेलुसिनेशन होने लग जाती है, कुछ कुछ दिखने लग जाता है, सुनाई देने लग जाता है. Next is etomidate, only CSF stable, avoided because it causes adrenal suppression. ठीक है, एड्रिनल सप्रेशन कराता है, लाइक फ्रीडशन सिंड्रोम की अंदर होता है. ठीक है, चलो. Coming to the neuromuscular blockers in the anesthesia, important topic for the exam, sir. Sir, neuromuscular blockers, what they are doing, sir? Depolarizing and non-depolarizing. Sir, depolarizing, what is it? Depolarizing, what we are having? Succinylcholine and succinylmethonium. And non-depolarizing, we have pan-vacu atra. So depolarizing के अंदर what is happening? There is a contraction, there is a no contraction, then relaxation. So because there is a contraction in the depolarization, yes, there is a pain present. And one phenomena is there, muscle of 4 phenomena, train of 4 phenomena which record the muscle relaxation pattern. So वो यहाँ record नहीं होता है क्योंकि relax होने से पहले वो contract कर रहा था. Now non-depolarizing, which only relaxes, they do not contract. Here the pain is absent. Plus along with the pain is absent, there is going to be along with the pain is absent, there is going to be the train of 4 response which is present. So here you have to remember, pain is present in depolarizing, D for dard, D for depolarizing, and non-depolarizing में नहीं होता दर्द, and train of 4 जहाँ दर्द नहीं होता वहाँ train of 4 present होता, जहाँ दर्द होता वहाँ train of 4 present नहीं होता, वहाँ present नहीं होता. Please join our Telegram channel for the PDF, my dear friends. Now non-depolarizing, long acting, intermediate acting and fast acting. Long acting, intermediate acting and fast acting. My dear friends, long acting, if we have to talk about, doxa is better answer than pancuronium. Intermediate acting, veku, roku, atra. This atra is very special previous year question. What is that? There is a Hoffman degradation. What do you mean by Hoffman degradation? Hoffman degradation is non-enzymatic breakdown. Bina enzyme ke tootta hai, that is shown by a special property of a non-depolarizing muscle relaxant. Fast acting में we are having rapa, rap, gapa, gap. Local anesthetic, we are dividing it into amides and esters. Amide and esters. Amide and esters, my dear friends. If we talk about amide and esters, you will see amides के अंदर you will see there is a 1 eye. And ester के अंदर 1 eye, amide के अंदर you are seeing a 2 eyes. 2 eyes are there, sir. 2 eyes are there, sir. Now these all are metabolized by liver except cocaine. The cocaine is metabolized by pseudocholine esterase. This is again a question. This is how you will find a question, sir. Now, what is the management of systemic toxicity of a local agent? Another previous year question coming. This is symptomatic treatment. Whatever symptoms are there, treat them plus 20% intralipid emulsion you have to give, sir. 20% intralipid emulsion you have to give, sir. 20% intralipid emulsion you have to give, sir. Then coming to the local anesthetic agent. Sir, intermediate acting and long acting you have to read right now with me, sir. Sir, intermediate acting is lidocaine. Lidocaine, and long acting Debu is better answer than Bupiva. Bupiva is a most cardiotoxic and they block the sodium channel. They block what, sir? Sodium channel. Sodium channel. Sodium channel. Sodium channel. सबको नहीं बताना होता ये सब बातें, ठीक है? चलो. Now, sir, malignant hyperthermia is the next important topic for the exam. Sir, due to mutation in the ryanodine receptors on the neuromuscular junction on chromosome number 19 and 17, there is an excess release of a calcium. Excess release of a there is an excess muscle contraction because of which there is a increase in potassium, and because of increase in potassium there is going to be the arrhythmia, and if mostly muscles are contracting, the muscle will break down and it will come inside the urine. And remember, this is called myoglobinuria, and drug of choice to malignant hyperthermia is dantrolene sodium. Dantrolene sodium. Dantrolene sodium. Dantrolene sodium. Now triggering agent कौन है? साली. SALI. ये देखो निमोनिक है भाई. ट्रिगरिंग एजेंट कौन है? साली. SALI. साली. तो याद रखना सक्सिनाइल कोलिन All inhalational agent like halothane, isoflurane, CO, desflurane, these are triggering. Plus lignocaine is a triggering agent for the malignant hyperthermia. They are the triggering agent for the hypothermia. Done, sir? Now opioids only used for analgesic property. Best opioid is remifentanil. Now again, like locals, अपना क्या कहते हैं उसे, local anesthetic agent were metabolized by liver except cocaine by pseudocholinesterase. Same here for the opioids. All opioids are metabolized by liver except remifentanil, which is the best opioid, which is metabolized by non-specific esterase. Non-specific esterase. तो दो ऐसे सवाल एग्जाम में याद रखिएगा. Now coming on to the ASC grading, ASA1, American Society of Anesthesiologists की grading आती है, तो याद रखना ASA1 says normal, ASA2 says mild systemic disease, 3 says mild systemic disease, severe systemic disease, 4 says severe systemic disease which is constant threat to life, and sir 5 says moribund, and 6 says declared brain dead. Declared brain dead. Moribund का मतलब है कि आप बिना सर्जरी के सर्वाइव नहीं कर सकते. Now let's move on to a very next topic, a very important topic for the class, and that is going to be the pin index. That is going to be the pin index. Pin index. Pin index कैसे लिखना ऊपर 5 6 7 5 6 7 5 6 7 5 6 7 1 5 2 5 3 5 1 6 2 6 3 6 and 7. This is how you will remember the important pin index. 1 5 is for the air, 2 5 is for the oxygen, and 3 5 is for the nitrous oxide. 1 5 air, 2 5 oxygen, and 3 5 nitrous oxide. Now carbon dioxide 1 6 is more than 7%, 2 6 is less than 7%, and 3 6 is cyclopropane. Antonox, entertainment day, mixture of two gases, oxygen and nitrous oxide, sir. Now color of the cylinder is also very important, and here you will tell me the pin index also. Air is having grey body with black and white shoulder. What is the pin index of the air? You will comment simultaneously in the chat box, my dear friends. All the brave hearts who are just sitting around the corner, round the clock to work hard to see them pass in the exam. My dear friends, next is oxygen cylinder. Yes, Medico, very nice. Oxygen cylinder, we are having black body, white shoulder. We are having what, sir? Black body and white shoulder. Black body, white shoulder. Black body, white shoulder. This black body, white shoulder, we are having a pin index of 2.5, 2.5, 2.5. Then coming to the nitrous oxide. Nitrous oxide is having what, sir? Your blue color, and the pin index of nitrous oxide also you have to comment the 3.5. Then carbon dioxide, gray color. This gas is used in the laparoscopic surgeries. 1 6 and 2 6. 1 6 is more than 7%, 2 6 is less than 7%. So cyclopropane 3 6 is a pin index and color is orange color. Antonox is a mixture of two gases. Pin index is 7. Remember, blue body with the white shoulder. Blue body with the white shoulder. Absolutely correct response you all people are giving. May God bless you all. Thank you so much. Thank you so much for the wonderful answers. Chalo, let's move on to the next part, intubation. Next part is intubation. Sir, intubation के लिए कौन सी position जरूरत है? Sniffing. What is happening in this sniffing position? These two lines are MCQ. Chin is lifted and head is tilted. Chin उठी हुई है, head झुका हुआ है. And remember, if there is an injury to the cervical spine, then you will not use this position. Then what you will do? Jaw thrust position, where the mandible is protruded out, and then you will intubate the patient. Sir. Coming on downward, Malam Patti scoring. This Malam Patti scoring is very, very important to predict the intubation. If you are able to see all the structures, class 1 and class 2, up to the base of the uvula, if you are seeing, that means soft and hard palate you are seeing, plus base of the uvula, yes, you can intubate. If you are not able to see complete uvula, then no, only hard palate, no. Then, so this is Malam Patti scoring. Then laryngoscope, after maintaining the intubation position, after seeing whether you can intubate or not, you have to know the type of laryngoscope you are using, and with the non-dominating hand you do, so that with the dominating hand you can put tube inside. ऐसे पकड़ के ट्यूब डाल सको। तो मक्खन तोश इज मोस्ट कॉमनली यूज इन द एडल्ट, और बच्चों के अंदर मिलर यूज होता है। मिलर इज सीधा और बच्चों एडल्ट का कैसा होता है, टेढ़ा, लाइक दिस, ठीक है, लाइक दिस। मिलर कैसा होता है, सीधा, और बच्चों का कैसा होता है, टेढ़ा सर। डन, चल, थैंक यू सो मच, थैंक यू सो मच। एंडोट्रैकियल ट्यूब, कर्व्ड एंडोट्रैकियल ट्यूब, सबसे पहले इंपॉर्टेंट क्वेश्चन फॉर द एग्जाम, इट इज अ बेस्ट, व्हाई इट इज बेस्ट माय डियर फ्रेंड्स, हम इसका गाना क्यों करें, बिकॉज इट प्रिवेंट्स द एस्पिरेशन, इट प्रिवेंट्स व्हाट सर, इट प्रिवेंट्स द एस्पिरेशन। And what special thing this is having, inflated cup, plus why this extra opening is there, एक छेद तो सर दूसरे की क्या जरूरत पड़ी। दोस्तों अगर ये बंद हो जाए तो इसको सहारा देने के लिए दूसरी ओपनिंग बनाई जाती है। तो एग्जामिनर ने भी इसका जिक्र करा था एग्जाम में, दिस इज कॉल्ड एज मर्फीज आई, दिस इज कॉल्ड एज व्हाट सर, योर मर्फीज आई, दिस इज कॉल्ड एज मर्फीज आई सर, मर्फीज आई। देन कमिंग टू द डबल ल्यूमन एंडोट्रैकियल ट्यूब सर, this is 2020 exam December question. Double lumen endotracheal tube is used for the lung surgeries because this can provide the single lung ventilation. सिंगल एक लंग में आप सर्जरी कर रहे हो, दूसरे में आप जो है ऑक्सीजन दे सकते हो। दिस इज अ स्पेशल फीचर अबाउट दिस। फ्लेक्सियोमेटालिक ट्यूब, व्हाट वी यूज इन द हेड एंड नेक सर्जरीज। फ्लेक्सियोमेटालिक ट्यूब क्यों यूज करते हैं, क्योंकि हेड एंड नेक सर्जरी में आपको सर्वर हिलाना पड़ता है, ठीक है, या प्रोन पोजीशन सर्जरीज हो उसके अंदर यू हैव टू यूज दिस फ्लेक्सियोमेटालिक। द ईएनटी सर्जन आल्सो मोस्टली यूज द फ्लेक्सियोमेटालिक ट्यूब। सर सुप्राग्लॉटिक एयरवे डिवाइसेस लाइक एलएमए क्लासिक, प्रोसील क्लासिक थोड़ा बेकार सा डिवाइस है, कैन नॉट प्रिवेंट एस्पिरेशन, ओके। नाउ प्रोसील इज हैविंग अ small opening where the drain is present and it can prevent the aspiration. LMS Supreme is the best because of the shape, easy to put, and also one more additional feature is there is you can put a gastric tube which will help in a gastric lavage also, which will help in the gastric lavage also sir. Then coming to the iGel, self inflation property होती है इसकी, अंदर डालोगे जितना साइज रिक्वायर्ड होगा उतना ये इन्फ्लेट हो जाता है अपने आप। दिस इज iGel, दिस इज iGel sir. Now this is what happening, this is happening in neuromuscular monitoring sir, and here the nerve test is ulnar test, ulnar nerve sir. Defibrillator, automatic, mechanical, non-breathable mask you can see. Then Guddle's airway and nasopharyngeal airway. Guddle's airway is a oropharyngeal airway sir. Open the mouth in an unconscious patient. Unconscious patient के अंदर मुंह खोलने में काम आता है, ठीक है, कहाँ सारे मुंह नहीं खुल रहा, ठीक है। ओके डन। देन साइज मिड पॉइंट ऑफ इंसाइजर टू द एंगल ऑफ मैंडिबल, यहां से यहां तक इसका साइज नापा जाता है, ठीक है। nasopharyngeal airway indication is conscious patient, because if you will do the nasopharyngeal airway, put the tube in the unconscious patient from the nose, there are chances that you might can injure the nose and you will not come to know, and from the nose, from the posterior side, from the posterior wall, it will go to your lungs, and person can aspirate and person can die, and his size is taken from nose till the ear lobule, Next is Venturi mask. Venturi mask, we can put the vaporizer, also we can control the flow. Ambu bag is for the mechanical ventilation. Now what is this mechanical ventilation? Sir, here you will connect the oxygen, and here you have to put on the mouth of a patient. 1, 2, 3, 4. If your ventilator is not available, this is mechanical ventilation you have to give to your patient, my dear friends. Now coming to the tracheostomy tube, we are talking about, this is tracheostomy tube. We have talked about the indications of tracheostomy tube. Prolonged intubation more than 7 days. Prolonged intubation, any kind of facial trauma, maxillofacial trauma, उसके अंदर हमें tracheostomy tube डालना सर. Any kind of supraglottic cancer which is obstructing the airway, we can put the tracheostomy tube. We can put the tracheostomy tube, sir. ठीक है? Portex tracheostomy tube is the most common, sir. Now, how to approach the difficult airway? सबसे पहले mask ventilation, उसके बाद intubate कर दो हो जाता है, तो फिर अगर intubation में भी दिक्कत आ रही तो laryngeal mask airway. अगर इसके बाद भी नहीं हो रहा तो cannot intubate, cannot ventilate. This is CICV. In this condition, you will go for cricothyroidectomy. Thyroidectomy. So remember, पहले mask ऊपर से, फिर इंटुबेट करने की कोशिश करी, उससे भी नहीं हो रहा तो कम से कम लेरेंजियल एयरवे डाल दिया, LMA प्रोसील ये सब डाल दिया। अगर इससे भी नहीं हो पा रहा, देन इन द लास्ट स्टेप यू विल डू अ क्रिकोथायरोइडेक्टमी। Now Boyle's machine. This is example of a cold close apparatus. Sir, this is example of cold close apparatus. Here you will see what is happening. Your air, your carbon dioxide is getting absorbed inside only, and the absorbent is soda lime. Absorbent is what, sir? Your soda lime. Plus you have a vaporizer also, plus you can humidify, control the flow, you can give the oxygen also. That is why closed surface, closed machines are very important. Boyle's apparatus, what we use in the daily life. Now anesthetic agents which we put in this vaporizer are having different colors. So what different colors we are having, my dear friends? First is halothane. हेलोथेन इज रुकने का कलर कौन सा होता है बेटा? रेड कलर। कौन सा होता है दोस्तों? रेड कलर इज देयर सर। सीवोफ्लोरेन, येलो कलर की सिवैयां, येलो कलर। डेसफ्लोरेन, डर्टी नाला, नाक बंद हो गया, ब्लू कलर सर। एनफ्लोरेन, ऑरेंज कलर। आइसोफ्लोरेन, पर्पल कलर। आइसोफ्लोरेन, पर्पल कलर इज देयर। आइसोफ्लोरेन के लिए पर्पल कलर इज गोइंग टू बी देयर सर। नाउ कैपनोग्राफी, इट इज मेजरिंग द एयर फ्लो सर। एयर फ्लो को मेजर कर रही है कैपनोग्राफी। इंस्पिरेशन, एक्सपिरेशन, अपस्ट्रोक, देन प्लेट्यू फेज विल कम, देन इट विल गो आउट। नाउ इट इज मेजर्ड विद द हेल्प ऑफ कैपनोग्राफी। तो नॉर्मली द रेंज शुड बी बिटवीन योर 35 to 45 mmHg. If the person is hyperventilated, that the person peak will be less than 35. He will be doing less than 35. It will be hyperventilated. Peak will be showing like this. If the person is hypoventilated, he cannot wake up and tell you I am hypoventilated. He will take breath like this. So bigger peaks will come which will exceed the 45 level. 45 level like this you can see. If shark fin pattern is coming, this is typically seen in the COPD. Now when the anesthesia machine is there, sir, what do you need to monitor? Sir, ECG, BP, pulse oxy, capno and temperature. Capno and temperature. BIS monitoring is to check the depth of the anesthesia. BIS monitoring is done to check the depth of the anesthesia. 0 is there, that means coma. 100 is there, matlab fully awake, and 40 to 60, that is you have to maintain during the surgery. Now open circuits में आपके पास open circuit में easy but not use. Why? Because in the same room you are getting the carbon dioxide. If in the same room you are getting the carbon dioxide, there is chances you will get the hypercapnic and you will lose the control. Closed circuit, we have just take example of a Boyle's machine. Now semi-closed circle, which is Mapleson circuits A, B, C, D, E, F, in which E and F are for the pediatrics age group. In this, IRST piece and Jackson-Rees is there. This IST piece is for the premature baby and Jackson-Rees is for the babies less than 6 years. Babies less than 6 years, sir. Okay? Chalo. Now, Magil circuit. Magil circuit is for the spontaneous ventilation. Maggie खाने का मन ऐसे कहता है spontaneously. So Magil is and Bain circle is for the controlled ventilation. Rest BC is not used. BC is not used. Fluid for the surgery. Colloid is a blood product like PRBC, platelet, fresh frozen plasma. Crystalloids are divided into two: isotonic and hypertonic. My dear friends, yes, isotonic is like a normal saline and Ringer lactate. So normal saline and Ringer lactate, if you see, Ringer lactate is a fluid of choice in surgery. Plus it is a fluid of choice in burn patient, fluid of choice in severe dehydration also, sir. Now hypotonic, which do not increase the volume, the example is dextrose 5%, 10%, 25%. Why they are given? They are given specifically when there is a low glycemic index, very low sugar, even 30, 20, 10 sugar होती है, एकदम से हम dextrose 5-10% देते हैं, it improves, patient is saved. Now American Heart Association chain of survival, कि अगर कोई आदमी को हार्ट अटैक हॉस्पिटल में आता है तो क्या स्टेप फॉलो करने हैं, आउटसाइड द हॉस्पिटल आता है तो क्या स्टेप फॉलो करने हैं. दिस क्वेश्चन हैज बीन आस्क्ड इन द एग्जाम माय डियर फ्रेंड्स. यस, so first of all we are talking about the chain of survival in the hospital if cardiac arrest is happening. My dear friends, In the hospital, if it is happening, the first thing is early recognition and prevention, activation of emergency response, high quality CPR, defibrillator, post cardiac arrest care and recovery. Sir, out of hospital, if it is happening, first of all, activation of emergency response. This is what I need to tell you. सबसे पहले emergency response, high quality CPR, defibrillator, advanced resuscitation, post cardiac care and recovery. This chain of survival is slightly different in hospital. अगर आपको कुछ भी नहीं पता चल रहा तो याद रखना, अगर एम्बुलेंस का फोटो दिया है तो ये आउटसाइड है, नहीं दिया है तो ये इनसाइड है. पहला अगर फोन मिलाया जा रहा है तो आउटसाइड है, पहले अगर रिकॉग्नाइज किया जा रहा है दिस इज इनसाइड, दिस इज इनसाइड, दिस इज इनसाइड, इनसाइड, इनसाइड. ACLS का छोटा सा चार्ट है, मॉनिटर करो. ECG शॉक रिदम, अगर रिदमेबल शॉक है तो CPR का साइकिल स्टार्ट कर दो. मीनवाइल ADR एमेड्रॉन दे दो. ADR कितना देना होता है, 3 से 5 मिनट में 1 ml देना होता है. मीनवाइल आपको एमेड्रॉन देना है, एंटी एरिथमिक ड्रग है जो पहले 300 mg देना, फिर 150 mg देना. इफ इट इज नॉट अवेलेबल लिग्नोकेन देना है. If non-shockable rhythm they have, we consider that as asystole, asystole, asystole. I think we are done with the fourth subject also. Now we are left with orthopedics and ENT part. तो आर क्या बोलती है जनता, 10-15 मिनट का ब्रेक लेके आए वापस दोबारा से. टुडे सेशन विल गो मैक्स टू मैक्स 12:30 और 45. वी आर गोइंग टू बाइंड एवरीथिंग. ठीक है. आज की रात ला 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 ला. चलो, we will see each other back at 11:40 is fine. 10 मिनट का ब्रेक is fine. 10 minutes ब्रेक ले करके हम वापस लौटेंगे. See you all lovely guys and girls also. Welcome back, ladies and gentlemen, to the Final Aid Rapid Revision in Chanting Style by the Conceptual Medicine. Please do not forget to follow us on YouTube and Telegram. So, my dear friends, रात हो चुकी है, रात आती है, रात आने दो, नशा होता है, नशा होने दो, हम खोते हैं, हमें खोने दो, हम पढ़ते हैं, हमें पढ़ने दो. Welcome back, welcome back, welcome back. चलिए, let's start with the class, and this class is going to be the orthopedics का class. Sir, orthopedics में if see the bone का part, basic part we are going to talk about. ठीक है, चलो हमें पढ़ने दो. Chalo sir, let's start with the class. Are we ready for the class? And one round of applause for everyone who is sitting very late night up to see each one of you passing, है ना? आप सब यहाँ मौजूद है इस चीज़ के लिए ताकि आप मेहनत कर सके और पास हो सके. एक बहुत ज़्यादा ज़ोरदार तालियां आप सबके लिए. परमात्मा देख रहा है. You all are going to pass the exam, है ना? No matter वो FMG हो, NEET PG हो, NSCT हो, कोई सभी एग्जाम हो, you all are going to pass the exam. Now let's talk about the basic anatomy part right here, sir. Basic anatomy part में यहाँ पे आया epiphysis, फिर आया metaphysis और फिर आया diaphysis. Metaphysis और epiphysis के बीच में आती है सर हमारी growth plate. Growth plate. And this bone is covered by the layer called as periosteum. Periosteum. पेरीओस्टियम. ठीक है साहब, पेरीओस्टियम. पेरीओस्टियम. पेरीओस्टियम का काम क्या है? न्यूट्रिशन वगैरह प्रोवाइड करता है, देखता है, प्लस नर्व एंडिंग्स होती हैं, प्लस यहाँ पे प्रोटेक्टिव फैक्टर्स प्रेजेंट रहते हैं. प्रोटेक्टिव फैक्टर्स प्रेजेंट रहते हैं. सो लेट्स वन बाय वन टॉक अबाउट द इंपॉर्टेंट टर्म्स व्हिच वर आस्क्ड इन द एग्जाम. सो माय डियर लेडीज एंड जेंटलमैन, वेलकम बैक टू द फायर एड बाय कॉन्सेप्चुअल मेडिसिन. ठीक है, पेरीओस्टियम. Periosteum is nothing but an outer covering of the bone. What is the function of periosteum? Protect the bone against tumor and the infection. ठीक है, ट्यूमर और इन्फेक्शन के खिलाफ जो लड़ाई लड़ता है बोन की, that is what sir your periosteum. Periosteum. And next thing is sharpest fiber. What this sharpest? This is bone and this is periosteum. Okay, let's suppose this is periosteum. Now periosteum is connected to the bone with the help of green fiber. This is called as sharp piece fiber, and you know all of the things are made up of type 1. Most abundant collagen in the body is what's a type 1 collagen. Type 1 collagen. Type 1 collagen. So periosteum, outer covering of the bone, protect against tumor and infection. One tumor basically we are going to talk about. ठीक है, ठीक है. Thank you ओमकार. Thank you यार. चल. Now next talk about the osteomalacia. Osteomalacia. Vitamin D deficiency in बच्चा लोग is what sir your rickets. In adult it is osteomalacia. Now what things are you going to see? What is happening? Sir, there is a loosening of the zones in the bone, plus there will be a softening of the bone due to decrease in the minerals. They will look like a fracture, but they are not a fracture. They look like a fracture, but they are not fracture. This is called as pseudo fracture, or in other language we call that as loser's zone. We call that as what sir? Your loser's zone. Loser's zone. Loser's zone. Loser's zone. Done, sir? Now sign and symptom like bone pain, muscle weakness, the patient is going to tell you. On examination you will see the alkaline phosphate. When the alkaline phosphate levels are high, always remember your vitamin D is, the bone demineralization is happening. Vitamin D is less. Alkaline phosphate means the osteoclastic activity is going on, bone resorption is going on more. The bone resorption means bone toot raha hai, so your serum calcium level also will be high in this, sir. Coming to the osteoporosis. Now what is happening in the osteoporosis? My dear friends, in the osteoporosis you will see the bone is porous. The bone is porous. अंदर से खुरदुरी bone है. That is also easily breakable bone. And also on the X-ray, what you are going to see on the vertebra, you are going to see fish mouth vertebra. Fish mouth vertebra. Fish mouth vertebra. So this bone is also prone to easy getting fractures. Now sir, on DEXA score you are going to measure the T score, and here it is less than 2.5 is again another previous year question. Again another previous question. The DEXA score, it is here it is going to be less than minus 2.5. Now osteopetrosis. Now what is happening in the petrosis? Sir, one is osteoclastic activity, one is osteoblastic activities. ऑस्टियोक्लास्ट का काम होता है बोन को तोड़ना और ऑस्टियोब्लास्ट का काम होता है बोन को बनाना. Here in the osteopetrosis, what is happening? The osteoclasts are not working. These osteoclasts are not working. ले भाई, osteoclast is not working. ठीक है, चलो. And osteoblasts, which we are talking about, osteoblasts are working, overworking. And if osteoblasts are working, only bone formation is there. That means more calcium is there. More calcium, more mineralization. That means bone is now looking more white, white like a marble. That is why this is also called as marble bone disease. That is why this is called as marble bone disease also, sir. So if you want to compare right here, sir, you can see right here, sir, this is healthy bone. You can see the cortex are more white and it is less white from the inside part. But here in the osteopetrosis, which is also called as a marble bone disease, here osteoblasts are overworking. Because of that, there is an extra mineralization. Now, my dear friends, because of extra mineralization, this bone is extra hard also. And extra hard things are also easy to break. So this is also getting break down easily, break down easily, break down easily, break down easily. स्वेटर पहन लो, कोई बात नहीं, तुम ना सिल के दे दो अपने हाथ से, मैं पहन लूंगा, पक्का पहनूंगा, ठीक है. Osteogenesis imperfecta. The gene deficiency coli A1, coli A2 genes are then which are getting faulty right here, sir. ठीक है. Now blue sclera, multiple bone fracture, hearing loss, SNHL, sensory neural hearing loss, plus your teeth will be getting what, sir, degenerated, or you can say malocclusion of teeth will be there, sir. Remember, so blue sclera, multiple fracture and hearing loss will be there, sir. हाँ कोई नहीं, तुम गिफ्ट दे देना, मैं वो भी पहन लूंगा, ठीक है. चलो डन. नाउ सर, blue sclera, multiple fracture and your hearing or aid will be there, sir. Done. Osteogenesis imperfecta. ठीक है. Osteogenesis imperfecta. Now coming on to the Paget's disease. Paget's disease. The pathological defect is that it is becoming porous. अंदर से खुरदुरा होता जा रहा है. That is pathology. And most common organism which is affecting the bone is Staphylococcus aureus. Done, sir. चलो. Now, sir, Paget's disease is done. Now, Paget's disease is what? Now the old bone is replaced by the new bone, sir. Old bone is always replaced by the new bone. Now this replacement is getting faulty. So what is happening right here? The disease which deserve with the replacement of old bone with the new bone is Paget's disease. This is what, sir, your Paget's disease. Paget's disease. Paget's disease. ठीक है? हाँ, ENT की क्लास के गिफ्ट ऐसे हैं कि अपने अपने माता पिता से मेरी बात करानी है. मैं उनको रिक्वेस्ट करूंगा कि इनको जूता दिला देना और इनको बैग दिला देना, ठीक है. किसी को प्यालियाँ कप चाहिए थी, किसी को वो दिला देना, तो वो गिफ्ट मैं उस तरीके से रिडीम करने वाला था. मेरी बात आपके मम्मी पापा नहीं टालेंगे तो आपको वो गिफ्ट मिल जाएंगे, बस आपको बात करानी पड़ेगी, ठीक है. चलिए, लेट्स टॉक अबाउट दिस appearance. Now there are the three stages of the Paget's disease. What are the three stages of the Paget's disease, my dear friends? Lytic stage, mixed stage and sclerotic stage. Lytic stage, mixed stage, बर्थडे विश करो भाई, इनको बर्थडे विश करो. हैप्पी बर्थडे टू यू, हैप्पी बर्थडे टू यू, हैप्पी बर्थडे डियर, क्या नाम है, निमरप्रीत कौर. हैप्पी बर्थडे टू यू, मे गॉड ब्लेस यू, मे गॉड ब्लेस यू. ठीक है, अब चलो खुश हो जाओ, ठीक है. चलो my dear friends, here we are having three stages. What are the three stages, my dear friends? Number one is lytic stage, where only bone is breaking down. Where only bone is breaking down. The only bone is breaking down. Breaking down मतलब only clast are working. Mixed stage में bone break and formation है, मतलब clast plus blast both are working. Sclerotic stage में only bone formation, where only blast is working. So here the cotton wool skull is a feature, and cotton wool skull is seen in mixed stage. My dear, cotton wool skull is seen in mixed stage, sir. Mixed stage, sir. And drug of choice for this Paget's disease, again bisphosphonates we are going to give. Other finding in the osteopetrosis, which was marble bone diseases, sandwich vertebra. Sandwich is also white sandwich. Done, sir. Now rugger jersey spine is a feature of hyperparathyroidism, and picture frame vertebra is another feature of Paget's disease. These are the extra finding. Plus in the Paget's disease you are going to see glass blade sign, you can see, or flame sign. Glass blade sign और flame shapes. Glass blade या फिर अग्नि जैसा साइन भी आपको देखने मिलेगा, अग्नि जैसा साइन देखने मिलेगा. डन सर. चलो. Now sir, coming to this achondroplasia, sir. Achondroplasia. It occurs due to the mutation of the fibroblast growth factor. बोन डेंसिटी बढ़ेगी तो फ्रेजाइल ही हो जाएगा ना यार, ज़्यादा कैल्शियम एक्स्ट्रा मिनरलाइजेशन होगा तो वो फ्रेजाइल बोन हो जाएगा. नाउ there is a gene FGFR3, autosomal dominant, most common cause of dwarfism. Now what is happening right here? The trunk is normal but the limbs are short. Plus the hands are like this. This is called as trident hand or starfish like appearance. Trident hand or starfish like appearance. Achondroplasia. Okay. Now sir, on X-ray you are going to see the champion glass pelvis. On X-ray you are going to see the champion. The achondroplasia, most common cause of dwarfism. FGFR3 gene mutation is there. Trunk is normal, limbs are short. Plus हाथ में आपको trident या फिर starfish like appearance देखने मिलेगी. Plus आपका X-ray pelvis पे आपको champion glass pelvis देखने मिलेगा. डन हो गया? डन. चलो. Now sir, osteomyelitis. It is an infection of bone. Sir, 99% of the time in orthopedics, the causative organism is going to be the Staphylococcus aureus. Most common rose is hematogenous. Now this is further divided into two, acute and chronic. Sir, acute and chronic, you will see acute is most commonly seen in the cute कौन है? बच्चे. और most commonly vascular part involved होता है. Most common vascular part in the bone is going to be the metaphysis. So metaphysis is going to be affected. जब ये बहुत ज़्यादा प्रोलॉन्ग्ड हो जाता है, 2-3 महीने ऐसा रहता है, नहीं ट्रीट हो पाता है, आफ्टर दैट व्हाट विल हैपन सर, देयर विल बी अ conversion of acute osteomyelitis to the chronic osteomyelitis. And now along with the new bone you are going to see the dead bone, and dead bone is called as sequestrum and new bone is called as involucrum. तो new bone भी बनने लग जाएगी dead, but out of these two which is a hallmark, सड़ी गली bone, that is called as sequestrum. Done sir? Now coming to the Brodys abscess. Again an infective organism, Staphylococcus is coming. It is causing a pus, and pus is looking grey inside the bone. You can very well see this area, grey area inside the bone is Brodys abscess. Ankylosing spondylitis. Sir, this is an inflammatory arthritis. What is happening? The joint space between the two vertebrae, they are decreasing. So remember, they are decreasing, they are fusing with each other. So they are looking like a bamboo. So remember, here is a bamboo spine. Plus the gene associated right here is HLB27, ankylosing spondylitis. Now coming to the next topic called as bursitis. Before that, some questions are popping for all of you. Please answer the question, sir. Question number 1. Sir, sandwich vertebra is seen in. My first question for all my dear broad-minded medicos. Please. Sandwich vertebra is a feature of. Sandwich vertebra is seen in. My first question. Please answer 2-3 questions and then we are moving forward. Sandwich vertebra is seen in. Sandwich vertebra is seen in. Sandwich vertebra is seen in. Sandwich vertebra is seen in osteopetrosis. Very good. Picture frame vertebra is a feature of. Picture frame vertebra. Picture frame vertebra. Picture frame vertebra. Picture frame vertebra. Paget's disease. Very good. Cotton wool skull is a feature of. Cotton wool skull is a feature of. Cotton wool skull is a feature of. pages. This is very good. Outermost covering of the bone is called as? Outermost covering of the bone called as? Tuheb from Nepal. Thank you. Outermost covering of the bone is called as? Periosteum. It is called as periosteum. 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 And periosteum is connected to the bone with the help of? Periosteum connected to the bone in the form of? With the help of? Periosteum connected with the bone with the help of which fibers? Sharpies. Very, very good. Very, very. All the questions are correct. Now let's talk about this bursitis. What is bursitis? There are fluid-filled pad, and with the age or with the inflammation, this fluid-filled pad degenerate. Because of degeneration, the two structures are now rubbing against each other, and they are causing the pain and inflammation. So remember, what are the different type of bursitis we are having, sir? First of all, housemaid's knee. The housemaid's knee is having pre-patellar bursitis. This is patella, sir. This is patella. अब पटेला से पहले होगा ऊपर की तरफ प्री पटेलर. क्लर्जी मैन हमेशा झुक के नीचे रहता है, नमस्ते करता रहता है. ठीक है, चल सर. इंफ्रा पटेलर बर्साइटिस. स्टूडेंट्स एल्बो, बच्चे हमेशा पढ़ते रहते, पढ़ के यहाँ पे हो जाता है अलिकनान बर्साइटिस. वीवर्स बॉटम, इशियल बर्साइटिस. टेलर में एल आता है, लेटरल बर्साइटिस. लेटरल एपिकॉन्डाइटिस में टेनिस एल्बो. मीडियल एपिकॉन्डाइलिटिस में गोल्फर एल्डो. कल भी पढ़ाया था सर आपको, कल भी पढ़ाया था सर ये बात. अब जरा सा एमसीक्यू का वाइवा दे दीजिए सर. स्टूडेंट एल्बो. स्टूडेंट एल्बो इज अ फीचर ऑफ, स्टूडेंट एल्बो में क्या देखने मिलता है? दिस इज योर प्रीवियस ईयर क्वेश्चन. दिस इज योर प्रीवियस क्वेश्चन वाज आस्क्ड इन द एग्जाम माय डियर फ्रेंड्स. स्टूडेंट्स एल्बो. स्टूडेंट्स एल्बो. ओलिकनॉन. वेरी गुड सर. Lateral epicondylitis, again exam question. Lateral epicondylitis. Lateral epicondylitis. Lateral epicondylitis. Lateral epicondylitis. Laterally will play tennis, sir. Clergyman, sir. Clergyman. Next question is clergyman. Clergyman it is going to be. Clergyman it is going to be. Very nice. Very good. Absolutely correct. Clergyman it is going to be. Clergy. Infrapatellar bursitis. Done and dusted, sir. Let's talk about the dislocation, sir. Sir, according to the shape, according to the organs, you will yourself imagine what type of dislocation is going to happen. Like if you have to hit someone with the shoulder, you will mostly use the anterior side. So most common location of the shoulder dislocation is going to be the anterior side, sir. Elbow you have to hit posteriorly. So posterior side, sir. Hip also from the posterior. Posterior side, sir. Then, sir, knee you'll hit in the anterior side and patella again to the lateral side, sir. So, it is the common dislocation. Now, I'll show you the gender neutral image right here, and you will yourself see that how to check which dislocation is happening. So, this is a gender neutral image. Sir, what is happening right here? Here, your knee is flexed and abducted and externally rotated. So this is Faber, and Faber mnemonic is for anterior dislocation. You can see flexed, abducted and externally rotated. This is Faber, it is for anterior dislocation. So head is coming out, femur head is coming out like this in the anterior side, anterior side. Now this, if you check, this is flexed, adducted and internally rotated, This is called as fader. Fader is for the posterior dislocation. Clear हो गया फंडा? सबको समझ में आ गया? What I try to tell you all. Faber is anterior dislocation and Fader is posterior dislocation. You can write C, sir. Head of the femur is going backwards, sir. Head of the femur is going backwards, sir. Done and dusted, sir. Okay, chaliye. Now let's talk about the syndrome and the nerve injuries. Important syndrome and the nerve injury, sir. If you see right here, sir, Cubital, U for ulnar nerve. Guion canal, ulnar nerve. Carpal tunnel syndrome, median nerve, sir. Tinel test, Fallon, reverse Fallon, all those tests we do for this, sir. Now, fracture healing as a process. First of all, 0 to 2 weeks, hematoma formation is there. 2 to 3 weeks, soft callus, then hard callus, then bone remodeling will happen. 2 महीने से लेके 2 साल तक का टाइम लग जाता है. 2 months to 2 years of time it will take. Now, the basic information you need to add in yourself that parathyroid, what it is doing increase in the serum calcium. How? Dietary and tubular absorption of the calcium. What calcitonin is doing, it is decreasing the serum calcium by blocking the osteoclastic activity, sir. This is just add-on you can do to your brain. Now, fractures, different type of fractures we have to talk about. First of all, open fractures and closed fractures. So, my dear ladies and gentlemen, open and closed fracture is one classification, other is on the basis of the fracture line. If straight line is there, transverse. If linear line is there, linear fracture. Oblique, non-displaced, oblique displaced. Spiral fracture is there, green stick fracture is there, then there will be a comminuted. One more fracture is there when bone is cutted into different segment, that is called a segmented fracture. That is called as what, sir? Segmented fracture, segmented fracture. Now let's talk about the complication. Now I have divided this complication into early and the late complication. My dear friends, early complication if we talk about, पहले क्या होगा? सबसे पहले अगर किसी का एक्सीडेंट होता है तो shock can be hypovolemic shock. Neurogenic shock can happen, sir. Early complication. Plus, very important early complication is fat embolism associated with the long bone fracture, sir. Then this emboli will lodge and go to lungs, from heart to it will go to lung, and the person can die, sir. And the duration of this is what? 48 hours to 72 hours. Within 48 to 72 hours, the person will die. In the deep vein thrombosis, prolonged immobilization is required. In that, at least 6-7 days of time. If prolonged time is mentioned and the patient dies suddenly because of a prolonged bed rest, you will think of a DVT. If within 2 to 3 days the person is suddenly dying, 1 घंटा पहले मरीज बात कर रहा था, 1 घंटे के बाद पेशेंट लुटक लिया, just because of the fat emboli which lodged and going inside the lungs. Third important complication is compartment syndrome. Now what is happening? There is a pain on the dorsiflexion. Why there is a pain on the dorsiflexion and your contracture is like this? This is called as Waxman ischemic contracture. There is a negative pressure under the skin, in the fascia. Because of the negative pressure, there is a necrosis happening. The blood supply is hampered, necrosis is happening. Necrosis is happening, because of that there is an intense pain. Immediately this is a surgical emergency where you will just put an incision and pressure will release. Moment the pressure releases, patient will say you, Dr. Saab, thank you. You are best. So if you want to become best, you need these kind of things in your life, my dear friends. So these are the complications we have divided. Early one is shock, fat embolism and compartment syndrome. Each of them are individual question in themselves only. Now sir, coming to the delayed complication. Delayed complication number 1, if we have to talk about myositis ossificans, where your muscle got trauma, there got a hematoma got calcified. मसल का ट्रॉमा हुआ, ब्लड इकट्ठा हुआ, वहां पे हिमाटोमा बना, हिमाटोमा कैल्सीफाई हो गया, जो एक्सरे पे ऐसा दिखे. तो मोस्ट कॉमन मसल टू गो अंडर दिस मायोसाइटिस ऑसिफिकेंस ब्रेकियालिस. ब्रेकियालिस मसल इज द मोस्ट कॉमन मसल टू गो अंडर दिस, सर. थैंक यू सो मच. ठीक है, चलो. नाउ एवास्कुलर नेक्रोसिस मोस्ट कॉमनली सीन विद द scaphoid, sir. Most common bone to get fracture is also scaphoid. Most common in the carpal bone, it is scaphoid, and avascular necrosis, this is also, sir, scaphoid. Now coming to the malunion and non-union, sir. Malunion means there is a faulty union like this seen with the supracondylar fracture of the humerus, and that is also not an early complication, that is also a delayed complication. Now next is non-union. Now fracture do not unite at all, they are having a gap, and most commonly this is associated with the lateral condylar fracture of the humerus. So these are some early and the delayed complication we have just finished, sir. Now let's talk about all the type of fractures we are having, important type of fracture. First of all, I would love to tell you about the clavicular fracture. So this is the overall most common bone to get fracture. Now this is divided into two. One is unilateral and bilateral, and before that the which site is getting damaged most commonly. So medially this is 3/5 and laterally 2 डंडे होते तो याद रखना 2/5. If unilateral clavicular fracture is there, the treatment is underarm splint, sling बोल दो. If bilateral is there, the treatment is figure of 8 splint. Figure of 8 splint. Figure of 8 splint is there, sir. Most common bone to get fracture overall, site medially 2/3 and laterally 2/5. Clavicle, remember, if unilateral is there, there will be a underarm sling, okay, or bilateral होगा the figure of 8. Now sir, let's talk about the neck of humerus. The nerve injury is axillary nerve. Yesterday only we have talked about abduction खत्म हो जाएगी क्योंकि deltoid को supply कर. इसकी मस्कुलोक्यूटेनियस ब्रांच होती है एक्सिलर नर्व की जो हमारे सेंसरी एरिया को सप्लाई करते हैं. दैट इज व्हाई रेजिमेंटल बैड सेंसरी लॉस विल बी देयर सर. यस्टरडे ओनली वी हैव टॉक अबाउट दिस सर. नाउ नेक shaft of humerus, the nerve gone is radial nerve. What will happen after the radial nerve injury? There is going to be the wrist drop, my dear friends. What treatment you are going to offer such patient? You are going to offer a cock-up splint, my dear friends. What is a non-traumatic cause of a wrist drop? In the forensic medicine we have learned, sir. Non-traumatic cause of a wrist drop, sir. We have in the forensic medicine we have learned that. Can you tell me non-traumatic cause? Sir, lead toxicity, lead toxicity, lead toxicity. Done, done. Now, Colles and Smith are the two fractures which confuses us. So let's us talk about the differences and the similarities. First of all, Colles and Smith, sir, they both are the fracture of distal end of the radius. They both are for the distal end of the radius. Distal end of the radius. ठीक है सर, distal end of the radius. They both are fracture of distal end of the radius. Now the difference is mode of injury and deformities what we are having. Mode of injury, if we see in the Colles, the mode of injury is push falling onto the outstretched hand. In the Colles it is what sir, your flexed hand like this. If you are falling onto the outstretched hand, the displacement is going to be the outward. The displacement is going to be the outward, ठीक है. And if you are falling onto the flexed hand, the displacement is going to be the inward. Plus dinner fork deformity is what you are going to see in the Colles, and garden spades deformity is like this. You can see the hand. This is the feature of Smith fracture. This is a feature of what, sir? Smith fracture. Now coming to the next type of fracture is Barton's fracture. This is again a fracture of distal end of radius. Now this is involving the intra-articular surface. Then scaphoid fracture we were talking about. Sir, scaphoid के अंदर most commonly area affected is anatomical snuff box. Anatomical snuff box के बारे में हम कल बात कर रहे थे. We have talked about the boundaries. We have talked about the content. We have talked about the roof. We have talked about the floor also. Roof and floor also. Now sir, most common carpal bone to get fracture and avascular necrosis में भी जाता है. If there is a scaphoid fracture, which cast you are going to give? That is also a question. That is what sir, your hand holding या फिर glass holding cast. Not hand holding, sorry, glass holding cast is going to be there. Glass holding cast is going to be there, sir. ठीक है, done. Now coming to the Rolando fracture. Rolando fracture, sir. Intra-articular fracture of base of the first metacarpal. You can see right here, sir. Intra-articular fracture of a first metacarpal. And now this fracture is dividing this into multiple fragments. Okay, and detached with the several fragments. This is called as Rolando fracture. Boxer's fracture is on the fifth meta. Boxer boxing कैसे करता है? Fifth metacarpal का fracture. You can very well see, right? Mallet finger. This is not a fracture of a bone. This is a avulsion of an extensor tendon. Tendon is gone. That is why your finger will drop like this. Sir. Then coming. चल, उसके बाद बात करते हैं supracondylar fracture of the humerus. Supracondylar fracture of the humerus we have talked about. Now we have to talk about the most common nerve involved, artery involved, late complication. Sir, in the supracondylar fracture, the nerve involved is amaru, like a damaru. We have to remember here amaru. Anterior interosseous nerve, medial nerve, radial nerve, and ulnar nerve. एग्जामिनर वन से आज अल्नर नहीं दिया था, मीडियल नहीं दिया था, सॉरी एंटीरियर इंट्रोशियस नहीं दिया था, मीडियल रेडियल नहीं दिया था, अल्नर दिया था. योर आंसर इज अल्नर नर्व. योर आंसर इज व्हाट सर? अल्नर नर्व. मोस्ट कॉमन आर्टरी इज ब्रेकियल. एंड इफ यू विल नॉट डू द Dunlop traction यूज होती है इसके लिए. इफ यू आर नॉट अप्लाइंग दैट प्रॉपरली देयर इज गोइंग टू बी द डिलेड कॉम्प्लिकेशन एंड दैट इज गोइंग टू बी द डिशू दैट इज या गन स्टॉक डिफॉर्मिटी. Montesian Galeazzi also confuses us equally, sir. Montesia and Galeazzi also confuses us equally, sir. Now, sir, Montesia is a fracture of ulna and Galeazzi is a fracture of radius. Now, which ulna? Sir, proximal ulna. And which radius? Sir, distal radius. First difference is clear and similarity is clear to all of you. Sir, Montesia is a fracture of proximal 1/3 of ulna. Proximal 1/3 of the ulna, and Galeazzi is a fracture of distal end of radius. Now, distal end of a radius is having a supination pronation joint, that is radio-ulnar joint. तो अगर आपके distal end of radius के साथ आपका radio-ulnar joint is getting dislocated, my dear friends, then you have to answer mark as a Galeazzi. And if only radial head is dislocated along with the ulnar fracture proximal part, the answer is going to be the Montesia. The answer is going to be the Montesia. Now, my dear friends, let's talk about this shoulder dislocation here now. Shoulder dislocation. See, this is a glenoid cavity, and in this glenoid cavity there is a head of humerus. So in the glenoid cavity there is a head of humerus. So anterior side pe, let's talk about anterior side. It is getting dislocated to the anterior side. So when it is dislocated to the anterior side, there is going to be the damage on the glenoid cavity, plus there is going to be the damage on the bone. The bone is looking like a hill. That is why the damage which is happening on the hill is called as hill sag lesion. And glenoid cavity जिसके अंदर banking हो रखी थी bone की, this banking lesion is called as Bankard's lesion. So Bankard's is a lesion on glenoid labrum, and hill sag is a lesion on the posterior part of the humerus, head of the humerus. Now, developmental dysplasia of the hip. Now, your femur is not getting into the acetabular cavity because of the developmental delay. Here we will use a splint called as pelvic harness. The long head of biceps fracture is due to the tendon bicep. टेंडन बाइसेप टूट जाती है, पूरा ब्रेकियालिस मसल एक उसकी तरह यू विल से नींबू की तरह यहाँ पे इकट्ठा हो जाता है. सो दिस इज लॉन्ग हेड ऑफ बाइसेप्स फ्रैक्चर. नाइट स्टिच फ्रैक्चर, आपने कोई डंडा मार रहा, आपने अपना हाथ आगे किया उसको बचाने के लिए, आइसोलेटेड शाफ्ट ऑफ अल्ना इज गेटिंग damaged. Done. Now, Bennett's fracture is a brother of Rolando's fracture. This is again a fracture of intra-articular fracture of a base of thumb. But now, in the Ronaldo, there was several fragments. Here it is single fragment. दो ही टुकड़ों में divide हुआ. पर Rolando multiple टुकड़ों में divide हुआ. This is a difference between Bennett's and the Rolando fracture. Jersey finger. Now, sir, jersey finger में what is happening? There is a rupture of a digitorum profundus tendon. जो मुट्ठी को पूरी बंद करने में हेल्प कर रहा था, उंगलियों को बंद करने में, अब नहीं हो रहा. तो whenever we are clinching that, you will see one finger is not able to close, and that is a affected part because digitorum profundus is gone, sir. Gamekeeper thumb. In gamekeeper thumb, there is no bone injury, but there is an injury to the ulnar collateral ligament. Bumper's fracture. The bumper fracture में there is a fracture of a lateral tibial condyle where fibula is also present. Now, this fracture will lead to foot drop. Why? My question is why? Can anyone answer why this will lead to foot drop? Can anyone answer me? Why this will lead to foot drop? Yes, please. Anyone? Can anyone answer me why this will lead to foot drop, my dear ladies and gentlemen? This is going to foot drop because of the involvement of the common peroneal nerve, which is binding around the neck of fibula, which is binding around the very good Prem Kishore, which is binding very good Medico, which is binding around the neck of fibula. The shaft of femur fracture, there is a gird stride, PNR जिसका निमोनिक हमने बनाया गर्ड स्ट्राइड का. Remember, P for petechial rash, N for neurological abnormalities, R for respiratory distress, and person can die also, that we have talked already, sir. Okay, that we have ऑलरेडी टच, ठीक है। चल, नाउ कमिंग नेक ऑफ फीमर फ्रैक्चर, इंट्रा ट्रॉन्केटिक एक्स्ट्रा नेक ऑफ फीमर फ्रैक्चर, एंड दिस नीड्स अ ओपन रिडक्शन, नेल्स प्लेट्स एटसेट्रा लगा के इसको जोड़ना पड़ता है। Then coming to Salter-Harris classification. Now I ask some 23 fractures I have taught you. I'll ask you some questions from the fracture, sir. Sir, distal end of radius fracture with radio-ulnar joint dislocation. With radio-ulnar joint dislocation. With radio-ulnar joint dislocation. What I am talking about? With the radio-ulnar joint dislocation. What I am talking about? With the radio-ulnar joint dislocation, what I am talking about, sir? Which fracture I am talking about? This is Galeazzi fracture. Very good. Next is, sir, first metacarpal bone getting fracture with multiple fragments. Multiple fragments of the bone is there. Which fracture is this, sir? Which fracture is this, sir? With multiple fragment. Which fracture is this, sir? रोलैंडो। और अगर एक ही सेगमेंट हुआ तो क्या बोलोगे सर इसको? अगर एक ही सेगमेंट हुआ तो क्या बोलोगे? वेरी गुड, कीप ट्राइंग। अगर एक ही सेगमेंट हुआ तो क्या बोलेंगे? Bennett's fracture. Very, very good, sir. Sir, lateral condyle of tibial fracture is? Lateral condyle of tibial fracture is? Lateral condyle of tibial fracture is? Tibia. Lateral condyle of tibia fracture is? Lateral condyle of tibia, यार tibia. Bumper fracture. Bumper fracture. Bumper fracture. Very good. Shalinder, very good. Bumper fracture is going to be there. चलो, let's talk about this Salter-Harris classification now. Sir, growth plate क्या हो गई? जुदा। फिर ग्रोथ प्लेट के ऊपर फ्रैक्चर लाइन कहाँ है? अबव द ग्रोथ प्लेट। फिर ग्रोथ प्लेट के नीचे फिर क्या हो गया? थ्रू द ग्रोथ प्लेट, ऊपर नीचे, फिर दूरियां मिट गई, दैट इज इरेजर ऑफ द ग्रोथ प्लेट। लुट गए सारे नजारे, वाह क्या बात हो गई, तूने काजल लगाया दिन में रात हो गई। Everyone looted the good views of my life, G. You have putted kajal in the eye, and from day 2 it become night. चलो, let's talk about right here, sir. Deformities. Genuvarum and genu valgus. Genuvarum. Genu किसको बोलते हैं? टांगों को, घुटनों को। हिप को क्या बोलते हैं? कॉक्सा। एल्बो को बोलते हैं क्यूबिटस। Let's first talk about the genu. तो जेनुवेरस का मतलब क्या है? बीच में रास्ता प्रेजेंट है। जेनुवेरस मतलब रास्ता प्रेजेंट है। रास्ता प्रेजेंट है अगर जेनुवेरस के बीच में रास्ता प्रेजेंट है तो दिस इज लुकिंग लाइक अ ओ। ओ के साथ में ए लगा दो, ऑस्टियोआर्थराइटिस। जेनुवेरस इज सीन इन ऑस्टियोआर्थराइटिस। ऑस्टियोआर्थराइटिस। यस, आई एम इन लव। ओके, देन सर नॉक नीज। नॉक नीज, नॉक नीज इज जेनुवेलगम। गम मतलब गम की तरह चिपक गया, चिपने का हम हुआ। नाउ दिस इज लुकिंग लाइक अ, दिस इज लुकिंग लाइक अ R. So this condition is associated with rheumatoid arthritis. This condition is associated with rheumatoid arthritis. Rheumatoid arthritis. Then sir, cubitus is, if it is making L, this is valgus, cubitus valgus. If it is joined toward like this, creating some space, that is varus. This is varus. Then coxa angle is also equally important. So normal coxa angle is 120 to 135. If it is lamba angle, long angle, it is coxa valga, chota angle coxa vera, coxa vera, coxa vera. Now swan neck deformity versus the Botnier's deformity. Sir, swan neck deformity, okay, swan neck deformity. Remember what is happening in the swan neck deformity? There is a PIP and there is a DIP. PIP पे flexion और DIP पे extension. DIP पे no. This is Botnier's deformity. This is swan neck deformity. This is swan neck deformity. PIP पे hyperextension and DIP पे flexion हो रहा है. Opposite will happen onto the Botnier's deformity. They both are seen in the rheumatoid arthritis. Rheumatoid arthritis. My dear ladies and gentlemen, now wind sweep deformity, it is seen in rheumatoid arthritis plus rickets. You can very well see because of the demineralization, or you can see the loose bone. The bone is, person is not able to stand straight. There will be deformity like this. This is called as wind sweep deformities. Chali chali fir chali 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 ishq di hawa chali. Now pencil and cup deformity, my dear. Pencil and cup deformity. Remember, it is seen in psoriatic arthritis. You can see ऐसा लग रहा है जैसे ये रहा पेंसिल और ये रहा कप, ये रही पेंसिल, ये रहा कप. ऐसा deformity यहाँ पे देखने मिल रहा है. This is seen in psoriatic arthritis. Sir. Then coming on to the pyogenic. Most common organism Streptococcus aureus, and most common joint involved is knee joint. Now different type of splints we have to talk about. Sir. Chalo. Now splint is used, this Thomas splint is used in femur fracture. Yes. Dennis Brown splint is used in CTEV, that is congenital talipes equinovarus, where your talus bone is standing like this rather than this. Club foot is associated with, कौन सा वाला होता है भाई क्लब फुट के अंदर? कौन सी ट्राइसोमी होती है? कैन यू टेल मी क्लब फुट में कौन सी ट्राइसोमी होती है? दैट इज गोइंग टू बी योर एग्जाम क्वेश्चन माय डियर फ्रेंड्स. That is going to be your exam question, my dear friends. Club foot. Yes, my dear friends. Yes, my dear ladies and gentlemen. Very good. Very nice. Wonderful. Perfect. Wonderful. Perfect. That is going to be the club foot is. Club foot is. Club foot is 30. Edward is 18. Very good. Mermaid splint used in rickets plus treatment of knock knees के treatment में काम आती है. Cock-up splint used in the radial nerve injury. You will see the spring right here. Knuckle bender used in the ulnar nerve injury. Aeroplane splint is used in the brachial plexus injury, and Taylor splint is used for the posture correction. What postural abnormalities we can have? It is your kyphosis and lordosis. इसको correct करने के लिए Taylor brace we use, Taylor splint we use. Milwaukee brace is for the scoliosis. If your spine become S shape like this, to correct it we use a Milwaukee's brace. Milwaukee. Bohler Brown. Again, this splint is a common splint used to immobilize and reduce the lower limb fracture. For the common lower limb fracture. I'll ask you question and you will answer me, sir. The question number 1. Brachial plexus injury. Which splint is used? Sir. Brachial plexus injury, aeroplane splint. Very good. Sir, lower limb fractures, the most common splint we are using is, in the lower limb fractures, the most common splint we are using is, in the lower limb fracture, the most common splint which we are using is Thompson splint. Very good, sir. Sir, ulnar nerve injury, which splint we are using, sir? Ulnar nerve injury, which splint we are using, sir? Ulnar nerve injury के अंदर कौन सी splint use कर रहे हैं? Ulnar nerve injury, we are going to use the, very good, ulnar nerve injury, we are going to use the knuckle bender. Okay, knuckle bender. Very good. Let's now talk about the tractions. This gallows traction or Bryan's traction is used for the shaft of femur fracture. Okay. Russell traction is used for the trochanteric fracture. Dunlop traction, we were talking about supracondylar fracture of the humerus. Can you tell me supracondylar fracture of the humerus will lead to a delayed complication, and what was that? Supracondylar fracture of a humerus will lead to a delayed complication, and what was that, my dear ladies and gentlemen? Supracondylar fracture of a humerus will lead to complication, delayed complication. What is that? Just a simple answer to a simple question, sir. चलो फटाफट से आंसर दे दीजिए. फट 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 फटाफट आंसर दे दीजिए. And that is going to be your gun stock deformity. Gun stock deformity. My dear friends, coming on to the last topic, that is tumors. Second last topic actually, tumors. Osteodyostema is a most common benign tumor of the bone. Proximal femur is most commonly getting involved. Okay. Second things, remember, giant cell tumor. This is also called as osteoclastoma. Okay. Giant cell tumor, GCT, lytic lesion without sclerotic margins. They are forming a soap bubble type of appearance, and the area they are involving the epiphyseal area. Epiphyseal area. Treatment is excision plus bone grafting. Aneurysmal bone cyst. When a bone is covered with a cyst, my dear friend, this is aneurysmal bone cyst. Ewing sarcoma, onion peel appearance you will see, sir. This is Ewing sarcoma. And sir, sunburst appearance or Codman triangle because of the periosteal reaction you are going to see in the osteosarcoma. Osteosarcoma. And osteochondroma is a benign tumor, originate from the metaphysis, sir. Then coming to the enchondroma. Enchondroma, if it is a tumor of the hand originating from the cartilaginous part. If multiple enchondromas are there, this is called as Ollier syndrome. This is called as Ollier syndrome. ठीक है, sir? Now I'll ask some questions and you will answer me, sir. Again, sir. Let's ask question. Question number 1. Onion peel appearance is seen in. Sir, question number 1. Onion peel appearance is seen in. Onion peel appearance is seen in. Onion peel appearance is seen in Ewing sarcoma. Sir, Codman triangle. Codman triangle is seen in. Codman's triangle is seen. Very good. Absolutely. Karthike, Medico, Coffee, Doctor, Anubhav, Shweta, Jalindar. Very good. Archit, Prem Kishore. Very nice. Osteosarcoma. Sir, benign tumor of the bone originating from the metaphysis is. Benign tumor of the bone originating from the metaphysis is. Benign tumor of the bone originating from the metaphysis is. Benign tumor of the bone originating from the metaphysis is. Chondroma. Very good, sir. The tumor which is originating from the cartilaginous part. Cartilaginous part is a tumor which is originating from the cartilaginous part is enchondroma. Enchondroma. Multiple enchondromas are seen in Ollier's disease. Very good. Now let's talk about this gout and pseudo gout, my dear friends. I will be able to fix it like this. Yes. Let's talk about the gout and pseudo gout. Sir, if we talk about the gout, the location is very important. That is first metatarsophalangeal joint. In the pseudo gout, it is going to happen most commonly on the knee joint. Sir, in the gout, the crystal deposited are monosodium urate, which are needle shaped crystals. And in the pseudo gout, there are the rhomboid shaped crystal. Sir, on polarized light, the gout is sounding like a doubt, and having doubt is a negative thing. That is why, remember, negative bifringes. Acute gout treatment is NSAIDs, except aspirin and your PCM. ठीक है, वो granulocytosis वहाँ पे कराती है. Now, what about the chronic gout? Can you tell me treatment of chronic gout? Mostly asked question. The acute में NSAID देने हैं, chronic में क्या देना है? Allopurinol, xanthine oxidase inhibitor. Very good. Now, pseudo gout, you can see pseudo gout. Most commonly you will see the knee joint, calcium pyrophosphate rhomboid crystal, P for pseudogod, P for positive bifringes, and treatment is NSAID. Osteoarthritis versus rheumatoid arthritis. Sir, rheumatoid arthritis is an inflammatory disease. Rheumatoid arthritis is an inflammatory disease, and osteoarthritis is a degenerative disease. Osteoarthritis is a degenerative disease. Most commonly the bone involved is joint involved is a knee joint, my dear friend. Most common site involved is a medial site, my dear friends. Then rheumatoid arthritis, morning stiffness, etc. the patient is complaining of. With this we have completed our fifth subject, and that was our orthopedics. Now my question is, ENT, whether you people will be able to do from our rapid revision which happened on the Dr. G. Banu Prakash, or you want me to complete ENT in 30 minutes, rest of the 30 minutes. All choices, all yours, because you people stood up till now. You're watching it live, so all your decision. You want me to finish rapidly in the 30 minutes, or you want to watch that video? Chalo, now let's complete it. Then 30 minutes more to me. 1 o'clock we will bind this session, all on your request. So complete ही कर देते हैं, ठीक है? तो some things I'll just assume that you people had watched my rapid revision of 5 hours class which happened on Dr. G. Vanu Prakash sir channel. There I have explained each and everything. Now I'll summarize it in the 30 minutes, sir. So here we are going to talk about the nose. Nose is made up of upper lateral cartilages. There are bones also. And here the opening is made up of alar cartilages. And which test we are doing to check the nasal valve blockage? Superior nasal valve blockage, basically we check in this. That test is called as Cotley's test, my dear friends. Saddle nose. Now saddle nose, what is happening? There is a dip on the nose. You can see right here. Most common cause is trauma. Other diseases which can also lead to the damage of a septal bony cartilage and a septal cartilage, they can also contribute to the formation of saddle nose. And if there is a saddle nose, we do the augmentation rhinoplasty. And if question examiner is asking you from where you are taking the graft, your answer is going to be the iliac crest, my dear friend. Next is rolled out edges and exposure to the UV light. I taught you well. Rolled out edges and exposure to the UV light. Yes, this is none other than your rodent ulcer, and which is also called as basal cell carcinoma. Now tell me one thing. This carcinoma metastasize or do not? Your answer is no. They do not metastasize. They do not metastasize. Then coming on to the next one, rhinophyma. There is a sebaceous gland. In the sebaceous gland, there will be a hypertrophy. Because of the hypertrophy, there will be a biggie nose looking like a potato. That is why this is called as potato nose. In this, what you need to do, you need to remove this with the help of CO2 laser excision. Plus, you can put the skin graft also. The foreign body in the nose is a mass. Mostly it is unilateral. Mass is present. Foul smelling discharge is coming outside from that area. Plus minus epistaxis, depends if you are, what type of foreign body it is. Now, you will do an X-ray of nasal spine, AP and lateral view. AP view is sufficient to know, and with the help of endoscope, you will remove it, my dear friends. Myiasis is a maggot formation inside the ear and nose also, and to remove that we use a maggot oil which is made up of chloroform and turpentine. Now nasal bone fracture is there. Now most common bone to get fracture, nasal bone. X-ray lateral spine we are doing right here. We can see the fracture. Now sir, what you will do before the edema start, try to reduce it with the help of a Walsham forceps. And now your question is, why sir, if edema has already started, then what will do? If edema has already started, then you will reduce the edema. You can wait for 5-7 days, and after that you will do the reduction of the bone, my dear friends. Nasal septum fracture, two type of forces we have to talk about. One is force coming from the front, one is force coming from the below. If the force is coming from the front, this is horizontal or Jargeway fracture, and if force is coming from the below, it will lead towards your vertical or Chevallard fracture. Now blowout fracture we have talked about, mid-face fracture. Mid-face fracture of maxilla. First one is transverse fracture, second word is pyramidal fracture, third is craniofacial dysfunction. In both of them you are going to see the CSF rhinorrhea, and in this you are going to see the bleeding ecchymosis on the hard palate, which is called as Guarin sign, Now coming on to the next part, sir. Guarin sign, very good. Now CSF rhinorrhea, the most common cause is idiopathic. Traumatic cause, if we talk about anterior cranial fossa fracture, is the most common cause. Otherwise non-traumatic, most common cause is idiopathic, and in idiopathic second thing is what getting damage is cribriform plate, my dear friends. Now the most common here, how to diagnose it? First of all, clinical test is where you will see a halo sign or target sign. Otherwise, to confirm it whether this is CSF or not, the CSF other than mucoid, how you will differentiate? Mucoid is chipchipa type of appearance, and CSF is continuously running nose. And here your test you are going to perform, the test you are going to perform is beta-2 transferrin estimate. How to find the site of leak? So my dear friend, site of leak you will find with the help of HRCT, and also treatment is conservative. You will ask patient to maintain some positions plus antibiotics so that infection should not go inside the brain. Now paranasal sinuses we have to talk about, my dear friends. Paranasal sinuses are 4 in number. The largest is the maxillary sinus, then followed by sphenoid sinus, ethmoid sinus, and frontal sinus. These are the 4 type of sinus we have to read about. Now this anterior ethmoid air cell is having 2 type of things. One is bulla ethmodalis and agar nasai. Bulla ethmodalis is most constant and the largest air cell. Agar nasai is most anterior air cell. Then posterior ethmoid air cell can then posterior ethmoid air cell is there. Now let's talk about the other thing is sir, middle meatus. It is made up of 3 structures. What are those 3 structures, sir? BUE, bulla ethmodalis, uncinate process, and ethmoid infundibulum. They make a osteometal complex. In the sinusitis, what happens? There will be inflammation, and the causative things can be allergy, can be any bacteria, virus. They can lead to also your inflammation of a mucus that will lead to the closure of the nasal cavity. Now sinusitis is basically closure of the osteometal complex, and if sinusitis is more than 3 months, we call that as chronic. And what are the chief complaints? Nasal discharge will be there, nasal blockage will be there, post nasal drip will be there, बहता नाक आगे की तरफ बहेगा बंद होने की वजह से, और पीछे की मवाद पीछे की तरफ चलेगी, हाइपोस्मिया भी हो सकता है, हेडेक भी हो सकती है इसके अंदर, साइनोसाइटिस के अंदर यस हेडेक का फीचर है ना. नाउ कमिंग टू नेक्स्ट वन. Next one is investigation. In the sinusitis case, Waters view is done. On the 30 degree, this view is done and rays are passed from behind. Only sinus which is not visible here is a sphenoid sinus. For sphenoid sinus, we do a open mouth test, and open mouth is called as Pieris view. Cardwell is not that much used these days. Let's only read about the Waters view. Now CT-PNS is the best investigation. First investigation is X-ray Waters view, but examiner is asking about the best investigation. Then your answer is CT-PNS, paranasal sinus. Now sir, complication of sinusitis, orbital infection, mucocele formation, pot puffy tumor. This all happens. Mucocele formation and pot puffy, they happen in the frontal sinus. So you will see the puffy swelling, you will see duffy swelling over here. It required an operation called as FES. FES stands for functional endoscopic sinus surgery. Now long-term complication of FES is synecdoche formation. For synecdoche formation, endoscopic removal we do. Also we use mitomycin C. The tumor of paranasal sinus, most commonly they are associated with the maxillary, ethmoid, frontal, and the sphenoid sinus. Now what is happening to check the prognosis? There will be Ongren's line. Below that there will be a poor prognosis. Above that there will be a good prognosis. Also there will be a loss of dentation, plus palate can also go. For this we need a surgery called as Weber-Fugerson approach के साथ में total maxillectomy we do, and that approach is called as, most commonly which is used, Weber-Fugerson approach. Now let's talk about the vocal polyp. AC polyp and your ethmoid polyp. AC polyp originate from the middle meatus, from maxillary sinus, and it will go to the posterior choana. It is 1 in number, and here in the ethmoid polyp they are multiple in number. They are multiple in number, and ethmoidal polyps are most commonly seen in the children, and AC polyps are most commonly seen in the adult. AC polyps are most commonly seen in the children, and ethmoid polyps are, which are more in number, they are seen in the adult. For them, the causative organism is allergy. Sometimes that is why corticosteroid we give. If not getting resolved, then we go for the surgery. In the AC polyp, we go for the endoscopic removal. We go for what, sir? Your endoscopic removal. Endoscopic removal, my dear friends. Then coming to this semterstide. Semterstide mein kya hai? Na, that is nasal polyp, asthma and allergy to an NSAID like. Now mucormycosis called by rhizopus or mucor also seen in diabetic young patient. So what is happening? This is angio-invasive fungus. This angio-invasive fungal will do what? It will, through the blood it will come, it will do the thrombosis. Because of thrombosis, what will happen? There will be the blood supply hampered. Blood supply hamper, there will be necrosis. Necrosis की वजह से वहाँ पे black scar formation हो जाएगा, fungal growth हो जाएगी वहाँ पे. And the drug of choice is liposomal amphotericin B plus debridement we have to do. And how to culture it? Local swab लेके culture कर सकते हैं. If it is going to the brain, we will use a MRI. We will use a MRI. Done, done. Coming on to the rhinitis medicamentosa. Now what is happening in the rhinitis medicamentosa? The patient is using the chronic use of decongestant will lead towards a transient vasodilation. पहले constriction हुआ, फिर vasodilation हुआ, जिसकी वजह से inferior turbinate की hypertrophy भी हो गई. Now immediately you need to stop those drops and add the steroid drop, my dear friends. Now deviated nasal septum. What is happening in the deviated nasal septum? On the opposite side there will be the closure, and the side which is getting deviated, the patent side you will talk, there will be a compensatory hypertrophy, plus there is going to be the headache, plus there is going to be the nasal blockage. There is going to be the nasal blockage, और यहाँ पे inferior turbinate की hypertrophy को तो mulberry like mass नजर आने लग जाएगा. Now we'll do a septoplasty and SMR also we can do. Septoplasty is only correction of the deviated part, and SMR is a correction of deviated part along with all of the septum, whether it is bony septum, whether it is cartilaginous septum. Now sir, septal hematoma also the treatment is incision and drainage. If you will not do, there will be a septal perforation. For that treatment is button, you will put it right there, sir. Now coming to septal perforation के other causes other than the surgery, sir, it is divided into cartilaginous part and the bony part. Cartilaginous part is getting fractured because of the TB, lupus, leprosy, and bony part is getting damaged because of the tertiary syphilis. Who is damaging both? Then the boss is coming, that is your Wegener's granulomatosis. Wegener's granulomatosis. Done. Atrophic rhinitis. Now what is happening in the atrophic rhinitis? The causative organism like Klebsiella oozina is coming, because of which there will be a mucosa atrophy. Mucosal atrophy is there. Because of that mucosal atrophy, their bone is also getting atrophied, and there is a crust like material which is getting deposited in the nose. Because of that, there will be a foul smell which is coming out to other person, but that person is not having that smell. This is called as merciful anosmia. For such patient, we do a alkaline nasal douching, and if douching is not working, we do a young suppression, modified young, in which we will temporarily close the nasal cavity so that the nasal mucosa can heal, and again the mucus secretion will happen, and this crusting must go on. Then coming to the rhinoscleroma. Rhinoscleroma is caused by Klebsiella rhinoscleromatis. This is caused by Klebsiella rhinos. This is most commonly seen. Which bodies you are going to see? Russell body and Miculi cell you are going to see. Now there is nodular stage, fibrotic stage, then granulomatous stage is there. Nasal deformity is most commonly seen with the fibrotic stage. The tetracycline and streptomycin. The drugs which give is tetracycline and streptomycin. Now rhinosporidiosis, this is protozoal infection caused in the pond, especially in the Tamil Nadu side. Males are most affected. This protozoa goes inside the nose, and there will be a mulberry like appearance. Once we touch that, there will be a bleeding. Here we'll do the electrocautery of the base plus dapsone prevent it from reoccurrence. Done. Then coming to the epistaxis, most common area of the epistaxis is Little's area. What is Little's area? It is the anterior inferior quadrant of the nose, and there is an artery of epistaxis which is called as what, sir? Sphenopalatine artery. The artery of epistaxis is sphenopalatine artery. Now coming to the Achilles dehiscence, it is present in the inferior constrictor muscle. It is a muscular weakness from where the outpouching can happen, that is called as Zenker's diverticulum. Laryngopharynx, which is also called as hypopharynx, my dear friend. Three important structure, three P's you have to remember here. P1 is pyriform sinus, then there will be post-cricoid area, then posterior pharyngeal wall. The most common site of hypopharyngeal malignancy is going to be your pyriform sinus, and sign you are going to see is absence of laryngeal crepitus, that is going to be the Muri sign, my dear friends, Muri sign. Now nasopharynx is having two landmark, one is what, sir, your adenoid, another is your eustachian tube opening. They both are. Now where is this adenoid? This is adenoid as the roof of the nasopharynx, and it is near to the choana. Now this is a collection of a lymphoid tissue which is now stopping the which is a part of Walde's ring and stopping infection to happen. Now they are feeling, if you will palpate them per oral, they will feel like bag of worm. They are present by birth, grows up to 6 years, and at the time of puberty they start regressing, and by the 20 years of age they will disappear. But there are some time when these adenoids become enlarged and they become the problem, and that problem is most commonly encountered with the school going children, where recurrent URTI, upper respiratory tract infection is a risk factor, and because of that there will be hypertrophy. The patient will be having a adenoid faces. What is adenoid faces? Pinch nose, open mouth, then there will be a high palate, plus there will be a hyporesonate voice, that means nose is closed, the patient will be speaking like a oh, okay. Then there will be a glue ear because of eustachian tube blockage. The adenoid hypertrophy will lead to eustachian tube blockage. Because of that there will be a glue ear, my dear friend, and also that person might be feeling not to eat, failure of thrive will be there, also not able to sleep properly, obstructive sleep. And treatment to adenoid hypertrophy, we do adenoidectomy we do in the adenoid hypertrophy in the extensor, this is Rose position, and there will be a subluxation of atlantoaxial joint. Now coming to the angiofibroma, sir. Angiofibroma is a benign tumor of the nasopharynx. Originating site is in sphenopalatine foramen, highly vascular, that is why biopsy contraindicated. Hallman-Miller sign or antral sign is there, where posterior maxillary wall is pushed outward. Here also angioembolization we do, and after that we'll do the surgery. Nasopharyngeal carcinoma, the Epstein-Barr virus is a causative organism plus genetic predisposition associated with the HLA-B27. Site of origin is a fossa of Rosen-Miller, and most common age is going to be the 52. That is okay. Now NPC is a hidden cancer. How the first symptom you are going to see? Lymphadenopathy. Which lymph nodes are getting enlarged first? Jugulodigastric nerve. There is a triad called as Trotter's triad in the NPC, and that is that Trotter's triad, my dear friends. Neuralgic pain, palatal palsy, and conductive hearing loss. As this is a cancer, cancers are mostly unilateral, that is why unilateral conductive hearing loss will be there. Treatment, chemoradiation is better answer than the radiotherapy. Then we are going to the oropharynx, where tonsil is there. Tonsil, there is a palatal tonsil present between anterior and posterior tonsil. Here the tonsil is having crypt, having blood supply, and having the capsule. This, sir, remember the tonsillar blood supply mainly is by tonsillar branch of the facial artery, and drainage with the paratonsillar vein. Now mostly the question which is asked in the exam is about the tonsillectomy method. Most common method is dissection and snare method. Remember what are the complications which can happen, my dear friends? That is your primary, reactionary, and secondary. Primary is during the surgery, reactionary is within 24 hours, slippage of ligature or slough formation is not there. Then secondary, we can do more than 5 days, there will be infection, IV antibiotics we have to give, sir. Now coming on to the quinsy. What is quinsy, sir? Quinsy is a peritonsillar abscess, which is a collection of pus between tonsil and its beds. You will push other side, tonsil push medially. Yes, there is going to be throat pain, dysphagia is going to be there, trismus is going to be there, hot potato voice is going to be there, but outer neck swelling is absent. If all the features are like quinsy and outer neck swelling is present, then your answer is going to be the parapharyngeal abscess, my dear friends. Then coming to Ludwig angina, flora mouth, dental caries की वजह से infection होगी. Most common muscle involved with mylohyoid muscle, and the area involved with submandibular, submental. These areas are involved. Okay. Now there will be if this swelling is growing too large, there will be a hot potato voice, there will be trismus, throat pain, respiratory difficulties will be there, and normally we give the antibiotics plus external incision and drainage we do, and if it is severe obstructing your airways, then you have to go for tracheostomy also, my dear friends. Now coming to the larynx. Larynx is a voice box. It is covered by 3 cartilages, 3 paired and 3 unpaired. Paired are just rudimentary, they went. Unpaired cartilages are important. What are 3 unpaired cartilages? We talk about thyroid cartilage is like an open book. In a male it is making 90-degree angle, in female it is making 120-degree angle. And remember, it is making the Adam's apple, my dear friend. Cricoid cartilage is ring-like, and epiglottis, if we talk about, it is leaf-like, cover the vocal cord. Now keratosis larynx. What is happening? The pseudo-certified squamous layer is covered by the keratin cells. Keratin cell, it is looking more white. On the video laryngoscopy, we'll check what is the cause for that. Chronic irritation, and irritation because of suttebaji, irritation because of drinking, irritation because of chronic allergies also. In that condition, we do the stripping off. Whatever keratin layer is deposited there, we will remove it and we will use the CO2 laser chordectomy we will do. And hoarseness of voice is a feature which will be the alarming sign, because of which we will do the further investigation. Now coming on to the puerphonia, endophomia, we all know. Sir, now coming to the enlarged saccule, which is called as laryngocele. Moment the patient is doing Valsalva, you will see there is a the dilation of the sac right here, dilation of the saccule right here, and this is most commonly seen with the trumpet blowers, trumpet blower. Now coming to the next one, sir. Next important thing we have to talk about, vocal polyp versus vocal nodule. Vocal nodule is a bilateral condition, vocal polyp is a unilateral condition. But treatment is vocal nodule is voice rest. In the vocal polyp, the treatment is microlaryngeal surgery. Microlaryngeal surgery. Now we talk about the intubation granuloma, faulty granuloma happening on the posterior 2/3. Vocal nodule and polyp, they are happening on the anterior 1/3. But intubation granuloma is happening on the posterior 2/3. And here the treatment is microlaryngeal surgery, like the vocal nodule. Now coming to the ring case edema, there is a ring case space in which, because of the permeability increase, there is a fluid filled in that, and because of which there will be the hoarseness of voice you will going to see. Treatment is quit smoking, voice rest plus stripping of vocal cord mucosa, and again the irritation to the vocal cord is happening right there. Juvenile papilloma is a vertical infection causing from mother to the child, and remember HPV 6 and 11, young child 3 to 6 years, child with the hoarseness of voice with the respiratory difficulty. In this also we do the MLS, that is microlaryngeal surgery, along with the CO2 laser. Now coming to the stridor, we got 3 type of stridor we have studied, my dear friends. Remember, inspiratory, biphasic. Inspiratory stridor is a stridor happening when there is the topmost structure is involved, that is your supraglottis. In the biphasic, sir, there is going to be the 2 glottic and subglottic, and the expiratory, there is going to be lungs which are involved in this, thoracic and trachea is involved. Now functional aphonia, our fake female is coming saying you are not, I'm not able to speak, and in that a cough reflex is present. Laryngomalacia, the weakness of supraglottis there is there. The laryngomalacia, weakness of supraglottis there is an inspiratory stridor because of the weak supraglottis. There is going to be an inspiratory stridor. You just have to, mother is going to say, typical case, mother will say, मेरा बच्चा रोता है सर, उसके बाद में इसको स्टाइडर बढ़ता है, सर ने बोला है रीएश्योर 12 से 18 महीने लगेंगे, ठीक हो जाएगा. नाउ कमिंग टू द मसल्स ऑफ द लैरिंक्स, टेंसर में कौन कौन सा, वोकैलिस मेन मसल है, एडक्टर के अंदर इंट्रा थायरोएटिनॉइड. ये इंट्रा और थायरोएटिनॉइड अगर आपका ढंग से काम नहीं करता है, देयर इज अ डिजीज, देयर इज अ एबनॉर्मल joining of this 2 vocal cord. This is called as phonesthenia. This condition is called as what, sir? Phonesthenia. Now coming to the bilateral and unilateral abductor palsy, bilateral abductor and bilateral adductor palsy. Bilateral abductor palsy, you are not able to open. You are not able to open. That means voice is normal plus respiratory difficulties there. In this you will do type 2 thyroplasty. In bilateral adductor palsy, your vocal cords are like this. That means aphonia is there, respiratory difficulty is not there, but aspiration ke chance hai. In this you will do type 1 thyroplasty, type 1 thyro. In the pediatric infection, 2 infections you have to remember mostly right here, sir. One is your acute epiglottis. Acute epiglottis is because of strep pneumonia, most common than H. influenzae, and here you will see the thumb sign in the acute laryngotracheobronchitis. Basically there will be a barking cough present, right, and tripod sign is a part of acute epiglottis. Here you are going to see the steeple sign. As there is a respiratory difficulty, the first approach is going to be the manage the airway. Done. Then laryngeal and bronchial foreign body, immediately you have to intervene and remove them. TB larynx had 2 signs, turbine epiglottis and mouse nibble appearance. Then glottic cancer, we were talking about staging. T1, 1 structure involved, T1, T2 is more than 1 structure involved, T3 is vocal cord is fixed, 4 is invasion. For this, the treatment for T3 and T4 is total laryngectomy. What is the mode of voice production after the total laryngectomy? One is your electrolarynx and another is your tracheoesophageal puncture device. This is Bloom's finger prosthesis. How it works? Once you will put finger on the trachea, the opening which you will see right there, then only you will be able to produce the voice. Otherwise, the air will go from esophagus. Otherwise, air will come from this hole only. If you close this, air will come from the esophagus, and there will be esophagus voice production. Esophageal voice production. Then tracheostomy. In the glottic cancer, we are doing in the high tracheostomy. That was once asked in the exam. That is first and second ring, and most commonly we are doing between second and third ring. And most common tracheostomy tube which we are using is PVC Portex tube. Indication of tracheostomy also we have studied. More than 7 days plus any kind of maxillofacial trauma is there. In all those scenarios, we do the tracheostomy. Now let's talk about the next topic, and that is called as what, sir? Your ear. Ear is developed from first and second arch. There are 6 hillock of it. They fuse together to form a pinna, my dear friends. And now the tympanic membrane, if you see, tympanic membrane having a landmark, that is lateral process of malleus and umbo. From there the cone of light is there. This is making a 55-degree angle. 2 important parts are there. One is pars tensa and one is pars flaccida. This tympanic membrane is made up of all 3: ectoderm, endoderm and mesoderm. Then 3 ossicles are important in case of your ear. Those are malleus, incus and stapes, out of which malleus and incus are made from first arch and stapes is made from the second arch, my dear friends. Now bat ear, if antihelix is absent, that will lead to a condition called as bat ear. Congenital disorder of pinna, number 1 is very important: preauricular sinus, sir. Preauricular sinus is an incomplete fusion of first and second arch. Sir, if asymptomatic, no treatment, nothing. If symptomatic, you have to release the tract. Development of pinna defect, microtia and anotia. Anotia matlab absence of the pinna, micromecia matlab small pinna. Now coming to the Darwin tubercle, is a conical appearance on the helix. Now boxers or cauliflower ear, because of the boxing, what will happen? There will be a hematoma formation because the cartilaginous and the skin of the pinna skin, sir. There is and it will lead to the necrosis of the pinna if you will not remove. So treatment is incision and drainage. If wax is present, up to 30 decibels of hearing loss will be there. Now diseases of external auditory nerve, first of all localized otitis externa, which is also called as furunculosis. ये एक बाल की इन्फेक्शन होती है, स्टेफाइलोकोकस के द्वारा होती है. ट्रीटमेंट में हम इसके इक्थामामोल ग्लिसरीन यूज करते हैं क्योंकि इसका एंटी बैक्टीरियल, एंटी इन्फ्लेमेटरी एक्शन भी होता है. दैट इज व्हाई इक्थामामोल ग्लिसरीन इज मोस्ट कॉमन. मैलिग्नेंट ओटाइटिस एक्सटर्ना का दूसरा नाम है अपना स्कल बेस ऑस्टियोमाइलाइटिस. ये बोनी ईएसी की होती है. इसमें पेशेंट मोस्टली क्या है, प्रीडिस्पोजिंग फैक्टर यू विल सी सीन इन ओल्ड एंड डायबिटिक पेशेंट. तो ट्रीटमेंट के अंदर एक तो आपने क्या कर दिया, 3rd जनरेशन सेफेलोस्पोरिन जो कि बैक्टीरियल कॉज के लिए दे दी, और साथ में यू आर कंट्रोलिंग द डायबिटिक ऑल्सो, यू आर कंट्रोलिंग द डायबिटीज ऑल्सो. ऑटोमोइकोसिस, फंगल इन्फेक्शन कैन बी कॉज एस्परजिलस नाइगर, ब्लैक कलर के स्पोर्स देगा. कैंडिडा अल्बिकन व्हाइट कलर के पोर्स देगा. कॉजिटिव फैक्टर क्या है, ह्यूमिड एनवायरनमेंट की वजह से होता है. ट्रीटमेंट में क्या करेंगे, सक्शन करेंगे, उसको बाहर निकालेंगे, प्लस टॉपिकल एंटी फंगल एजेंट वी कैन यूज. व्हाई वी कैन नॉट यूज द सिस्टमिक, बिकॉज दिस इज नॉन इन्वेजिव फंगस. दिस इज व्हाट सर, नॉन इन्वेजिव फंगल. नाउ डू टॉक अबाउट द यूस्टेशियन ट्यूब. काम क्या होता है, मिडल ईयर वेंटिलेशन का काम होता है, मिडल ईयर सिक्रीशन को बाहर निकालना काम होता है. अगर ये ब्लॉक हो जाए तो मिडल ईयर की सिक्रीशन विल रिमेन इन द मिडल ईयर ओनली. फॉर दैट पर्पस वी डू a treatment called as grommet incision. We put a grommet in the anterior and inferior quadrant, and after some days we'll see this grommet will automatically come outside and the patient will be relieved, my sin. That traumatic perforation done middle cleft. Middle ear diseases में सबसे पहले बात करेंगे ASOM. If we talk about the ASOM, Streptococcus pneumoniae is a cause. 5 stages of ASOM you are going to see: tubal occlusion, pre-suppuration, suppuration, stage of resolution and complication. Cartwheel sign is seen in stage 2 and pus discharge will come in stage of resolution. If stage of resolution is not treated, it will lead to the stage of complication, and stage of complication is going to be the safe CSOM. So there is a difference between safe and unsafe CSOM. Unsafe CSOM and safe CSOM discharge. If ज़्यादा भर के discharge आ रहा है, perfuse discharge is coming, thing, my dear friends, that is going to be the safe CSOM. If scanty discharge, some small amount of discharge, that is unsafe. Blood stain hai, foul smelling hai, unsafe hai. And if it is not blood stain, not foul smelling, that is going to. Plus, if central perforation is there in the pars tensa, then you will think of a safe. If there is a perforation in the attic part, and then you have to think of a unsafe. The unsafe can lead to cholesteatoma also, which is a bone eating thing which will eat you. For that, different surgeries approach are needed. And if only your tympanic membrane is damaged, you will do a simple tympanoplasty, which is also called as Maringoplasty, which is also called as Maringoplasty. This is unsafe CSM we were talking about. There is a one very famous theory about the cholesteatoma, that is a retraction pocket theory. First there will be retraction, then there will be a destruction, then there will be a squamous metaplasia. From squamous cells will go inside the middle ear. There the keratin will also come. Squamous and keratin plugs will be made, which is called as cholesteatoma. They will be eating. Now there are complications of cholesteatoma, unsafe CSM. If we talk about that will be your intracranial and extracranial complication. The different type of intracranial and extracranial complication is going to be, my dear friends, and those include brain abscess, EDH, SDH. These are going intracranial, and petrositis and sigmoid sinus thrombosis. These are going to be the extra cranial complication. Now, sir, we are going to talk about okay, acute mastocytitis, done. Now let's talk about the fluid in the inner ear. Fluid in the inner ear is endolymph and the perilymph. Endolymph is secreted from stria vascularis, and perilymph is also a CSF which is secreted from the aqueduct of cochlea. Now basal turns are 2/3 turns are there. Upper one is for low frequency, lower is for high frequency. Again a question asked in the exam. Now benign positional vertigo, what is happening? There are two things, utricle and saccule. They are having sensory end organ called as macula, and once the patient is moving this that, he is having vertigo. For that, diagnosis is Dix-Hallpike maneuver and treatment is Apley's maneuver. So then coming to the audiology में conductive hearing loss and sensory hearing. If the problem is still the middle ear, it is conductive hearing loss. If it is in the inner ear, that is going to be associated with the sensory neural hearing loss. Tunic 4 test की बात कर रहे थे sir. First of all, Reynolds test we do in the 256, 512, 104, 256, 104, 256 and 1028. Okay, now sir, if Reynolds test, how to perform a Reynolds test? If you're doing Reynolds test and you are asking your patient आगे से ज़्यादा, that is air conduction, पीछे से ज़्यादा, that is bone conduction. If your patient is saying sir आगे से ज़्यादा सुनाई दे रहा है, that means there will be a normal ear or possibility of a SNHL. If your patient is saying नहीं डॉक्टर साहब मुझे पीछे से ज़्यादा सुना रहा है, that means bone conduction is more than air conduction, and that will suggest you of what's your conductive hearing loss. Now Weber test, I'll just put it here, and if patient is saying कि centralized है, that means normal. अगर बोलेगा इस तरफ problem थी, इसी तरफ जा रहा, that means conductive hearing loss. अगर प्रॉब्लम इस तरफ है और जा रहा दूसरी तरफ, that means there is a sensory neural hearing loss. That means there is a sensory. Then other ABC test is there, which is done by occluding the ear canal. We ask the patient to raise hand when he is not able to listen, and same we put on R also. If we are able to listen, that means normal or conductive hearing loss. If we are not able to listen, that means this is sensory neural hearing loss. Sensory neural. Now special dips are there. Two dips are there. One is 2000, one is 4000. 2000 is called as Cart's notch. 4000 is Bowler's notch is there, and 2000 is because of otosclerosis. 4000 is because of the sensory neural hearing loss, that is noise induced hearing loss. Presbycusis and Meniere's. Presbycusis both are SNHL. Presbycusis high frequency SNHL, Meniere's is low frequency SNHL. And presbycusis is a bilateral, Meniere's is a unilateral. In presbycusis you are going to see the sloping audiogram, in the Meniere's you are going to see the rising audiogram. Bira has 7 waves, छोटे बच्चों में काम होता है, थोड़ा सा एक्सपेंसिव होता है, 5th wave is important होता है. OE इलेक्ट्रोड से वो बिरा जो है वो ब्रेन स्टेम से रिकॉर्ड करता है. OE is recording from the cochlea, and this is cheaper test as compared. Now impedance audiometry, if we talk about, this is comparison of the air and reaction of tympanic membrane and ossicle to that air. That is called as compliance. Sir, if compliance is normal, the curve N will come. If glue ear is there, no compliance, the curve will come flat. If there is a eustachian tube function, there will be a negative pressure. Because of that, the curve will be shifted to the negative side. If there is a otosclerosis, there will be a reduced compliance. Because of reduced compliance, the small curve is going to come. And if there is an increase in compliance, which is seen in the ossicular dislocation, there will be a non-joining line which will look like a volcano mountain. Sir. Now coming to the autosclerosis. Autosclerosis is a fixation of foot plate of stapes, and remember here short sign if it is present, the treatment is sodium fluoride. If short sign is not present there, then stepidotomy we do. Stepidotomy से स्टेपिडक्टमी में क्या अंतर होता है? स्टेपिडक्टमी में हम थोड़ा सा छेद करते हैं स्टेपिस के फुट प्लेट में ताकि वो मोबाइल हो जाए, नहीं हो तो अलग से एक फेनेस्ट्रेशन बनाते हैं. Acoustic neuroma is a tumor of the eighth nerve. On MRI, gadolinium enhanced MRI, you are going to see the ice cream in cone appearance, and this is associated neurofibroma type 2. Surgical excision is glomus jugulare is a tumor of jugular bulb which is situated on the floor of the middle ear. Here you will see a brown sign, redness, red mass blanches on sigillization. Once you are putting a pressure or you can doing a Valsalva, you will see the red mass which is coming out. It will do the sigillization, and this mass is coming out like a rising sun. This is what called a rising sun sign. And on CT you will see a Phelps sign, my dear friends. Now Meniere disease is an episodic disease. It is a ear fullness, might be seen, not be seen, and remember this is also called as glaucoma of the ear. Glaucoma of the ear. The phenomena are like recurrent teleos and diplagos. Recurrent is loud sound, here more loud. Teleo में कभी कभी चक्कर आ जाता है जोर से चिल्लाने में. Diplagos में same sound is heard at the two frequencies. Here the treatment is first of all your medical management. If it fails, endolymphatic decompression surgery we do, and if it still fails, we would do transtympanic injection of the gentamicin. Bell's palsy and Ramsay-Hunt syndrome we have discussed already. Ear implant, hearing aid less than 90 पे काम करते हैं. If your eighth nerve is fine, then you will go for the cochlear implant. If your eighth nerve is not fine, you will go for the brainstem implant. If there is a canal stenosis or there is a anoxia, this is absent, then we put a BAHA, that is bone anchored hearing aid. In this which we are doing, we are conducting the bone energy directly to the inner ear. Bone energy directly to the inner. This is classification of deafness, and here we have completed day 2 fire aid with your Dr. Paras on our clinic conceptual medicine channel. Thank you so much. So this is a way we can do in a short time also. Same class we took at least 5 hours to complete, explained everything. That time explained, this time made you learn and told you what are the important topics we have to do. Please download the PDF annotated one from the Telegram channel. We are having a link also. May God bless you all. With this thing, if we'll work more hard, no one is going to stop us. हम होंगे कामयाब, हम होंगे कामयाब, हम होंगे कामयाब एक दिन. ओहो मन में है विश्वास, हमें पूरा है विश्वास, हम होंगे कामयाब एक दिन. May God bless you all. Thank you so much. जय हिंद, जय भारत. और कल मिलते हैं 2 बजे, 2 o'clock, third day, 2 o'clock. Again 6-7 subjects we are going to complete. 3 days, 19 subjects. We are going to pass. Keep saying I will pass, I will pass. जय हिंद, जय भारत, शुभ रात्रि.